meeting.
Okay, great. Thank you. Okay, good morning and welcome to the December 8th meeting of the Humboldt County Board of Supervisors. I now would like to ask you to join me in a salute to the flag before we get started here. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everybody. And next I go, good morning, CEO Nielsen. Are there any modifications to the agenda?
Good morning, Chair Fennell. Yes, there's one modification to the agenda. Supervisor Madrone is pulling item C27 for discussion.
C27, okay, thank you. With that, we will go to the consent calendar. And any discussion, or is there a motion on the consent calendar?
Through the chair.
Good, yes, good morning, Rex.
I would like to recognize, I know we have an issue with our homelessness and everything's being done, but there's almost $1 million being spent with our CADA House Partnership, who's, from what I hear, is one of our great partners in trying to solve this. So I just wanted to recognize that the efforts that DHA just made as reaching out with partners trying to solve this grave issue. So I just thought, we hear so much we're not doing anything, and I think we should recognize when we do something. So thank you.
Thank you, Supervisor Bohn. Anyone else or a motion?
I was trying to make a motion to pass the consent.
Go ahead, Supervisor Bass.
I was making a motion to approve the consent calendar, but I do see Supervisor Madrone had his arm up, so it's still a motion.
Without C27, right?
That's with the modification. Yes, thank you.
Yeah, great, thank you. Is there a second for that?
I'll second.
Okay, Supervisor Madrone, good morning.
Good morning, everyone. I just wanted to recognize Vernon Price and thank him so much for his service on the Behavioral Health Board and in everything homelessness in trying to help all of our communities. So thank you so much, Vernon.
Thank you, Supervisor Madrone. So we have a motion and a second to go to public comment on the consent calendar. I believe we have at least, yes, we do. So please press *9 to be on. There are two people who've done that already. And we'll go to 7454. If you can please press *6.
Estelle, yes, this is Ken Swatsky. I did want to say the flag salute went much better with just you reading it rather than having kind of a chorus there of not jointed comments or reading of that. So I approve that. I did wish to make comment on one item, or a few items here on consent. I would like to echo what Supervisor Steve Madrone did regarding Vernon Price. It's always been a pleasure working with him in the room when I did, but before COVID here. And he's a great asset to our community. I also wish to make comment on the special meeting action summary. I believe that's item 6. That was a very long meeting. I felt I would say maybe the wrong message was sent, but my feeling was hopefully the Auditor Controller will just continue to do what she does and continue working rather than facing 7 hours of this kind of a situation and having your staff on there. She was chastised for them also watching. And so I hope they just all stay to work today and just do what they do. And I think that was the direction that was made under that as my outtake from that. I also noticed we have a consent item for, I believe, 19 for a new health officer. I'm glad we have someone in that particular seat. I think it would be most beneficial if that health officer would always have that dashboard handy. Hopefully that person will do that, or a hard copy handy, because that's a very hard thing for me or other people to understand. And I don't expect them to memorize these. I don't expect them to memorize that particular topic as far as the dashboard, but they should have it handy to answer our questions. That would be greatly appreciated. So I think the other thing that should be noted is the employees get an extra day holiday, I guess, this year. That was in the past. December 24th, I think, is item 22. And so I hope they appreciate when a lot of people are out working, they get an extra day to make that a 4-day weekend or whatever it comes out to be. Thank you for my opportunity to speak on consent items.
Thank you, Kent. We have also somebody who's listed as a call-in user. If you would press *6, you can come into the conversation. Welcome.
Good morning, Madam Chair, ladies and gentlemen of the board, Madam CAO, County Council, ladies and gentlemen of Humboldt County. This is Vernon Price. I would like to thank you so much for the letter of appreciation of serving our community and those most vulnerable in our community. And thank you so much, Supervisor Madrone and the other gentlemen, of your very kind words from the heart. It is to my deepest regret of giving my resignation of multiple reasons, but I have now accepted as of 8 o'clock this morning, been approved as an executive board member of Cal Voices, a state organization that is run for peers, by peers, concerning homelessness and mental health. That is the parent organization of Access California, which I am a Superior Regional Ambassador for the Northern region of California. Again, I would like to thank you from the heart of giving me a letter of appreciation. Again, it has been an honor and a privilege to serve the people in our community. But there are some concerns that really needs to be addressed of peer involvement in our behavioral health board and other county commissions and boards. And that was, I won't rehash or beat a dead horse. January 28th of this year, I submitted a letter of a formal grievance in regards to, how a consumer was spoken to or with by, county executive staff. That has not been addressed. And this is an ongoing concern of those of us that are consumers or former consumers of our community that are spoken to instead of with. So please let us keep that in mind as we move forward, improving the quality of life, building a stronger community, and a more vibrant county that we all reside in. And again, from my heart, I want to thank you all. Thank you for your time and your concern.
Thank you very much, Fern. There is another public comment with the last 4 digits of 0150. If you could please press *6, you can speak on the consent calendar. Welcome.
Good morning. Good morning. This is Dottie Russell, and I'm calling on behalf of Southern Humboldt and the lack of services for homeless people that we've had for several years since the adoption of the 2005 Ending Homelessness Within 10 Years. So I want to just say that there are individuals that have been homeless for years and years and years. One individual that's homeless has a violation right now going because of creating a nuisance. The county has not paid for his incarceration many times because he was able to get off the main street, which was decided on not by Estelle. So I don't want to, pin her on this one. But at the opening of the planning department in Redway, it was mentioned that one of the biggest problems was that this individual was collecting things and creating a nuisance on the main street. He had broken into the Christian Science Church, and that had a fire because prior homeless people had broken into it. And so he had broken into the church and was collecting things there instead of the main street. A number of people that lived in and worked in the community said if he could just be off the main street, we could start helping to get him disability and his girlfriend. He didn't get disability. The planning department now has a nuisance case. We're trying to do an eviction as well. He never had an agreement with us because he broke in without permission in the first place. So this is a homeless issue. This is an issue in our community. and it supported Humboldt County and businesses in Humboldt County as well. So we really need help, and along with that help, we need to also look at what's happening. So to kind of change I guess I shouldn't change subjects at the very end. I'll change to another issue, but I need help. The planning department staff's been there. Health and Human Services has been there. His most recent request for disability was denied again. He said he's never going to ask for help from anybody again because obviously nobody wants to help him. This is a human being from our community that's lived here most of his life, almost his entire life. He's been homeless for 10 years, and we seriously need to team together and make this happen for this young man and his girlfriend, because it's not fair to have somebody living in America with this situation and getting no help. The only way he was getting any money of any kind was by recycling things, and now there's a nuisance case against him for having recyclables. We need to open up the recyclables again somehow. I don't know how. And we also need to get help for this man and his girlfriend because it's inhumane what's going on. Lastly, to have people think that they don't have to pay their rent so that they don't pay rent for years, for months and months. And then have.
Thank you, Dottie. I'm sorry, your 3 minutes is up.
It's okay.
Thank you.
It's okay. Thanks. Yeah.
Bye. Great. We have another comment. Last four of 3053. Welcome.
Good morning, Thomas Mulder here. I just want to clarify you can hear me.
Yes, we can, Thomas.
Hey, I guess some of my public comments I'll actually put in here under consent agenda, as the previous caller touched on a couple items that are of concern. Yes, I think it's important that we have things for homeless and people in need and stuff like that. These are tough times, but while we're doing that, let's not promote people to have properties that are subpar. The previous caller, I believe, has quite a few subpar properties. I drove by one of them today, the one that they were just speaking of. So let's make sure while we're trying to provide needs for people, we don't let landowners take advantage of providing those needs. Thank you for the opportunity to speak.
Thank you, Thomas. All right, I see, yes, there's another number 2122. If you could please press *6, you can join the conversation. Welcome.
Good morning, Estelle and board members. This is Uri Driscoll. I just got a couple of comments. I've been trying to track some of the COVID statistics, and the more I try, it seems like the more confusing it can be. And I know we have a new health director now. That should be good. So if I could just make a couple of recommendations, and just so we all can kind of better understand what is the effects of this.
Uri, may I interrupt you for a second, and I'll pause the clock just in case. This is the consent calendar. We're actually going to have a full discussion about the COVID pandemic emergency directly after this item, if you wanted to address the COVID emergency.
Sure, that's fine. Thank you for that. I was just trying to figure out where to put those comments in. No problem. I'll stick around for that. Thank you.
Thank you. You're right. It'll be right next.
Okay.
Thank you. All righty. So that does it for comments on the consent agenda. I do want to, before we take the vote, I do want to echo what my colleague said about Vernon, and clearly by just the comments that he made and his acceptance of that letter, his heart is always in that very, very important place of helping those that with whom he has walked a similar path. So thank you so much, Vernon. That's really important. And again, I really appreciate that we're helping out the county workers. We're giving them that extra December 24th holiday, since we haven't been able to work out some of the other discussions we've been having. So I appreciate staff for going forward with that. So with that, we have the consent agenda. We have a motion and a second. Ryan, can we go for a roll call, please?
Yes, Chair Fennell, thank you. Supervisor Wilson?
Yes.
Supervisor Bohn?
That'd be great.
Supervisor Madrone?
Yes.
Supervisor Bass?
Yes.
And Supervisor Fennell?
Yes.
Thank you. Passes 5-0.
Thank you, Ryan. And one other thing I had written down here is I wanted to, of course, thank Dr. Hoffman for stepping up into the position of health officer. And in very, very short order, we'll be hearing from him. We'll go now to a time set item. But before I get started on that, I did have a couple of requests for time certain-ish breaks in the meeting. So I'm going to say that sometime around 11, we'll have a break wherever it falls with the discussions, and then sometime around 1 p.m. we'll have a break, just so everybody knows. Okay, and again, we go now to the first item of the day as far as time certain. It's an update on the COVID pandemic. Welcome, Dr. Hoffman, Director Stevens, and I know that we also have Roberta Luskin-Hawk from St. Joe's here today to talk with us about the situation we're in, as well as Sheriff Hansel. So good morning, everybody. And before we even start with the presentation, Supervisor Bohn has his hand up. So let's hear from Supervisor Bohn.
I just wanted to thank Dr. Luskin-Hawk. She was double booked today when I called her, and she made time because I think most of us have said ICU more in the last 4 days than we've ever said in our life. And with her managing two of our larger, with Mad River and Phelps, the larger health units, I thought we could get a direct line on what ICU beds mean, staffing, and as much as she can give us, so we have a full understanding of coming straight for her. So I wanted to, she's on a time constraint, so I was hoping Dr. Hoffman would let her lead off. And I want to thank her for taking time to share with our public. So thank you, Doc.
Thank you, Supervisor Bohn, and welcome, Doctor.
Thank you, Estelle. Can you hear me well?
Yes.
Yes, we can hear you very well.
Okay, good. Well, certainly it's an honor to be in front of you today. I will say that you can be, I hope you can be proud of the work that the entire healthcare community across Humboldt has done in our preparation to respond to the COVID-19 pandemic. There's been superb collaboration with public health and all the various healthcare entities where we're really trying to work together and make sure that we do that effectively. At St. Joseph Health, as you know, we have St. Joseph Hospital in Eureka and Redwood Memorial in Fortuna. And most of the planning around surge preparation, a larger majority of it is up at St. Joseph, where we have not only a bigger intensive care unit, but board certified intensivists providing care and infectious disease docs and just more bench strength. So we, in early February and March, we went into this with 12 ICU beds and with, probably only 12 ventilators should we need more, and it was very early. And so we have done planning across a number of areas. We certainly have done extensive training in infection prevention. We have procured through Providence a great deal of personal protective equipment. We have, with the incredible generosity of our donor community, purchased another 12 ventilators, and we have some ventilators on loan from the state and rental from our system. So we have gone from 12 to 38 ventilators available, more than we should ever need. We've procured, we've participated in investigational drug trials, and then as remdesivir became FDA approved, we have adequate inventory of that. Early in the year, that was not the case. That is the case now. And we serve as a repository for other hospitals in the area, such as Mad River, so that they buy some directly, but there's some items that we keep in stock should they need them. In addition, we've expanded our testing capabilities. We work closely with the county on testing, but we now are testing anyone admitted to either Redwood Memorial or St. Joseph on a new platform that provides rapid testing for COVID, so that that's done. And within our hospitals, you'll see that the healthcare workers in clinical areas are universally wearing masks and face shields as well. And then last but not least, we are prepared to distribute the COVID vaccine. We bought a -80-degree freezer for storage of the Pfizer vaccine, not only for us, but for all other healthcare entities in the county. And we can distribute it from our setting, and plans are underway for that distribution. And while I know this is longer, probably covered more than just ICU beds, it really is much more than ICU beds. But today, rather than 12 ICU beds this week, we're going to expand and add another 6 ICU beds at St. Joe's for kind of an ICU step-down unit. And we have that we can do with kind of existing staff. It's a bit of a stretch, but manageable. So we have some plans of what it would look like if we have to do more than that. And that certainly will be more challenging, but we have plans should we need it. Mad River also has added 2 ICU beds. They had 4, and now they're going up to 6. So in addition, I think that we have clinical treatment protocols. We know that compared to early in the epidemic, actually fewer patients end up getting converted to an ICU bed, but it's still a significant impact on resources. So I think that's my long way of saying, tremendous work has been done to plan that. Now we're in the execution phase. And in addition, we have executed a lease for the alternate care site at Redwood Acres, should we need some additional placement of people who are at the end of their treatment, ambulatory and doing pretty well, but still needing hospital level of care, some oxygen or some medicine. So a lot going on. That's kind of the quick rundown, but maybe more importantly, I'm here to answer questions.
Well, thank you very much, Doctor. I'll go first to Supervisor Bohn. Supervisor Bohn, your microphone's.
I think the question I hear, so how many actual total ICU beds do we have? You've got 12.
Well, I've got 18 now. I basically have 18 at St. Joe's and 4 at Redwood. Mad River has 4, but they're going to 6.
So we have 28 total, I guess I'm hearing, or somewhere in there. Okay, I hear that a lot. And I think I've got to throw this in there. I know the community banded together in March and April to buy you more respirators. I think they bought almost $500,000 worth of respirators for the St. Joe's, and I think they need to be recognized, because their anticipation we were hopefully never going to use them, but I'm kind of worried now. So I think they need to be recognized. But anyway,
it was extraordinary. And I would say, just to call out, there was Humboldt State University bought 4, Women for Wellness, lots of individuals, but an extraordinary response from the community.
You bet.
And for a long time, even though we ordered them, we couldn't get them, but they have been delivered and they're ready to go, because we weren't prioritized because we didn't have enough cases.
So, Doctor, one of the questions that comes up for me is, we look at the way the state is handling the issue with ICUs now, and we've learned, as Supervisor Bohn said, a lot more about ICUs than we had ever before, probably. And basically, ICU means staffing. A ventilator is a ventilator. We can have tons of ventilators if we don't have the staff to care for people. We see images on television of requiring 5 people to take care of someone. So with that in mind, and with the drawdown on visiting nurses, or however, people who contract, how well prepared are you to deal with the surge in that regard, staffing?
Yeah, so that's a great question, Estelle. I think staffing throughout the country is going to be the biggest challenge and will require some creativity potentially. We have certainly our dedicated ICU nurses. Typically a nurse takes care of 2 patients in the ICU setting. They're supported by pharmacists and respiratory therapists and our intensivist physicians. There's a whole team of people. In addition, we have nurses who have been in what we call our float pool, who have that ICU training. Sometimes we use them today in ICU, sometimes we use them in another place. Certainly more of them would be asked to come into the ICU setting. And then the reality is when places around the country see a substantial surge, that they often ask nurses to pivot a bit. And so a recovery room nurse is used to seeing patients on a ventilator after a heart surgery or a neurosurgery. And it may be that that recovery room, that will limit certain surgeries so that the recovery room nurse can help in the ICU and do more team-based care with the ICU nurses. And then last but not least, we've set up at St. Joe's, we've installed just in the last, they're going in right now, some other telemedicine capabilities. So each of our 12 ICU rooms have a monitor and a high resolution camera. And there's some possibility that if we were really in a crunch, we could get additional support from people who were remote up in Providence, for instance. The Providence Tele ICU actually was able to help care for patients in New York during New York surge. So I will not say that we are totally, it's hard to say, well, do we have every scenario covered without a stretch? No, I mean, it's going to take the team-based care and some stretch and some creativity and redeployment of people doing jobs a little differently than they might do it under normal circumstances. But because we're not expecting that we're going to be able to get additional resources through the Mohawk or through FEMA or through, we have right now requests in for travel nurses. So if they're available, we will pay for them. That's not the problem. The problem is that every hospital in the country needs them, certainly many in the state. So we are, the way we're deploying our plans is really to make sure that we, have contingencies with people who are here in Humboldt. Last year we hired 102 new graduate nurses. We recently had hired another 35. We are constantly adding to our nursing workforce and training them. We also have taken nurses who have typically worked in what we call a telemetry area and are in the midst of training them to be ICU nurses. So all that is ongoing. Again, sorry for the very long answer, but it's somewhat nuanced.
Well, no, it is. And there are two things I wanted to say. First of all, I want to remind myself other illnesses. But before I get to that, I just want to reiterate, people on the outside have no idea of the amount of preparations that has gone in to getting us to this point, so that when I ask you this question, you have an answer that is a long answer that is multifaceted. And that's how we actually deal with this. And I really appreciate all of the work that everybody's put in to get us to this point where we can be somewhat comfortable as we see a surge on the horizon. And then the other thing I wanted to say is, with regard to that, you said, that you might, would you be deferring some surgeries or some other treatments if we did have the surgery, and what would that look like?
Yeah, so at the moment, the good news is that we're able to deliver regular care and COVID care simultaneously. So very different from March and April when we couldn't. But we have a committee that looks at the surgery schedule regularly, and we look at our ICU capacity, and certainly any emergency surgery would go forward. But for instance, today, if someone was having a totally elective surgery that required a nursing home placement afterwards, we would suggest that they defer that surgery. Over time, if we really had a major surge, we might need to once again defer some procedures that weren't urgent, especially if they required an overnight stay or an intensive care unit stay. But again, the value of having more PPE now and having a plan where we have additional beds, we've rented additional beds even, is to try to deliver important care for other life-threatening and chronic conditions while we deal with the surge. So again, better prepared to do that going forward, but we are looking at that daily. We have a capacity call daily. I'm on the phone with my team over the weekend, and there's a tremendous attention being paid to make sure we're ready to do both. And if we have to pull back, we very sensible about how that would happen.
Thank you, Doctor. Any other questions or comments for the doctor? Well, thank you so much, Roberta. We'll go now to Dr. Hoffman, and again, welcome. We really appreciate, again, the fact that you stepped up, and I think you're doing great. Welcome,
I'm going to
Dr.
leave, but I look forward to working with Dr. Hoffman. Thank you all as well for the support. Appreciate it.
Thank you so much, Roberta. Thank you.
Thanks, Roberta.
Thank you.
Can everybody hear me okay?
Yes, we can hear you, Doctor.
Great. Well, I just want to start off by thanking everyone in Humboldt County for entrusting me in this position. Obviously, of utmost importance right now. The process that we went through to get to this point has been very lengthy and very deep, and I appreciate that this board took that process and put it into place. A little bit about myself, just because some people here don't know me yet. So, taking over for Dr. Frankovich, who has done an incredible job. She laid the foundation that we will take the rest of this pandemic into and back into normal life. So her service is incredible, and we can't say enough about what she's done for us here. I'm a family doctor, and I have a master's in public health from Rutgers University in New Jersey. But I've spent most of the last 20 years here in California, which is my other home from the East Coast, and have been coming to Humboldt County for about 15 years now. Met my wife, who grew up here, and we would spend a lot of time here. I've worked here over the years in different capacities as a physician, and we've decided to come back here to raise our family. It's such a great, wonderful community to be in. So let me set the stage for the COVID update. This is my first time, so I'm sure all of you are aware of where we're at, but I wanted to kind of give my contextual understanding of where we've been in Humboldt County, not just in the country. So 10 months ago, we all started into this, and we were hoping for a normal spring and summer, and it turned into a very different one for us. Humboldt County was on the forefront of diagnosing and testing. One of the first cases in the United States was diagnosed here. Our lab quickly got up to speed and was running 60 tests a day at a time when Oregon, where I was practicing, the entire state had 30 tests. We did not have the ability to diagnose this disease very well, but here in Humboldt, it was being caught very early. That led to, in addition to amazing testing, our incredible investigations team led to stopping this from coming into our community, along with the wonderful community here who took this seriously, who stayed at home, who wore masks, and who distanced throughout the spring and summer. We had times when we were having spikes in the cases over summer through travel, what seemed to be mostly through travel, but each time it was stopped by our testing and investigations unit. And that brings us to now. So now here we are again. Winter has come, 10 months into this pandemic, and what we're seeing is a change. We are at the beginning of a change in how the epidemiology of how this disease is spreading in our community. It's no longer coming in from the outside, it's here and it is spreading amongst our community, and it's doing it very rapidly, and that's concerning. So we've gone from early in the late summer and fall with the blueprint metric. We were sitting firmly in the yellow tier for quite a while.
And as you all remember, not that many weeks ago, we suddenly skyrocketed from yellow to red, and then shortly thereafter to purple, the most restrictive tier. This was due to a lot of spread from late October and early November, Halloween gatherings. And we knew that the gatherings were an issue, and we were trying to do our best to try to stop those. But I think it got to a point where around Halloween, we couldn't stop it anymore. There were many large gatherings, and from there, it just spread out throughout the community. So going into Thanksgiving week, the state was seeing a surge. We've all seen the surges around us in the neighboring states. We went from a case positivity rate of just under 1 per 100,000 in the early part of the fall to now hovering around 9 to 10 per 100,000, so about a 10-time increase in the case rates. We went from also our positivity rate on our testing went from very low numbers, from around less than 1% positive to now upwards of 5 to 6% positive on some of our latest numbers. So let's think about this. So this virus was kept out of our community for 10 months, an extraordinary thing. We went from the time it took to get to 1,000 cases, nearly 10 months. That's extraordinary. We should all be very proud and happy of the work that has been done with this team and our community. Now, where are we? The projected time to go from 1,000 to 2,000 is just over a month from now. If that sounds shocking, it should sound shocking, because 10 months took us to get here, and potentially only a little over 1 month to get double that. And that's just the nature of this disease. When it doubles, it's not a linear, it's not like this, it goes like this. It goes up exponentially as it spreads in our community. So these are the reasons we have the restrictions that the state has asked for. The strictness in the purple tier, which we are still in, and the new stay-at-home orders that could be triggered should we reach an ICU capacity. Now, right now, we're looking good. We, as Roberta discussed, we're actively looking to increase our ICU capacity so that we can handle a surge. Roberta and I spoke this weekend and this morning, and I feel confident that she and her team and the other teams in the area are taking this very seriously and looking to expand the ICU potential and hospital capacity as much as they can reasonably. But like Roberta said, we cannot plan for every single possible outcome. Even with all the best laid plans, we still could be looking at a shortcoming. And so that's where the trigger comes in. If we get to that trigger, it really triggers a new, and we're not calling it a shelter in place. It is a stay-at-home order though. We do want people, if this trigger gets pulled, to essentially think of this as you are at home unless there's an absolute need otherwise. Okay, so we hope we don't have to get to that point, but that is the thinking behind it, is to create a better way of doing what we did back in March and April that allows businesses to continue to stay open, but really the focus is on staying at home. So what are we doing locally to deal with this surge? Well, we are continuing to build our testing and investigations unit as best we can. We have several new testing lines coming on in the next weeks. Our Optum site is expanding. We have the UIHS site, which is hopefully going to start in the next few weeks or month. We have other options. We're rolling out rapid antigen tests, which you will probably hear more about in the coming weeks. This is also being done across the state and nationally. These are rapid tests that will give you immediate results. So we're expanding our testing as fast and as best we can. We have, honestly, this is the best lab you could ever hope for. It's incredible. The investigations unit is also expanding. We have brought on more investigators and tracers from the state and through a state platform that will also help to identify connections between cases earlier. And then I believe there's more information coming from the governor in the next couple of days about other platforms that the state's going to roll out with notifications, apps, technology that will help identify, have you been in contact with someone who is positive for COVID-19. So we continue to do all that locally and expand it as quickly and as we can. Lastly, I'd say, the other measures that are really important for us to keep in mind as we go into these next weeks and month, really, because everything is going to be measured by what happens in that next month. As I said, at this rate we're seeing right now, if we don't do anything at all, we will see us go from 1,000 to 2,000 cases sometime in January. But we can do different. We can change that. And what can we do as all of us to change that? Not, because we're going to continue to do at Public Health everything we've done, and we're going to do it even bigger and better than we have in the past, but we need help from everyone else too. So there is a travel ban in place in California currently. There should be no travel except for essential travel. So unfortunately for all of us, for these holidays, that means staying at home. The more we can do that and adhere to that travel ban, the less likely we are to bring virus back or send it away. Gatherings are prohibited under our current tier. So we need to be aware of that and adhere to that. These gatherings, we know, even small ones, can and do spread this disease quickly. Masking is still the foundation of us stopping the spread of this. So the more we all mask, inside and outside, if you're close to someone, even outside, you should be wearing a mask. And especially indoors, all of us, especially essential workers, people who are working right now, who have to come to work, if you're not in a private office alone, you should be wearing a mask of high quality. Distancing is still important. Distancing 6 feet or more, even with a mask on, because the more we have close contact, even with a mask, it doesn't separate us out. If we have an exposure, the mask does not stop that exposure. So we have many, many people who are getting exposed in healthcare settings and government settings and business settings that are still open because they're all essential, but they're still in exposure even if they have a mask on. And this is really important because we have many, many people who are getting quarantined right now. And quarantine is one of our other main ways of stopping the spread. But the more people we have to quarantine who are essential workers, it makes our jobs very difficult. So the more we can do to slow the spread by wearing the mask, keeping a distance, even in these scenarios where we're still having to work, will help us slow the spread of this and reduce the number of quarantines that we have to do. While I'm on quarantine, one last thing about that, because we have really changed where we are asking our community to tell each other about quarantine. We do not have the capacity to contact everyone anymore who is going on to quarantine. So we contact every single positive, but our contact tracing and investigations unit is focusing on high-risk settings like skilled nursing facilities, overlap with healthcare facilities, overlap with congregate living facilities, vulnerable populations, schools, places where this could spread very rapidly, but we do not have the ability to talk to every single contact of a positive if they're in a low risk or lower risk situation. So any of us might get contacted that you've been in contact with a positive and you should quarantine. And that might not come from public health. That might come from a friend or a family member. And we want people to know that that still is a recommendation, even if it comes from your friend or family member. And we have everything on our website and tells people how to go about that. So why are we doing all of this? Because we want to get through this winter with minimal life loss and minimal amount of hospitalizations. We can make it through if we do these things for a few more months. We have vaccine on its way and scheduled to be delivered in a few weeks, the first round, and then each couple of weeks after that, throughout the winter and into the spring, there should be more and more vaccine coming. So we are hopeful. We are at the end of this tunnel. It is here. So now is the time for all of us to tighten up our masking, our distancing, and no gatherings, no travel. And we'll get through this and we'll be better off. Thank you.
Thank you, Doctor. Really appreciate that comprehensive overview of the situation at hand. Any questions or comments from the board? Supervisor Bohn, then Supervisor Bass.
You didn't spend very long on it, Doc, and I was kind of hoping you could, the only thing everybody's hoping for is accurate information and things, but you spent about 30 seconds on the vaccine, and since you're I'm trying to figure out which group is figuring out who is going to get it. I know our sheriff's deputies have decided to forego it for our more vulnerable populations. I applaud them for that. But what does your team come up with how is the distribution going to take place? Because I think that's what we're going to be asked quite a bit. So maybe if we could get that out in print, it's solid and stuff like that. Because as you know, in our emails yesterday and everything else, I really think the lack of knowledge to the public and the vagueness is creating a little bit of this hysteria and our pushback. And so I'm hopefully we can solve that under your watch also.
Sure. No, great questions, Rex. Obviously we could spend 30 or 40 more minutes talking about vaccines, so I don't want to take up too much of everyone's time. There are national and state level talks going on currently to finalize the vaccine recommendations for Tier 1A. So that's the first round. I think it's seeming pretty solid that that's going to include healthcare workers in high-risk settings, which I did go into this on the media availability last Friday. For anyone who didn't catch that one, it goes over that a little bit more. But so high-risk healthcare settings and long-term care facilities. Those are, what we're seeing with our skilled nursing facility right now at Granada, we want to get that sort of situation under control first. So vaccines will go to those populations first. I suspect that we won't have vaccine for the Tier 1B probably until January. So we're still working. That hasn't even been worked out, Rex. So that's why these aren't our attempts to try to cover anything up. We are still working this out. We don't know, there's a lot of national and international debate on who should get the vaccine and when, because we have a limited supply. It's going to come out in small doses, and we have to try to make a judicious opinion on what's the best use of that.
But I fully agree. I was just wondering who makes that on a local decision. And I have the criteria I've been hearing is perfect. I think that's who needs to get it. I have no desire to step up in line or anything else. I agree with that. And then do we expect the vaccine to hit here Thursday or Friday? Because that's the rollout day, as long as they get approval tomorrow, which with the UK giving it approval, I don't imagine we're going to deny it. So.
We have signed up for vaccine. I can't tell you when it's going to get here. They haven't told us yet, but we're ready to receive it as soon as it gets here. And we're ready to roll it out as soon as the approval is there. So we have large teams working across public health, with St. Joe's, with all of our healthcare providers in the county, making sure that we know exactly which healthcare providers and long-term care facilities should get it first, and the plan to get it out to them. So that's where we're at right now. There's a lot of people working on this.
Thank you.
Thank you. Supervisor Bass.
Thank you, Madam Chair. I have a couple of questions for Ian, and then for the sheriff later. So I don't know if we're going to have a chance when we're going to ask the sheriff questions. But for Ian, following up on what Supervisor Bohn was asking, and I don't know if you've heard this, but I thought it was interesting. On some news stations this morning, they were saying that the U.S. actually kind of underestimated and didn't actually order probably as much as they could have for this first vaccine coming out. Like they were waiting to see what else comes along. So, I'm curious if you think, that is obviously going to affect us, but when it comes from the U.S. and it gets to the state, what is the process that it actually takes to get to a local community?
Yeah, it's a great question, Virginia. We've seen those reports. We're not sure. That's a much higher level, obviously, than we're at. I can tell you that I've been in discussions with just last night at the end of the day with our vaccine coordinator, who was telling me that actually we might be getting more than we originally were slated for a week ago when we put our first order in. So, this is the reason when I put out the media availability last week, I don't want to give any particular numbers, because until we have the vaccine here, it's, who knows, right? But we've been promised a certain amount, and that number actually went up recently. It could go back down. We won't know until it gets here. My understanding is how this is allocated is it's sent out from the CDC to the state. The state has it in a warehouse where they're going to send it out to us, and it'll go into our ultra low temp freezer. And then we will be, the local health jurisdiction will be in charge of coordinating that going forward once it's here. We have many partners who are going to be stepping up to get the vaccine out. We will help facilitate that. And there are many, many volunteers who have already stepped forward to help that process along. So we are encouraged that this process will go smoothly once the vaccine is here.
Right, and that's plain. And you didn't even have to go that far into it. I just was trying to get a path so people can understand. It's more confusing than, it's not that simple, put it that way. A couple other questions I've got. Well, okay, the 88, the number that came out yesterday, I heard a lot of people, I got calls on that saying, was this all in one place? Can you give a really very brief, what you saw, where those came from? Are these just totally community spread, or is it centered somewhere?
We're seeing a lot of community spread right now. We are, seeing that to a degree that we have not seen before in multiple settings across the county, both in home settings, gatherings, and workplaces now. Many workplaces are having outbreaks. So, we have to be careful. That's what I would say to that.
No, and that makes absolute sense. I do know someone whose work setting, someone did test positive. Now the families and the employees, it's actually turning out to be a bit of a nightmare for everybody, trying to make sure they're doing the right thing. And then I think the last question, I thought I saw Supervisor Bohn's hand go up. He might have another one, but my last question for Dr. Hoffman is, we hear about rapid testing. Is there an opportunity for large employers perhaps to have access to rapid testing? I'm just curious, is this something that is only going to be done in medical settings? It seems like that could actually help catch things more quickly. So that's my question for you. Thank you.
Great question, Virginia. So we have some rapid tests, and we have been holding off on using them because the data hasn't been great on their use. But I think in the last several months, there's been a lot of large-scale studies that have looked at the use of these rapid tests in various settings, and they've gained a lot of evidence for them. So like I mentioned in my update, I'm actually have a final version on my desk right now for a rollout of a rapid test that we have here that will go out to many healthcare facilities across Humboldt County. There is potential that these could be used in other settings as well, but we certainly want to start with healthcare settings because there are requirements for use of these, which includes that it has to be a certification process that usually happens in a healthcare setting, and also a reporting system. These have to be reported to a state-based reporting system for infectious disease. So more to come on that. I'd say, this is our first round of rapid tests, and if it goes well, I could see it happening, in various other settings as well. We want to see it happen first in the healthcare setting.
Did you say you had a question for the sheriff as well, Supervisor Bass?
I did, if it's all right here at this time.
Go ahead.
And this is also might be include Connie as well, Connie Beck or Michelle. So I know I've been sending a lot of emails about concerns over evictions. I, have a few people in my district that are currently going through, I think, no-fault evictions, but there's, a lot of concerns on, well, where do I go? I have a compromised health system. I have an animal. I'm going to be on the streets. There's nowhere for me to go. What do I do? And it's really, I'm having a hard time explaining this process to people because I don't really know it. And I know the sheriff and I have exchanged several emails, and when it comes to evictions, I believe the sheriff is mostly operating on behalf of the courts. And, I'm just wondering do we see anything at the state level coming back down? I just don't know. And then where Connie comes in, if somebody is in a medically fragile state and they're going to be kicked, they're going to be not able to be in their place anymore, do we have something that helps pick those people up to keep them from being on the street? So that I think is that piece of it. And then the other one for the sheriff is with this morning's article, Shasta County on the front page and the discussion there about non-compliance or non-willing to comply. I'm just hoping you could weigh in on that if you read that article. I didn't seeing it.
I did not read the article about Shasta County and what's going on there as far as non-compliance goes. So I'm not sure what they're doing over there.
Oh, no, it's just some willful, we're not going to do this kind of stuff. Anyway, read it later.
I do see that there's throughout the state, there are businesses that are not complying, and the result would be essentially, again, their day in court and a citation issued, and they would have to go to court and plead their case in front of a judge. So that's essentially what'll end up happening with those businesses.
Okay, Supervisor, go ahead.
I just say, and the eviction question, I don't know if the sheriff or.
So the eviction, is for, COVID related, someone lost their job for COVID, those kind of things. The courts aren't approving those eviction procedures. But if someone just failed to pay rent, they have a job, they have means, those kind of things, then, there is an avenue that people can be evicted from their residence. And those are occurring right now. But again, it's a court vetted process we receive those summons from the court, we receive the orders from the court, and we act on the court's behalf when someone is evicted. And so I just urge people, if you are served with an eviction notice, to please go through with the process and don't just ignore it, because if you ignore it, the judge can't weigh the other side of the evidence. So please, have your day in court, plead your case, and oftentimes more time is given or eviction is not approved. So.
All right. Anybody else want to weigh in on that? All right. Supervisor Madrone?
Thank you, Madam Chair. Yeah, I had similar questions to Supervisor Bass. I mean, we're starting to see some of the sheriff's departments around California come out in the public saying, we're not going to enforce. And it just seems like such a horrible message at this time. And, I certainly understand the incredible hardship that small businesses are going through, many losing their businesses, as well as the incredible difficulty that our entire communities are experiencing. I understand. I think we all get that. But this is not the time to be backing off from enforcement. So I'm just wondering, Sheriff, have you've seen these things in Riverside County and other places? Where are we at here locally? Are we going to be enforcing these rules, shelter in place and all these other kinds of things? Or are we going to follow Riverside's direction here?
Well, I think we've done the same thing as we've always done, and that is education approach. And, this is what's made us, I think, so successful here is that we're all a part of this community and we're doing our part. It's when we come and, it's definitely a balance, because when you send a deputy sheriff in to enforce a stay-at-home order or those kind of stuff, what happens if someone refuses? Now we're going to use force against someone who's not wearing a mask in public, force a deadly force, confrontation. Who knows, over what? So it's a balance. Every officer and every deputy uses discretion, and that's why I pay them to use discretion. And so every day they're out there dealing with calls. As we see throughout the county, we do have escalating violent acts that are occurring throughout the county. We do have escalating crime that's occurring throughout the county, all the way from Oric to Alder Point. I think you've read about it in the newspaper lately. So, essentially we are spread thin and we're doing our best. And so we are going to continue to prioritize calls. I have not made the statement that I'm not enforcing any stay-at-home order or those kind of things. I am, going to take every thing serious, and we will look at it and evaluate it. And but the deputies will use discretion when it comes to this. And if there's a citation needed, a deputy will cite someone. There was a similar circumstance I think we all talked about in Costco, where a lady got cited in Costco because she refused to wear a mask. And our deputies have spare masks. They'll provide a mask to someone instead of giving someone a citation. But if someone refuses to leave a business because they're not wearing a mask, then we can arrest them for trespassing. So it's always those kind of things will come up, but every situation is different. I can't make a unilateral statement that everyone's going to get arrested or cited or shutting a business down. That's not going to happen. Every deputy is going to use discretion, and we'll do our best to try and maintain that balanced approach, which is, I think, a reasonable approach here in our county. But again, there's always due process. And so I'm not going to go in and shut down a business. If there's a business that's out of compliance, they may get a citation and they may have their day in court. And so that's their due process that they would have in a court of law. So I'm not going to deprive them of that process. And we hope that we can come into a compliance with our community. And so far, I think we've done a very, very good job. Like I said, balancing that.
Sheriff, I want to jump in here and just say, if you wouldn't mind, Supervisor Madrone, I really appreciate the approach that you are taking, the balanced approach. I think it's actually foolish of some sheriffs somewhere to make announcements like that, because you know what? That's just political, and people being manipulated then to say, I'm going to take a stand with, whoever made this pronouncement, and I'm going to do silly things like not wear a mask when I'm required to and make a stink about it. And that's just not where we need to be. So I really appreciate the balanced approach. People know that what they need to do. Everybody should know at this point. And if they're making a statement, then they're going to have to take the consequences. That's kind of how it goes, I'm sorry, Supervisor Madrone, I really wanted to say that.
No problem, Madam Chair, and I totally agree with your sentiments there, 100%. And I also want to applaud the sheriff and all our deputies for the hard work. This has not been easy for anybody, and I know it is a balancing act. So I very much appreciate that, Sheriff Hansel. I guess for me the thing is, at one point it might have seemed like choosing not to wear a mask was just sort of being rude or making a political statement or whatever. But in all honesty, not wearing a mask is walking around with a deadly weapon. When we talk about the use of force and stuff, I mean, if people are walking around unmasked and not distancing and getting in your face and stuff, that could potentially kill you or somebody else, literally. I mean, I don't mean to be dramatic, but this is not just a simple case of people choosing one thing or another. I mean, people walking around unmasked, unsheltered, undistanced is a threat to our society. And I appreciate that in Humboldt, I think most people have really gotten this early on, which is why we did so well in the beginning, but we've all gotten very tired and, people are getting more lax about it as time goes along. And so I appreciate you not coming out with the kind of a statement that Riverside did. I agree with Chair Fennell. That was, really? So at any rate, it's difficult for all of us. Thank you for everything you're doing. I know we all know we have to double down at this point. It is not just a joke or just a political statement. So thank you.
Well, and I do want to chime in one thing, okay? I'm not Riverside County, but they have their own challenges down there. The one thing that I think we can all agree on is the lack of communication, the lack of coordination from the governor's office down to law enforcement. And the legislature and the state senate also have weighed in on this. The governor has not weighed in or kept us in the loop on these kind of issues. And so we urge the governor to actually work with the state sheriffs, to work with law enforcement on how to properly, manage this. And don't just kind of make the rules and not, bring us to the table to see how we can actually enforce these rules. Because I think that's where a lot of this frustration is born, is because the governor doesn't fully explain. We learn about him 15 minutes before a conference call. And I know CSAC and RCRC, they've all, weighed in on the same thing. And that we just wish the governor would bring us all together to have unilateral type decision-making that we can all kick back and not necessarily agree with, but understand. And so we can, help the overall system, with us dealing with COVID-19. So it is, like I said, it is a balance. And so I'm not taking anything off the table, because there definitely could be some time where we need to have someone in jail over a COVID violation. I don't know when that would be, but that would be the case. But I'm thankful that we got, Dr. Luskin-Hawk on the call today, because she cleared up a lot of things as far as ICU beds go, and our medical staff. I think that was great. I think it's good public information for us to acknowledge here, and for our community to realize that we're all truly trying to work together at this and trying to mitigate as much as we can. But the good news, our death rate here locally has been the same this year as last year. We have not had an increased death rate because of COVID-19. And so that is something that is, that is decent. So though, yes, I agree with you, this is deadly for some people. The stats show that, unless you're over 70 years old in Humboldt County, it doesn't make, that death rate is not exponential, and it's not necessarily deadly, as far as our percentages here in our county.
Thank you. Any further questions or comments from the board? Just one other thing for me is looking at the news that's coming from Shasta, and then looking at the regional approach on whether or not we have to go further than the purple tier, you know, with the actual lockdown type thing. It seems to me that, you know, the fact that we're in a region now that I look at it, it may not be so bad at all that the governor is looking at that from that perspective. And so if by any chance our region goes below the 15%, how much time will local businesses who would be affected have to be aware of that? Do you know that, Doctor?
Yeah, so they're calculating that daily, and it had been coming out at noon, but today it came out at 9:30. So all of us can see that on the CDPH website. So the number was for Humboldt County, had been as low as around 20%, got up to 26%. I think it's around 24% now, or sorry, for the region. When and if our region dips below that 15% mark, which right now only 2 of the regions in all of California have done that so far, we have 24 hours. So that's why in my address on Friday, I said, you know, at that time we were given the projection that it would happen about now, but it looks like that's not happening. We're not sure though. I mean, you know, here's the thing. So we have an outbreak in a SNF right now that we all know about at Granada, and that could turn very quickly. Okay, so we could go from 0 deaths in the last several months to doubling our death rate easily in the next week or 2. I think we should all be prepared for that. And that's why, you know, these are the most vulnerable people in our society. They served us well throughout their entire lives, and now they are at the highest risk. And so we want to protect those people. And the only way for us to protect them, what we know is they were protected all throughout the spring and summer and early fall. And now that the virus is here and circulating freely, you know, to a certain degree, yeah, not wearing a mask is like putting a death sentence on some of these elderly folks who are in long-term care facilities. So we need to be cautious going forward, because I think we can spare their lives. I do. I don't think it's necessary to allow that to happen since we're so close to the vaccine. But unfortunately, the result is we need to all buckle down a lot more.
Now, I want to say something about that too. You know, we need, and I think you're seeing that more in national media, people need to understand this isn't just fading away when you're old. This is an ugly death. This is very disturbing, and it's disturbing for the people dealing with those who are passing because of COVID and family. It is not just people disappearing because they're older, and nobody wishes that on anybody. So if we can help by wearing a mask, doing the kind of following the guidance we've been asked to for a long time, why not? You know, that's it.
Thank you, Estelle. And now is the most important time as ever. I mean, I think with the amount of virus here, again, I just go back to what I was saying earlier, that what we're seeing now is not what was happening in Humboldt County in March or in the summer with the surges that we've seen in the past. This is a different surge. This is truly the virus in our community circulating freely. And so we have not seen that yet. And it's important to remember that. And so if you didn't wear a mask up to this point, we don't fault you. It's okay. It's okay, but please, now is the time. For the next months, until we get through this, we get the vaccine and we feel confident, again, that we can take our masks off. I am hopeful that will come shortly after the vaccine is more widely available in the spring and summer months.
Thank you, Doctor. Did you have your hand up, Supervisor Madrone? Oh, Supervisor Wilson, sorry.
Yeah, just a couple things. I appreciate this conversation, and I want to really emphasize that as we, you're right. We're seeing it in our community in a way that we have not seen it before, and it's still, even as much as it is in our community now, it's still not as explosive as we're seeing in other areas, but it can get there. And what we're seeing in other areas creates pressure on us. We're not an island in this space, and we're not an island just in terms of people coming in and out with the virus, but we're not an island in terms of resources, whether it's nurses or PPE or those sorts of things. That the more that we see those expansions in other areas, that impacts our ability to access resources. If this expand, if we have something happen here. So it's kind of like fires, right? So it's like, when we had the fire in Blue Lake, thank goodness, which was when the Tubbs fire started down in Sonoma County, thank goodness it started 2 hours before the one in Sonoma County, or we wouldn't have had planes to be able to address that, right? And so what's happening is the resources being allocated to other places and are scarce here in terms of our ability to respond. And so I want to make sure that people understand, like, those risks are real and becoming more so every day. I want to also go back to this discussion about not wearing masks in businesses and around community. I went back to, we talked about before, the burrito place down the street. I went back to the first, and again, a person's in there not wearing a mask, and it's not just the threat that someone feels about maybe necessarily the disease, but everyone has to evaluate how to talk to this person. People feel threatened. I mean, look at the video of the person who was freaking out in Costco, right? I mean, luckily there's a lot of people there in that space, but a single person may not say something to that person because they're afraid of their reaction. They're afraid of being the confrontation that could come from that. And then they hear about people becoming violent. Again, people don't know. So if you're not wearing a mask in these businesses because you think it's some right or whatever that may be, you're just really trolling people and kind of terrorizing them, really making them feel threatened because they don't know what to do. Like, they have to make that risk assessment in that moment. Is it worth it? And all of the dynamics of size and, quite frankly, race and gender and all of those experiences they've had to deal with in their life in terms of like avoiding confrontation all play into that dynamic. And so it would be really great if we try not to push that into other people just because we feel like we have the right to. I'm hoping that we weren't raised that way. We really need to do our best to help calm everybody down. And quite frankly, wearing a mask is about the least you can do to do that. It's really simple. It's really easy. It's not an inconvenience. At least for the minor amount of time you're in a business that needs to do business in there. And quite frankly, you don't want to scare other customers away from that business. You're not doing them any favors. It's just not cool. So that's all I have to say. I really appreciate this conversation today.
Thank you, Supervisor Wilson. We'll go to public comment on this item. If you wish to make a public comment, you can call the numbers on the screen. Oh, Supervisor Bohn?
Well, exactly what Supervisor Wilson said. And I would implore our information team, our media team, to put that out there even more, because there's so much misinformation out there. There is so much. I mean, we have people saying that the test is only 50% accurate, that 70% are false positives. I mean, and I agree, I shake my head too, but there is so much misinformation out there, and you can't deny it because we see it all day long, both in social media. I see it confronted to me directly and things like that. And part of it, and you and I had this discussion, I've been beating this bandwagon, but I hear the same response. Can we have an accurate dashboard? How many people do we have in the hospital? How many do we have in the ICU? I know there's a cost factor. I've heard that. But when Trinity and Del Norte can throw that cost factor and get the accurate information, the more information is powerful. We've all said information is powerful. If we can give it to the people, and streamline our dashboard a little bit. I think it would be so powerful where people could actually see the impacts instead of, we have 54 hospitalizations. That tells us nothing. It's just, I had to throw it out there because I get 20 people a day ask me, and I just asked a question for 20 people a day. You do the math. Thank you.
No,
I second that.
I appreciate that, everyone. Being new here, obviously, there's a lot of history that I don't know about, so I can only speak to what I know. So let me try to do that the best that I can. When I first looked at our dashboard, I had the same thoughts, Rex. I was like, this could look a lot better, and I've been asking that since I've been here. And essentially what I was told was that we have a county platform for our website that only lets you work within those bounds, okay? From what I understand about Del Norte's, which I looked at and was like, wow, this is fantastic. It looks wonderful. Why don't we look like that? Well, they're farming it out to an outside firm. So I think that, if county can update the website side of things, because as far as I know, public health's not in control of that. We just give the information, and then they have to put it up in that way that, looks a certain way. We are going to have a meeting, I think today and a few hours, shortly here, to talk with the JIC about the dashboard and updating some of the numbers, because we do feel like this, we want to give meaningful information on the hospitalizations and ICU bed capacity, but it's, we want to do it in a way that's thoughtful, that will actually inform the public and not scare people or make them worried about things they don't need to be worried about. You can see that Roberta and public health are in close contact, as is all of our hospitals. CEOs meet frequently. We have public health on those meetings to talk to them about hospital capacity and planning. We've got the ACS all lined up if we need it. So we feel well prepared. I think that the public shouldn't be concerned about our hospital system at this point. If we get to that point, we'll sound the alarm. Honestly, what we want right now is people to conform to our requests of masking and distancing and stopping gatherings and stopping travel. I mean, that's where it's at right now. There is no number on a dashboard that's going to tell people that they can take their mask off or go to gatherings or go travel for the holidays. That's not going to happen. And I understand that the numbers are important to people, and we want to give them to people in a way that makes sense to them. But I don't think those numbers are going to change anything. The other thing is from from the standpoint of the website, I'd be happy if the county could look at ways that we can get a better website up. That would be fantastic. On the side of what the numbers mean and should we publish those numbers, I mean, we're a small community. We often might only have 1 or 2 or 0 hospitalizations at a time for COVID. And there are privacy laws around this for, to protect people's privacy, really. I think that is my understanding of why we have decided to not publish those. Just like we don't publish businesses who have positives. We don't publish, agencies that have positives. We have, but I think the decision has been, and again, I'm new to this, so I don't know, but from what I understand, Michelle can help maybe talk to this a little bit, is that's the reason, is that this is a small community. We're not LA, we're not San Francisco. We publish those numbers and people know who that person is, and there's a privacy issue. So Michelle, do you want to chime in on that?
No, that's fine. It's the same answer I've been getting. The people are asking, I want them to know that we don't have a good enough computer system.
I think it's not the computer system. I think it's the platform of the website. We have epidemiologists who are looking at these numbers, and we track them very closely. I think it comes down to more about the presentation of it, which is much slicker in Del Norte, and I agree. It looks a lot better. It's based off of the other dashboards that are based off of Johns Hopkins, which is the best, most comprehensive dashboard out there. And ours looks very different because we don't have the website capacity within the county is what I've been told.
I think that, yeah, that's part of it. And it's just, one good goal. We can do it. We can do it. If we can't, your message is very clear, Doctor.
Yeah, and
no matter what's on the website, but we have our job to do, which is to follow the guidance. And just, I think what people would like is if let's say the total says 1,000 people, but the dashboard says 854, that's counterintuitive. When people are going in, they're being told, go to the dashboard to look, but then it's not giving them the same information. That's all. It just means that it's got to be updated more frequently. But I think we kind of hashed this one out quite a bit.
Look for changes. They're coming. They're going to come. We're meeting today to talk about it, and we want to make it more user friendly. We want to make it have accurate information. So we're meeting just after this to talk about it.
Thank you so much, Doctor. So we are going to public comment now. And again, as I said, call the number in the screen if you've got that. And then you press *9 to be in the queue. And then when I call your last 4 digits or however you're identified, you can press *6. So the first caller is call-in user, and not sure who that is, but press *6, please. It says call in user 1. There you go. Welcome.
Good morning again, Madam Chair. This is Vernon Price calling from Eureka. I really want to say thank you to everyone in this county, from the Board of Supervisors to Public Health, the Director of Public Health, our doctors, and the exemplary leadership of our Sheriff Humboldt. In this pandemic. I mean, really, how can we prepare for the unknown? And this county has done an excellent job in this crisis that we are in. I would like to ask a question on the disbursement of the vaccines as it trickles into our state and county. I met with 15 unhoused citizens in the greater Eureka area yesterday that has case managers throughout our Health and Human Services system, everywhere from mental health case managers to the home program to CCT. Are our case managers going to be prioritized, because they do meet people where they're at, in their homes, on the street, in the Mission, at Free Mill, and other locations throughout the county? And also, a second part of my question would be to Humboldt County Mental Health. There is other people that is also meeting people where they're at, and they fall in the gray area of administration instead of providership. Will they also be prioritized in this vaccination process? Thank you so much for your time, your concern, and allowing me the honor and privilege to ask these questions.
Thank you, Vern. We don't interact as we go through public comment. Perhaps you'll have some answers at the end. So the next caller is the last 4 digits of 0150. If you would press *6, you can talk with the board. Welcome.
Hi, Dottie Russell again. So there's been a lot of comment in Southern Humboldt about people going on trips for the holidays, whatever. So I think this month that there'll be people that are traveling and how they're going to get out and where they're going to go and what's going to happen. I don't really know, except for I know that there's a lot of talk about it in Southern Humboldt about people leaving and then coming back. So one concern that I have is that if they manage to do that, I'm not sure how they're going to, but if they manage to do that, then January is going to look pretty scary too, not to be too negative about that, but it just seems to be a reality. And then maybe along with that, there could be some kind of, I don't know how you would do it, but to figure out if people are planning to leave, and then try to arrange something so that they're not coming back, for a couple of months or something, because they're going to be leaving and they're going to be coming back, and it's this community down here doesn't always follow the rules. Fortunately, a lot of people are wearing masks. That's really great, but their plans to go away for holidays and stuff is not looking very promising to me. So I don't know how you might monitor that, but if you could, that would be great. The last thing is that for the businesses and the community and community spots, whatever, fighting by the request to wear the masks and all. If there could be something on the door, or like you post things for if there's algae in the river, something that says, thank you for participating in keeping our community safe, and really call it out and let people know that this is really happening. People are really doing it. And I think a lot of us have taken a lot of steps to keep things safe. And I would like to see all of those people doing that, at least reference to this is a good protocol to keep our community safe. Thank you very much.
Thank you, Dottie. Okay. The next caller is the last 4 digits of 2122. If you press *6, please, you can join the conversation. 2122, please press *6. You have the last, there you go. Welcome.
Okay. Good morning again. This is your ride, Driscoll. Well, I'm happy to hear that the new health officer will be taking some recommendations on how to better improve the information, because when I look at the dashboard, I just keep scratching my head like, what the heck is going on here? I think that it's, one thing that's very positive is that we have a seemingly extremely low number of hospitalizations. And even though the positive test cases seem to be going up, the death rate is extremely low. And as Sheriff Hansel said, that it's actually less than it was last year without COVID. That I thought was kind of interesting. So if the number of hospitalizations are really low, that's really a good thing. One of the things that I would like to see changed in the dashboard, if possible, is the number of positive cases that are tested. How many have a certain level of symptoms? You could have it in 3 tiers, say, either no symptoms, mild symptoms, moderate, severe, maybe even ICU. So we understand just how serious this is. A couple other comments. With all due respect, I don't think you really understand what it takes when you have a business that is having to shut down. I mean, you all are getting your paychecks every 2 weeks, and these people are not, and they're seeing their family or their longtime employees having to go hungry, and that is really hard. And with all due respect, I don't think you all understand that completely. Let's see, the other one of the other things is the ICU beds. There was a brief discussion about that and how many other cases are, besides COVID, are in the ICU. Now, that may not be publishable information, but if we have 28 beds, are 8 of them already occupied? It'd be just kind of interesting to know. And I guess we only have 1 hospitalization now, if I heard that correctly. I might be mistaken. The other part of it is, I know plenty of medical personnel, and they are extremely stressed, and I really wonder what type of mental health support that these people are getting. I don't think that should be overlooked. There's obviously a lot of mental health and anxiety issues that are going on, and it's one of the casualties of this COVID-19 that I hope is also not just going to be ignored. And I need to comment on Supervisor Madrone's comment about your breath is a deadly weapon. I think that when people hear that people just instantly dismiss everything else you say. because our breath is not a deadly weapon. And
well, on that, that's 3 minutes, Uri, but thank you.
Okay, well, thank you so much.
Thank you. The next caller has 3053 as your last 4 digits. If you could please press *6. 3053, please press *6. Thank you.
Sorry about that. Thomas Mulder here. I just wanted to increase the idea that Rex was bringing up, improved dashboards. You know, if we knew we had 50% of our ICU beds used at a certain point in time, or how many people were in the hospital, people might think about traveling less or something like that. Think that we've asked for 3 months now to update actually probably more like 6 months to update the dashboard so we know how many people are in the hospital at a certain time, so that way people can make personal decisions about how they would like to move forward. Hey, we got it. There's a lot of money that came in from the state. I actually, speaking from the state, it was interesting that Gavin Newsom, our governor, is trying to heckle some of the sheriffs that aren't imposing his order, but he had a problem with the president trying to hold back funding for sanctuary cities. So it's kind of half full. Also, I'll tell you that, you know, we had our cases spike. Look at what the governor did. He went out to a luncheon with a bunch of people unmasked, and then right after that, our case count spiked heavily. So if the government is going to say this is serious, their actions need to show us that it's serious. So that way, normal people see, you know, high up people doing things. And I don't know, just something to take into consideration. I would also like to know, what is the repercussions for a business that's going to lose everything they have to say, you know what, if we hit this next tier, they refuse to close. What's the sheriff going to do to those businesses? Thank you for the opportunity to speak.
Thank you, Thomas. That brings us to the next caller, and that is with the last 4 digits of 5896. If you please press *6. Welcome.
Hi, good morning. My name is Sonia Levy-Boyd, and I'm calling in as a community member. And I just wanted to take a moment to thank Dr. Frankovich for all of her service. She did a tremendous job keeping my family safe and our community safe in the last 10 months. So thank you, Doctor.
Thank you very much, Sonia. Appreciate that. The next caller is 3906. 3906, if you could press *6. You will be able to speak with the board. If your last 4 digits are 3906, please press *6. There you go. Welcome.
Hi, my name is Sina Marino, and I'm a community member of Eureka. And I had a question that has come up for me about the vaccinations that are going to be given primarily to the first responders or essential health. And I had heard an interview by a nurse. She was a Black nurse, and it was on NPR, and 3 of her relatives had died, and she wanted to know what she could do about it, and she got the vaccination. But for several days, she had very strong symptoms and was debilitated. And my question was, if they're going to get the initial vaccinations, will they be able to go to work? And will they be able to spread the bacteria or the virus to other people if they did go to work once they get these vaccinations? Because if everybody, all the ones in our hospital got the vaccination the same day and then they couldn't go to work for a week, that would be disastrous. And that's my question. Thank you.
Thank you, Tina. All right, we go to the next caller, and that is the last 4 digits of 4450. 4450. If you would press *6, you can be on the line with the Board of Supervisors. Welcome.
Good morning. This is Joan Romo, And I would like to put an agreement with URI that our health is not just physical health. It is mental, emotional, spiritual, and physical. And that's a concern that I have also as far as what's going on with the mental and emotional and spiritual health besides the physical health. And I had that same question as far as why are we not being told how many are in the hospital and how many are in the ICUs instead of how many have been. And I finally, several months ago, found that information in the LA Times. And the LA Times, if you Google it, has Humboldt County, and it tells us since April 7th, clear up to December 6th, because they're about a day or so behind, exactly how many people we've had in Humboldt County in the intensive care and in the regular hospital. And according to that data, since April 7th, we have had one day, April 16th, where we had 4 people in the ICU. Since April 7th, we had 8 days of 2 people in the ICU, and all the other times we have had either 0 or nobody in the ICU. And the latest time that I looked at the LA Times, as of this morning, it said we currently have 1 person in ICU and 6 people in the hospital. That means only 1 ICU bed is impacted from COVID since this case has started. And that's a concern I have is, again, and when I called up to find out that same question about why aren't we told, and I was told again, because it's a privacy law. I'm going, then why is it not a privacy law to know how many people have died, how many people total have been in the hospital, how many positive cases we have, when that in itself is still only a number. It is not identifying who, it's only identifying the same type of total numbers that we've been told with everything else, except how many people currently are in the ICU and currently in the hospital. So right now, currently, if you go to the LA Times, they have it on a daily basis, and they even have their information on Saturday and Sunday. They don't do it just Monday through Friday. And so they've been doing it every day. And so if they can do it in the LA Times, why can't the Times Standard, why can't our Humboldt County report the same information to us? Why do I have to go to the LA Times to read something about Humboldt County information that should be posted locally so that we know exactly what's going on with the numbers? Thank you.
Thank you, Joan. The next caller is got the last 4 digits of 7454. Welcome, Kent.
Estelle, Kent Sawatsky here. I do a lot of studying of people. And when I'm traveling out and about, people are learning how to speak with their eyes. And I think that's a wonderful thing because their faces are covered now and eyes can be very expressive. But, I think that there are people, and I don't want to say maybe vain. I've seen some people that won't wear their mask. But to me, until an example is set, and the example would be set by you folks, whether you're in your room by yourself, not having a problem with people around you, to be wearing those masks, to say it's just okay to cover your face and speak with your eyes. Until that precedent's being set by all the people on the screen that I'm looking up and watching at this meeting, and I'm not picking out any one person because I didn't see anybody wearing a mask that I recall seeing. I would ask you to consider that as an option. I'm not going to echo the Uri's or Joni's or any of those people comments. I think we've heard those. They're legitimate. I don't see any HIPAA problems at all regarding, as long as you don't mention the person's name or how they can be identified in any form or format. I find it very distressing that we can put someone on paid administrative leave for 18 months and pay them $600,000, or as another agenda item, spend $225,000 or $250,000, but we can't bring our technology up to equal level as Del Norte. Our computer systems here are terrible. They're hard to access. The whole system's antiquated, and the money needs to be spent in some of those ways. I did want to say, lastly, that it's so sad that we were thrown under the bus by Humboldt State, because we would have all those nurses that we would need right now, either trained in our community, being here working for us, that we may need in our community, or we coming back home to be where they were trained and had a good life and and families and things here. So that's really sad that we were thrown under the bus. I still will continue to support, maybe we can further support the nursing program at Humboldt State because they're needed right now. That's about all. So thank you for my opportunity to speak on these topics.
Thank you, Kent. Let's see, we have another caller. That's 4909. 4909, if you would press *6, you'll be able to speak with the board. If your last four digits are 4909, please press *6. Welcome.
Hi, thank you. This is Jessa from Fortuna, and I just wanted to take this time to thank everybody, the sheriff and his department, the public health department, the officers and all their staff, and the board of supervisors. I know it's been a really hard year, and you guys have been all working very, very hard and dealing with a lot. And I just wanted to say I really, really appreciate it. Thank you all.
Thank you very much, Jessa.
Thank you.
Okay, let's see. Any further comments before I close public comment? Give you one last chance to call the number and press *9, and then you will be brought into the discussion. We do have one, 4254, 4254. If you could press *6, please, you can speak with the board. Welcome.
Good morning, Estelle and board. This is Lelania Dubois, and I just wanted to say what a privilege it's been to hear this conversation. And as a human rights commissioner, I really have empathy with what the sheriff was saying around clear direction, because we also have been getting emails around masks and human rights issues as we've heard this in this discussion. And we're looking forward to having some clear direction from our governor as well as to how we can help support our community around that. Thank you so much, all of you, for this conversation.
Thank you, Lelania. All right, I believe that completes public comment at this time. So I will bring it back to the board, and there were a few issues that were brought up that I hope we might get a little clarification on. Does anybody have some comments based on public comment? Supervisor Bass.
Thank you, Madam Chair. Yeah, it was interesting. I had heard about Sina had mentioned people being sick and wondered if that was going to put people out of commission. And I've been hearing, I listened to a different station this morning myself, I think it was CNN, and someone who had taken the vaccine actually just mentioned mild issues with it that really did not impact except one day where they felt kind of off. So I'll be interested, I think it's gonna be different for different people, but I'd be interested to hear what the doctor thinks. And I did want to remind folks that just because one ICU bed is full now, because people are in the hospital, it is often the time that the people who are in the other hospital beds might move over to the ICU beds. So I would say that number, I think, could change pretty rapidly. And so those are my comments, other than, I have my mask on my arm, and no, I don't wear it in my office when my door is closed. But if you come around here, you'll see everybody pretty much wearing their masks as they walk in the building. So I appreciate Kent's comments there, but we are all very careful, but probably in our own room, maybe not. And if that is suggested by the doctor that we should be wearing them in the room when we're alone, I'll do it. So that's it.
And also Supervisor Bohn, you had a comment?
Yeah, you can't get in our building without a mask. So just fully aware. Mm-hmm. Nobody can. So I can't, you can't, nobody can. So, and I think FDA has approved the Pfizer vaccine, so you're going to see it coming out. I just heard this morning early that the National Guard is contracting with a rental car agency for trucks and vans for distribution of both dry ice and vaccines. So it looks like we're going to hit the ground running. They're contracting. So those things are happening as we go. Madrone will probably get their approval next week with any luck. Johnson & Johnson probably in 2 weeks, and they're a single source vaccine. I heard this morning very early on a news broadcast that maybe in 3 to 4 months, this is the word I love, we're going to have a vaccine glut, because remember, we have 11 manufacturers making vaccines for this. And the thing is, Johnson & Johnson already has millions. Madrone has millions. Pfizer, they're making this stuff, waiting for approval on their final trials. So I think those are great things. And I think if anything we get out of this, I think we have to applaud again our local DHHS, our local health staff. I thank the sheriff. Education rather than enforcement, it goes a long way, and it allows the guys to go out there and do the job what they're signed on to do, is that's crime and violence, and educate the people to do this. And that's what we need to do. We heard a lot about the dashboard. I mean, go get a platform and then we'll put a link on there instead of the state. We'll link to our new platform. CR and Humboldt State have spent over $5 million putting in a new nursing program last year.
Right.
You heard St. Joe's mention today that they've hired 140 nurses in the last 14 or 16 months. I mean, we're gearing up. We're doing the right thing here. But I think in closing, when you talk about the vaccine coming, as Dr. Hoffman said, the vaccine's coming. We're at the end of the tunnel. Be like a really good prize fighter, everybody. In the fight on a strong note. Put the damn mask on. If you haven't been wearing one, put it on. Humorous. It doesn't make you look any smarter, doesn't make you look any stronger. I know there's 50 internet warriors out there that says the mask causes more problems than it does. I'm not hearing that from the health professionals. I mean, the 2 Bakersfield doctors from 7 months ago, I haven't heard from them. I mean, everybody, we have these little shots, but I mean, it's the right thing to do. I mean, I don't know. God, listen to the old redneck here. I try to wear one as much as possible, and I sometimes slip, but it will save somebody's life. And if it's your grandparents, yay. If it's me, yay. If it's, I mean, do the right thing. It's not that hard. As Hub said, I think Supervisor Wilson said, it's not that big a deal. I was actually somewhere last night and saw a socially distanced Santa. Santa had a mask on, and so did all the kids and the parents. So we can do this through the holiday, but you got to do it in Humboldt. This is tough, but skip this Christmas so you can spend the Christmas with your family next year, because there's no guarantees if you screw this up. I don't think we can say it anymore. And I think, and I'm going to tell you people out there, I think we have a commitment that our dashboard is going to improve, or we will find somebody, we will contract out to somebody just like Del Norton. We'll put those people on the front line and we'll contract out the dashboard so we have accurate information without violating any HIPAA rules or anything else. Because if we're not giving out proper information, there's no reason to believe anything we say. So I think the more information is king. Thank you.
Thank you, Supervisor Bohn. Dr. Hoffman, did you want to add anything in there, given the public comment?
Well, let me address Supervisor Bass's comments about vaccine side effects, and I think one of the callers mentioned this. We are aware of side effects from the vaccine. Of course, every vaccine has side effects, and this one is not different than any other one. When we stimulate the immune system to fight a virus or a bacteria, it creates the kind of scenario that in your body that is similar to getting sick, but you don't get sick. It just primes the pump for your immune system so that if you do see the virus in the future, your body will fight it off very quickly. So you cannot get sick from this virus, from this vaccine. You can't get, there is no virus in the vaccine. And so if you have a side effect from the vaccine, you cannot give the virus to someone else. It is not a live vaccine. Many people will experience mild side effects. I fully expect that. Anything from chills to aches to maybe even a mild fever. All of us who've had vaccines know that's pretty par for the course when you get a vaccine. Our arm hurts, soreness for a day or two. All that stuff is very common for any vaccine, and this one as well. We will be taking into consideration, though, that we are vaccinating mass numbers of people, including healthcare workers, and that, yes, there is a possibility that if we gave it, say, to a whole hospital staff in one day, might not be seeing all those people come back to work the next day. So we are going to think about that and rolling out the vaccine. That's been talked about greatly, and sort of cohorting people. So usually it's only a day or two at the most, and most people, even if they have those, they take some Tylenol or ibuprofen, they feel better. So we are thinking about that. And then the last point on masking, Supervisor Bohn, I really appreciate your support in that, and everyone here. I know everyone here believes in the masking, and so does the vast majority of our community. You know, whether or not we should go so far as to mask 100% of the time when we're out of our house is a discussion that's being had at a national and state and local level. I think that we don't have current recommendations from that. We're following the guidelines, which say if you're in an office by yourself, you can take your mask off as long as there's no one else in that office. Should that change? I don't know. We can look at those guidelines and see. I think that that's a lot of, you know, a lot to ask of a lot of people, but it might be the right thing. And there are some people who have suggested that much. I'd say, though, for the most part, if you are outside of your house and not in a private space, like a house or an office without anyone else around, you should have a mask on. If you're outdoors in a place that you can't distance from other people, you're hiking, you're walking, you're biking, you should have a mask on if you're going to be closer to other people. That is the request from everyone in public health right now. So we'll continue to look at our masking policy and make any updates if needed.
One final point that was brought up, Doctor, if you would, a question about people who are going to go ahead anyway and go away for Christmas. Advice for them when they return to Humboldt.
Yeah, so, you know, we plead with you, please do not travel for these holidays. We've seen the travel around Halloween, we've seen the travel around Thanksgiving, and that's what we're living with right now. So the ask is really do not travel. You might, if you work in certain areas, there could be repercussions. You know, certain businesses might not let you come back to work if you are traveling. You know, are there safer ways to travel? You know, I don't want to endorse this. It's not like we're saying go out and travel, but if, you know, let's say you have to travel for a very compelling reason. You have a loved one who's ill somewhere else, so you might not be able to see them ever again. You know, there's other essential reasons to travel. If you come back from that travel, I would recommend that you quarantine for 14 days. And quarantine means that you stay at home, that you don't leave your house for any reason, not even to go to the grocery store, not to go get food. People bring you food. You stay in your house for that 14 days. You can interact with your household members who didn't travel. That's fine. If they didn't travel, they can go out and get food for you. But anyone who did the traveling should quarantine for that 14 days. And they should try to get a test around day 7 to 10 after returning from the travel. Okay, that's the max. That sort of maximizes the amount of likelihood that if you were exposed on that travel, most people, the vast majority, would turn positive by day 7 to 10. And that's what we do with most of our contacts up to this point. We can't test everyone now because we're running into just too many cases in the community, but that's been our recommendation all along. It's 14-day quarantine, stay at home, and then get a test around day 7 to 10. And then I'll say on top of that, if you traveled or if you have had interactions with someone who you are suspicious or you know has COVID-19 and you interacted with that person and then you get sick yourself, then you need to isolate. And isolation is in your own room, separate from everyone. That means try to use your own bathroom, you close the door, and you only interact to get food or water or other amenities delivered to you, and you separate, and you wear a mask as much as possible, and all your family members wear masks around you as much as possible if they have to interact. And that's the difference between isolation and quarantine. It's important to understand these differences as we go into more and more community spread. But again, I think the bottom line is, please, please don't travel. This, like Rex said, let's be here for the next holiday. Let's have grandma and grandpa and aunts and uncles be here. It's almost over. We're almost done.
Thank you so much, Doctor. Really appreciate it. I know we went on long on this item, but I think it's important at this particular very important juncture. So again, thank you everybody, and welcome to the team, and thank you to everybody else involved in this teamwork to keep us safe and sane here in Humboldt County. So I'm going to go next. Instead of the next item on the agenda is public comment on non-agenda items. However, we have a special presentation on multi-agency consolidated emergency communications from the sheriff, and the presenter will not be available after this time. So I'm going to go directly to that item now. And again, thank you, everybody. So break has been suspended until we can get through this, and then we'll have a break. Sheriff, this is a presentation on that. Thank you.
Thank you, Chair. I really appreciate it. This is our opportunity to report back to the Board of Supervisors something that you all have authorized a couple of years ago, and that was, number one, an RFP for to have someone look at the concept of consolidated dispatch and an EOC within the county. And what we did is we partnered with Mission Critical Partners to conduct a consolidated dispatch study, and we have Jamie Young on the line with us. We would love to have Jamie kind of go over that consolidated dispatch study with you all, talk about what we learned from this, and give you the insights as far as what this actually will bring together. And so I would like to invite Jamie to address the board. Okay. And I apologize because Jamie does have a conflict at 11:30 today. She has another presentation, and I apologize for not properly giving her that notice about how long these meetings can go in the morning. So anyway, so she has a half hour, but I do also have Captain Brian Quinnell and Morgan Schlesinger, our supervisor at the dispatch center, available to answer questions if it goes beyond 11:30.
Well, welcome, Jamie. I see your list here, name on the list. I believe that you'll be coming into the panelists now. Is that correct, Ryan? We're getting Jamie in?
Correct, Chair Fennell. She just joined as a panelist.
Okay, great. Thank you. Welcome, Jamie.
Good morning. Can you hear me okay?
Yes, we can.
Wonderful. Thank you. And I am sharing my screen. Is that presenting itself?
Yes, it is.
Wonderful.
Yep, looks good.
Thank you, and good morning, everyone. Honorable members of the Board of Supervisors, County Administrator Nielsen, Sheriff Hansel. I'm pleased to be here today to give you this information regarding consolidation and staffing in the 911 Center at Humboldt County Sheriff. I apologize for my time increment this morning. I do have another presentation scheduled at 11:30, and as my partner is going to pick that up, I did want to devote as much time to you as I possibly can. So I'm happy to give you this information, and if I run a little bit over in terms of discussion, I'm hoping my partner will just pick that up and I can join him afterwards. See if I can move this forward. Thank you. Okay, so I am from Mission Critical Partners. Our company is a nationwide company. We are based in Pennsylvania, and we have about 120 consultants that work for the company that are all previous public safety administrators for the most part, or have worked in the ecosystem for some time. I've been in, my personal background is 40 years in public safety communications. I spent 36 plus years in the county of San Mateo here in the San Francisco Bay Area as the 911 director for 25 years of that 36 years. And the executive leadership position running a police, fire, and EMS dispatch center. Our county has a population of about 800,000 people, and so our comm center was quite busy. But we found that consolidation was one of the biggest attributes of the 911 center as we developed over that period of time. So I'm pleased to provide you with this information and the knowledge that I have in my team who worked on this project around consolidation and staffing. What we're going to present to you today is a high-level overview of the results of our staffing study conducted for the Sheriff's Dispatch Center. I will discuss consolidation types and options for you to consider, and then also offer input on a recent development that Oregon has made me aware of, which is looking at fire operations entering the Sheriff's 911 Dispatch Center. As part of looking at consolidation, we run the full gamut of looking at all of the risks and benefits for what consolidation brings. And so you can see it runs from technology all the way to governance and financial issues. The focus of this presentation is more about the workforce, how we staff 911 centers in the modern day versus what we did yesterday, and then what those numbers look like in comparison to industry standards and best practices. So one of the first things I wanted to tell you, and I listened to your COVID conversation, and one of the comments that resonated was that everybody's in this together, that there is no one city or county that isn't experiencing the same thing that all of you are, and their varying degrees of what that experience is. And unfortunately, that can be said for 911 centers when it comes to staffing as well. Staffing dispatch centers in this kind of period of time where public safety can be controversial is particularly difficult. And so it's not just a local issue, it's a nationwide issue. Like I said before, we're nationwide and we do staffing studies and help with recruitments all over the United States. And we have found that, when we look at trends and patterns for what is going on in terms of hiring and keeping 911 staff, it runs across the board. There is really nothing that really stands out. But what we can tell you in California particularly is that because we are the largest state in the union, we have particular issues with the competitive private sector when they are offering more salary and benefits to entry level folks coming right out of college in IT positions. And so we do have a lot of competition issues when it comes to looking at trying to take someone out of out of college that really doesn't know what they want to do for a living and morph them into a government environment. So we do have centers that do more for less money, which is part of the competitive nature. And we also have folks that generally just don't want to do a lot of work for when they can do less work and get more money somewhere else. And that was prevalent in my dispatch center. Some people just don't like the dynamics of a busy dispatch center. And something that's a little bit more manageable when it comes to workload and environment seems to resonate with them. This year, I think one of the bigger attributes that we have in terms of hiring and keeping staff is that California dispatchers became first responders in terms of definition with the passing of AB 1945 in September. That is a a starting point for California 911 folks for looking at marketing skills and being commensurate with their first responder partners out there in the street. I think that is something that is worth mentioning in terms of what it is that we can leverage in the future. But just to let you know that these are very competitive times when it comes to looking at the same kind of candidate pool, particularly in your environment where you don't have a lot of people coming in and out, particularly like in a large city or a Bay Area. Looking at the Bay Area here, we have about 200 dispatch centers that people can look to see what would fit them best. And so your area is quite unique. So you are not alone. To that point, you can see here that on this slide that I created, there's 440 911 centers in the state of California. Nearly 2/3 of them are small to medium large centers. And when the biggest obstacle is finding that qualified candidate, because they are processed through hiring standards, much like law enforcement is. And so finding those qualified candidates become quite the obstacle when trying to keep staffing up, trying to keep staffing levels up. But you can see here that in your region, you have Arcata, Fortuna, you have the sheriff's office, all having vacancies in their dispatch centers, kind of all looking at the same candidate pool, if you will, which becomes a difficult thing to do. I did want to kind of put this in perspective because I have been in the business for a long time and I have seen the changes that have come in our profession. And one of the things that I can relate to when it comes to staffing a dispatch center and consolidation, as you can see, back in when I was hired, we were really a clerical branch of the radio and technology services department. And so as technology changed, so did the responsibilities of the staff that were working in. So you can see that this picture, which was actually a picture of a comm center up here in Daly City in our county back in the late 70s, early 80s, you can see that the equipment is quite different now, and that the clerical approach to staffing a 911 dispatch center really can't apply anymore as we look at 911 dispatch centers going into next generation operations of 911, and we are much more operational in nature. So one of the first things that happened that brought us into a more operational environment was our shifts. 8 to 5 was not the staffing pattern any longer. We moved to 12-hour shifts. That was one of the first things that operationalized the 911 dispatch center besides the advent of 911. So when we talk about staffing patterns and things that haven't changed, one of the things that was shared with Mission Critical was that the staffing pattern in the dispatch center at Humboldt County hadn't changed since 1989, and then again in 2014, when there was one position added as a result of Measure Z. And that I think it's critical to look at the staffing pattern, and I applaud the Sheriff's Office for bringing a staffing study into the mix to look at the modern technology that really presents the opportunity to look at what the staffing numbers should align with. So as we move through the clerical piece and move into more modern dispatch centers, you can see that this screen is pretty typical, or this screen monitor array is pretty typical of what 911 dispatch centers look at on a regular basis, 12-hour shifts, sometimes 16 when they're mandatory, and looking at different data points coming in, mapping situations, live video feeds, surveillance feeds, and what have you. This is not atypical. In fact, it's becoming more the norm that another top bottom set is added. So there are 8 to 10 monitors depending upon the operation. So what this indicates is a call volume increase and with the technology advances, more responsibilities being added to the 24/7 operational environment. I can tell you that looking at the analysis during this study, that it looked as if a close to 70% increase of call volume has occurred over time since the 2014 measure up to today. So the weight of the workload is there on top of the increase of the workload. So when I talk about weight of the workload, for example, there might have been only 4 data responses that we may had to inquire to the state law enforcement network when we were running people through the databases. Today, Morgan's dispatchers, they are getting 16 plus responses on the law enforcement network with more to come as we sophisticate a lot of our databases up at the state network. So you can see that the call volume not only increases, but the weight of the workload gets more complex and continues to be added to this 911 operations center. So one of the perspectives to take into account is staffing when we look at what it is that the folks are managing in these dispatch centers. And when we look at our staffing analysis, we do a specific comparison about what the 911 center should try to achieve. And really what we're looking at is comparing our staffing to best practices and to industry standards. And right now we look at, there's a number of industry standards, and we look at what is most meaningful or what is mandated in terms of the 911 center and where they are, where they're at. So in California, we have one mandated standard, which is the Cal OAS standard that tells us that we should be answering 911 calls within 15 seconds, 90% of the time. And then there's also other mandates. Post does have a training mandate, 24 hours of training every 2 years for in-service training. And then there's also a nationwide association that also has a de facto standard for call processing. So we take those standards and say, and kind of reverse engineer it and say, how many people would it take to comply with these standards? So here are the NINA standards, here's the Cal OES standards and the POST standards. And to this day, I believe that a number of 911 centers do comply. Most all of California 911 centers have done an excellent job trying to comply with the Cal OES standard. And under the premise that Cal OES is the funding mechanism that provides us our 911 equipment, both software and hardware. So it is something for us to strive to achieve. And they work with us operationally if that is not the case. One more applicable standard that I use here, because we will be talking about supervision, is NFPA, which is the National Fire Protection Association. And we do use their standards, and they are used widely throughout the nation, but they also do address the role of a supervisor in a dispatch center. And basically, what we align ourselves with philosophically is that supervisors in the dispatch center should really come from the old paradigm of a working supervisor, where they are assigned a shift just like their subordinate colleagues and work a shift right next to them, where really they don't have the opportunity to adequately supervise. So working supervisors is really what we think is going to be something more of a past title. When supervisors can, they should relieve folks for breaks, meal breaks, emergency type situations, but really shouldn't assume a 911 assignment on a regular basis, because they don't have the ability to properly manage or supervise operations and then the people that are conducting the operation. So here's the current state of Humboldt County Sheriff's 911 staffing. The 911 Center has authorized strength of 9 full-time dispatchers. And that breaks down to 7 full-time dispatchers and 2 working senior dispatchers. There's 1 communication center supervisor. And customarily, there are 2 911 consoles that are staffed. They are staffed, they try to staff them 24 hours a day, but during low staffing periods, which has been recently, they have to decrease down to 1 dispatcher from 1 o'clock in the morning until 7 o'clock in the morning, Monday through Thursday. So you can see that there's a sheriff's channel position that is staffed, and then the call taking, which is staffed, but it goes down to 1 person during that period of time. I will tell you that at a minimum, 2 staff should be on duty 24 hours a day, 7 days a week, regardless of an official staffing study. It is really particularly unsafe for 1 person to be in the dispatch center running operations and by themselves for any period of time. I recently just finished another staffing study in Southern California where it was always just 1 dispatcher, and the stress is accumulative. It's pressing on them for the single dispatchers that they have to take a health break. They get, this was a college that I did it at. There was an active shooter situation. They were by themselves for, at least 10 to 15 minutes until somebody could get into the dispatch center. It's really not a safe situation for staff to have to go through. So I think that regardless of a staffing study, I think if anything resonates, there should be a minimum of 2 people in the 911 center at all times. Right now, staff works 12-hour shifts. So one of the calculations that we look at is really just what it takes to cover a 911 center. And it's kind of simple math, and it's probably a little bit too much in the weeds, but really at this point, to give you what it is that we calculated to cover a 24-hour shift with 12-hour shifts, 7 days a week, that comes up to obviously more than the regular FTE, which works 2,080 hours. It comes out to a little bit more since they are working a 44-hour work week. And really what it takes is we take those hours and we times it by how many hours a day that is required to be at a console 24/7. And the simple math just basically tells us that 8 full-time equivalents for 2 consoles with no backfill staffing. So this is just an equation that we used to use back in the day, was really the simple math that we had back in the day. So we've moved that into a more modern kind of calculation, so that the legacy calculation of just kind of guessing, because there was really no formula for us to use, was a bit more sophisticated. So what we know is a couple things. One is that right now, an average of 500 hours is being backfilled by existing staff because existing staff take time off. So the snowball effect is pretty prevalent right now, where when you have people that need to take vacation and time off, that backfill needs to occur by existing staff. When you don't have a extra help bench or other people that can come into the dispatch center that are highly qualified to work a 911 console, we're using our own staff to backfill our own staff. And that snowball effect has consequences. And right now, Morgan tells me that there's been quite a bit of sick leave or what have you because of different factors, but to the extent of taking FMLA, a number of her staff are up to are of maternal age, and she calculated up to 75% are using the allotted 6-month leave of absence under FMLA. while those are permitted and certainly acceptable, we're still using our existing staff to backfill those vacancies. So when we have vacancies, just because we have vacancies in the schedule because we don't have staff and we have to train and fill those seats, then once those seats are filled, we have leave that has to be backfilled, and typically at overtime, as I mentioned, using existing staff. And then we also look at a utilization factor, which says not only are they away because they take leave that they're entitled to, but they're also away for meals and breaks and training, and those seats have to be filled. You just don't get a meal break and just leave the console. So as it stands right now, Humboldt has a 92% utilization factor, which is pretty high, but that 8% needs to be backfilled by somebody in order to give those folks breaks. What that really means and what that translates to is an increase in staff is needed. And so I think that it's probably no surprise that, that leaving one dispatch center in the 911, leaving one dispatcher in the 911 center is not aligned with best practices. And it certainly can add stress to the one dispatcher that's there. So I think it's probably pretty obvious that more staff would be needed. The question really is how much more staff is needed. And so what we do is we take the calculation that says, if you don't have turnover, so if I just erased turnover and said that the dispatch center was adequately staffed and that what it takes to run a dispatch console 24/7 would be 5.2 dispatchers right up in here. So if I had all the staffing that I needed, it would take 5.2 dispatchers to run that console 24/7. Unfortunately, when people ask for staffing studies, it's because we have challenges, and so we have turnover. And our turnover is near 40% in the Humboldt 911 center. So when we're backfilling at the rate of 40%, then it takes about 7.3 staff required. And those numbers pretty much don't go away for, I think that the quickest time I've seen people get hired and turned over and retained is a minimum of 2 years. So, and that's if they're lucky. So 7.3 staff per console is necessary to fill the gap of that utilization factor and that 40% turnover factor. So you can see here in the chart that the consoles here, that even if we added the 0.33 staff that's needed to balance out those two consoles, it would take 13 staff, 13 line dispatchers to fill those two seats. We would recommend looking at perhaps from this allotment, making some lead positions that could be supervisory in nature when there is no shift supervisor around, or if the lead is the supervisor, then increase that number and then keep your manager position at that at the one that it is currently at. Whoops, I don't know what happened there. So in the wrap up for this particular one, when we look at the basic hiring, is one of the advents that we look at trying to highlight is overhire. And I know that can be controversial, but one of the things that we see in 911 centers is that sometimes when you recruit and you get applications, you get really good candidates, and you get really good ones that if I get 6 really good candidates, but I only have 3 openings, then the 3 other ones go to the competitors. So one of the things that we try to advocate for is whether or not there is an appetite to overhire so that we can get those 3 really good in the selection process to be hired, and try and be ahead of the curve as opposed to always trying to catch up to to rounding that corner. We seem to always be behind the 8 ball when it comes to hiring, and oftentimes what happens is that we are behind the 8 ball, we catch up I think in my 25 years, I can only remember maybe 6 months of being fully staffed in our 911 dispatch center when we did not have a recruitment going on. And so you can see that it's just a continuous process that occurs, and whether or not we can catch up through overhire would be an attempt just to find out whether or not it would be achievable. So we advocate for overhire when possible. We look at revisiting that working supervisor position because right now, even though it's critical staffing times, and we advocate all hands on deck for dispatch staffing, when it comes down to those, look at really taking that position and looking at them as more of a supervisor of operations and people, as opposed to working the actual console itself. We look at a phasing in of any of the recommended staff that is financially feasible, phase in over time to reach optimum staffing levels to reach those industry standards. And then another way to attract folks during recruitment is to perhaps look at methods of splitting the positions for just a call taker and just a dispatcher, as opposed to blending them into one position. Oftentimes what we find is that people are much better on phones than they are on radios and vice versa. So the possibility of them looking at different responsibilities as opposed to collective responsibilities may be more attractive. At this point, I'm going to break and ask if there's any questions about staffing before I move into consolidation.
Thank you very much, Jamie. Can you give us back the full screen so I can see everybody? That would help.
Okay, let's see how I do this.
Thank you very much. Yeah. Okay, any questions for Jamie on this presentation? Any questions or comments? I don't see any hands up there. Okay, Jamie.
Okay.
Is there any further?
I do have a couple more things to add here, so
okay.
I'll do them really quickly.
Mm-hmm.
Okay. I'm hoping. Okay.
Great.
Okay. So we're going to talk about consolidation now, and really basically one of the comments that I have about consolidation is that there's no better time to consolidate than in the era of technology. Technology technically was the one thing that limited consolidation, and that is no longer an obstacle. Most everything these days are going IP-based. Very sophisticated equipment allows us to lease fiber or provide our own fiber lines and connect in ways that we weren't able to connect to before. Some of the themes about the consolidation study that we did was that, and it was with all of the 4 ECCs that are in your region. There was a number of things that emerged in terms of trends, and they're probably no surprise to any of you that growth versus the amount of space that's allotted for folks, staffing vacancies, or mostly at most 3 out of the 4 centers. Infrastructure and wiring, we're in buildings, and this is not an isolated situation, but we're in buildings that just don't support the infrastructure, the IT infrastructure that's needed for complex operations. So you can see there's a lot of facilities limitations, and that there were just really a growth versus the amount of space issue. The one thing I will compliment the county on is that as the sheriff and the police chiefs looked at common operational themes and technology, All four dispatch centers share the same computer-aided dispatch center or system, which is usually a heavy lift, as a lot of people differ in their opinions about what they need from their CAD and their records management system. So you already have one huge obstacle out of the way when looking at consolidation. When we did our report, I chose to take an offering that said, look, you can do a variety of things when you consolidate. You can do a full consolidation, which means you take every 911 center in the county and consolidate. You can do a partial consolidation, and there's a couple of different definitions of a partial consolidation. You can do a co-location, which allows for the same type of infrastructure to be shared, but you might be divided by a wall. Or you can do virtual, and the virtual right now with the computer-aided dispatch system is something that is possible if it's not already in place. Or you can do shared. And again, there are many virtual or shared infrastructures where agencies use the same 911 system hardware or radio systems and what have you. So taking a look at that, we focused on the news that Morgan had provided me, which was looking at taking incorporating the fire dispatch into the 911 center. So the first thing just to comment on is that it's a shift in culture and mindset in the PSAP, or the public safety answering point. As the Humboldt 911 is a law enforcement 911 center, entering fire is a completely different operation. And so it not undoable, it's just a different mindset that fire operations has versus what law enforcement does. Typically, fire dispatch includes the ambulance correlation or dispatch of rescue squads for EMS responsibilities, and also includes the advent and application of emergency medical dispatch protocol in the dispatch center for dispatching the fire medical resources. What I looked at when we were talking about this was Morgan gave me some statistics. It looked like 16,000 calls overall were taken by the fire department. Basically, about 70 to 80% of those calls are typically EMS calls, calls for an ambulance or some sort of a medical response. So you can calculate that out to be about 12,000 calls. And then if all of those calls had the emergency medical protocol application, that's usually about 60% of those calls get that EMD application. You're looking at about 72 to 9,600 EMD calls annually, which is about 26 calls a day in a 24-hour period. So you're getting an average of about one 911 call into the dispatch center per hour that would need the medical protocol. The numbers that are not represented here are generally those calls that are, when you say only 60%, then what happens to the rest of these calls? Those are generally calls that are radioed in from first responders that say they need an ambulance or a medical response, or the jail, or some other qualified entity that does not go through 911. So looking at staffing, you'd have to take a look at what this operation would do. And I get into a little bit of an operational environment in the next slide, but you're really taking on a whole new discipline, and sharing folks becomes a little bit more complex. You can't necessarily share folks if they're not trained to be a fire dispatcher. So adding one full-time consul to dedicate to fire operations is recommended. That's the 7.3 people that would need to be added to the existing 13 if you were to take that 13 number that we recommended for full staffing and add it to that 13. We recommend that 2 emergency medical dispatchers to be on duty at all times. When I spoke with Morgan, she said that she intends to have her staff cross-trained so that everybody can at least answer the phones, which we support. Also, a body, whether it be an existing personnel or adding a person, one of the things that comes along with the emergency medical protocol is a formal quality assurance program, because they are applying clinical protocol, that they are audited to ensure alignment with the protocol, and that the alignment and the way that they arrived at the call type is a best practice. And then again, we talk about supervisors as now as you're making the operation more complex by adding another dimension to it, we still support the fact that supervisors need to be separate from the staffing calculation. So all of that to say is that if you were to move forward with a fire consolidation to evaluate the call answering impacts during the first year, to take a look at the QA scores to see if quality and quantity projections are aligned, to ensure that the level of service is what was expected for both the 911 calling public and for the fire agency that's being served. Last, one of the things that taking on consolidation means is that it's a project versus program. And when you're in project, there are a number of one-time costs that need to be calculated or projected. And in that, some of them are soft costs that are borne from existing staff, and then some of them are brand new costs, which usually includes the technology procurement and all of that, all of the requirements that has, which is licensing for software and testing and cutover. So it's just basically implementation and installation time. But a lot of the soft costs would need to be dedicated, a dedicated person that would be basically a fire operations specialist in the organization that would work with the fire partners, the fire department partners, to say, what are the policies? What are the communications policies that need to be developed? And then going down this list of what the one-time costs would be and how it translates over to ongoing budgetary increases of the existing 911 center. So when you consolidate, that it is looked at as being a cost saver at some point down the road, but we generally see the first 1 to 3 years, there isn't as much cost savings as we would like, because we're upstaffing to try and reach the staffing number that's desired. And then we're also kind of paying off our one-time costs. So there's a number of things that, very quickly, and I'm sure it's kind of hard to calculate, but as I conclude here, that the current staffing situation for Humboldt is really desirable to look at. Their 9 dispatchers are incredibly overtasked with overtime, trying to make up existing vacancies in the dispatch center due to leave and continuous turnover. I think that they've done a spectacular job keeping up with everything that they've been put in front of them, they've accepted. But I do think it's time for the staffing equation to be looked at and see if there's any room for funding to support them as they sophisticate. I will say that 911, the next generation 911 system, is moving into the state of California. The infrastructure in the state starts in Northern California next year. So what that brings is the ability for 911 centers to see video and hear audio, instant messaging, all sorts of multimedia functions that enter the dispatch center when you're operating off of that infrastructure. So your basic staffing needs, if there's any room for examination there, are needed. And then when you look at Humboldt Consolidated, again, there's just more people adding to it since fire is a completely separate operation. And I had a slide that kind of showed you the depth of technology that is completely different than what is used in the 911 center today for law enforcement. So you'd see that they are two disparate operations, but you would be able to affect some cost efficiency with the fact that you'd have cross-trained personnel and that be able to toggle those folks when looking at leveraging your staffing numbers. And with that concludes my presentation, and I'm happy to take any questions and just say thank you for the opportunity to present this material to you today.
Thank you, Jamie. Any questions from the board on this presentation? Supervisor Bohn.
Oh, there's Jamie. We got your picture now. Hey, thank you for the great report. Consolidation has been on my plate, as everybody knows, for about 8 years now. And I know with the recent uptick in pricing from CAL FIRE to over 300, it opened up another can of worms, and then the shortage of dispatchers. I mean, we had to implement a lot of things to basically attract the right people. We, pay wise and stuff. And I think we've come out really well because we were paying overtime to sheriff deputies to be up there. And so I just don't think it's where we're understaffed. So what I'm thinking is, now you're talking right now, you're just talking Humboldt Bay Fire and some of the volunteer fire departments and maybe Fortuna. Which fire departments are we talking about? Now, maybe I should go to Billy on this. And have we reached out? I know this will be the third report we've had on consolidation in the last 28 years. And every once in a while we get one department wants it, one doesn't, and we've got such a duplication of process. And especially now in this day and age where we can go virtual and have two different sites. So if one site goes down, we have another site. So it's almost like a redundancy line. So we do supply coverage. What can you, maybe Billy can give me, Sheriff Hansel can give me some info about who's involved, who's not, who can we get involved?
Yeah, I think, Jamie could talk to just how this consolidation study came together. Every Fortuna, Arcata, Eureka, and the Sheriff's Office all participated in this study. And then Humboldt Bay Fire was a part of it as well as looking at just how much calls for service Arcata Fire has, as well as County Fire. When we look at consolidating fire agencies, we're essentially looking at County Fire right now. They're the ones that have the need. They're the ones that are looking at going out to an RFP for services because of CAL FIRE and the services that CAL FIRE are providing right now. So this is something, again, that we've been looking at for years, like you said, Supervisor Bohn. Right now, things are actually looking okay with our county, law enforcement agencies. A couple of years ago, a lot of people were struggling with staffing. A lot of people were struggling with some technology issues and those kind of things. So the only chief that has looked at trying to look at the next steps and trying to forward on this conversation is Chief Day from Fortuna PD. Fortuna PD is interested in carrying on this conversation. Just had a conversation with them last week about it, as well as, like we said, Arcata Fire, Humboldt Bay Fire, as well as County Fire are looking at trying to look at options and what we can do for them. As this study, it's a 100-page study, as pointed out several times, the big benefits are that we can pool resources, we can share the technology, we can have operational efficiencies, and ultimately a savings in the budget. That's the biggest benefits from this. We don't have one facility that can take care of all this right now. And a part of this study as well is a combined emergency operations center. And so there's a lot of facts in this study that I think are good, but I think as far as, looking at the next steps, this board can ask me to come up with some kind of a report or study or a proposal to look at what it would take for our dispatch center to look at consolidating at least some fire services, whether it's County Fire, Arcata Fire, Humboldt Bay Fire, into our dispatch center, and what it would take to expand our staffing, technology, training in order to be able to accomplish that consolidation. Because I think over the next couple of years, I think we're going to have more of this. I think more consolidation is the future, pooling of resources, government resources, so we can share the costs and save money in the budgets ultimately.
And I'd like to add to that, Supervisor Bohn, that Fire Services Committee, we've been looking at this whole issue with CAL FIRE and how we're to provide dispatch for fire services. I like the idea of recognizing that you would need that extra console setup in order to have to some degree of separation with regard to fire, because it is a really different set of cases that they'd be dealing with. So in theory, I like the approach you've taken, really do. Any other, Supervisor Bohn?
Well, and I think if we dig down into this and do some more, I think from when I've talked to people over in Reading or Shasta County, Shascom has been pretty successful over there, and they've got Reading Fire. I think they have Anderson. They have the sheriffs, Reading Police, obviously. They've got a big, and Shascom is set up as a separate JPA with their board, much like, I guess it'd almost be set up like our SWAT team, or I'm not sure how, but I mean, everybody gets a piece of the pie, and I think the big thing is there will be no layoffs, because we can take everybody that's doing dispatch and more than keep them busy. And I mean, just recently we had, a few years ago, we had a tragic incident up in Arcata, and Arcata PD was trying to talk to 3 different departments. Could you imagine if they were all in the same room looking over their console going, what do they got going, and everybody be on the same page? And we're going to have more and more of these incidents. And if they haven't, that 10-second response time, they don't have to get in and try to get somebody else, especially if it's after 1 o'clock in the morning and we only have one person on. It's just, you can only answer the phone so many times and tell them to wait. So I just think there's a savings. I mean, I can tell you there's going to be a huge cash outlay to try to get this thing set together. But in the long run, the efficiencies, I mean, we don't have to buy 4 different boards when one runs out. I mean, we can update our equipment, one package. It just makes too much sense to me, and I'm not the one it should make sense to. I hope it makes sense to the people in charge that this would be the best way to, it seems to be the best way to serve and save the people we serve a little bit of money in the long run. So it's going to be hard at the beginning, but I think it just makes so much sense. And I don't know, maybe it doesn't. It just seems to me.
Supervisor Wilson? Go ahead, Jamie.
I will just say that having operated a consolidated dispatch center, and we brought fire in, we had 6 agencies back in 1992. And the success that they enjoyed over time brought the rest of the county in 1999, where to the point where they operate in what they call a boundaryless response, and that it doesn't matter what jurisdiction goes to the 911 call as long as it's the closest paramedic engine that goes to that call that can limit that response time. They've been doing that operational methodology for 25 years. So now that it's ingrained in how it is that they do business. And I can say the same for law enforcement. Law enforcement, we operated 8 different law enforcement agencies, including the sheriff's office, and they run seamlessly as one team when it comes under one common operating picture, which is the dispatch center. So I couldn't agree with you more that when you have centralized operations and everybody can see that in the mobile environment, it starts at the 911 center.
And Jamie, just to follow that, have you ever seen one of these blow up the other way? 6 agencies get together and say this isn't working at all and completely blow up? Or?
Sure. Now, I mean, I do think consolidated operations generally stay intact, but there are customers that leave. Even in California, one of the agencies down south, a fire agency, has had people leave consolidated environment because it wasn't meeting their what their agenda was. So that happens. Deconsolidation does happen. And usually it's a governance issue. We'll say that it's usually people in the governance. It's not the boots on the ground that really have a problem. It's the governance that has a problem trying to
always a problem.
Through the issues. I say that candidly only because that really is the theme that emerges, but it's generally not an operational issue.
Thank you, Jamie. Supervisor Wilson.
Thank you, Chair Fennell. I'm not totally sure, I mean, whether we want to talk about this before or after we get public comment, but I guess I'm kind of asking what are the action items? Like I concur that I believe that consolidation is the right direction to go in. So, but that is a thing, and that's a project in and of itself to do something like that. It involves, coordination with our HR department, and it coordination with other agencies. It involves those sort of things. And so, as you mentioned, there's the fire, our fire subcommittee that we have might be a good place to have some of those discussions. Or do we create a working group, or where might we go from here to actually take action to kind of move in the
That's a great question. It is multifaceted, as you say. So we would recommend that an implementation process be set up. If you were looking at moving to the next step, there are different sub objectives that go underneath that implementation committee. You have field operations, you have dispatch operations, you have not only just human resources, but you have the contractual issues of governance and whether or not it's going to be a JPA or if it's going to be intergovernmental agreements. So you have the governance issue to discuss. You need to bring in bargaining units, the different bargaining units, and bring in labor and the ones that are going to be doing the work. You need to bring in the IT specialists because, again, you're bringing in and merging technical specifications. What Fortuna may do might be something different than the sheriff's office does, and how do you bring those two technologies together? So if there's integration that needs to occur, or looking at how to operate things differently, all of those things need to be discussed and planned for. It's quite an undertaking, but I will say it's very doable if a timeline is provided, because you want to set what the sufficiencies are going to look like. So if the objective is to start looking at economies of scale at 2022, you have 1 year to get through this implementation plan and start scheduling out what that implementation and installation would look like. Those are all things that we would recommend a full-scale implementation process. So every stakeholder is represented and is put on notice that this is moving forward.
Yeah, and just getting piggyback on that, the issue of covering fire dispatch is a pressing one. This isn't just something in the future. This is something we have to address pretty quickly. So, this is all part of the same discussion, but I don't think we can wait on it very much.
Well, there are things, there are always type of bridge solutions that you can put in place. Some things that are kind of the low-hanging fruit that you can work on while some of the high ones are being worked on. So maybe the governance issues are, those are usually long-term type initiatives. But if in fact there was some sort of a short-term contract where you were looking at, okay, we'll take on fire for 6 months. What is the basic requirements that we need to do that? Then that list needs to be put together. We need to integrate station alerting. We need to make sure our folks, our alerting mechanisms, mobile alerting mechanisms are in place. The dispatchers are trained. So that's a separate plan. from the long-term plan, but there are definitely temporary measures that you can put in place. We did a number of those as well because we did have pressing budget issues. And so you just look at the bare requirements and making sure that the private vendors that are involved can meet those deadlines, as well as the staff that are involved in the implementation plan.
Thank you, Jamie. Supervisor Bass.
Thank you, Madam Chair. No, I was really glad to see this on the agenda today. And I think while, going through the agenda item and hearing this, I think is a lot bigger than any of us, unless you were directly involved in it, even imagined. So glad to see the information. It's been past time and glad to have it in front of us. I'm curious as the next steps as well, like Supervisor Wilson said. And then in regards to, you can't wait, Supervisor Fennell, I do appreciate what you said, Jamie, because, we got to do it right or it will all fall apart. So I appreciate knowing what those incremental steps are, and more information on that could be helpful also. But I am interested also to hear the public comments, and so we can continue the conversation.
Okay. Well, I think at this point I will go to public comment unless there's any other questions. And I don't know if you have to leave, Jamie.
So far, so good. So
okay,
partners got it covered.
Great. Wonderful. Okay, let's go to public comment on this item then. And again, call the numbers on the screen. And if you wish to speak to the board, please press *9. If you have done that already, please press *6. And we do have one caller done that already. 7454. Welcome, Kent.
Well, you may not have any other ones because I just pushed the *9 just as we speak here. So, I was researching this during the topic a little bit, and I think Rex's number, I think it's 3. This will be 3 strikes, you're out. I didn't have the years down as Rex did there, but it's time to move forward. This it's moving, of course, at the normal speed of lightning that government works at. The technology's got to be there. I mean, I would assume that people, instead of calling 911, should be able to have the technology where they text in. You could have, let's say, one catastrophe and you might have 7 people reporting. Just show up text on the screen. You hit a little button with a standard response that many people have called this in, and services are on their way. So, to me, the technology should be able to facilitate this and also cut down on the cost and need for manpower. That's what it's all about out there. Anyway, I support you moving forward with this. Maybe you could expedite this one instead of expedite this one, since it seems to be moving at that usual snail's pace. And the need's definitely there. When I was making suggestions as far as saving money for the Arcata Fire District, that was one of the biggest ones because, again, Rex mentioned there, the Cal Fire just totally blew up through the roof as far as cost goes. They really didn't like the idea. And then all of a sudden, right in the middle of the conversation, they found out their costs were going to go up. And maybe now is the time to strike while the iron is hot and get her done. Thank you for my opportunity to speak on this. Good job, Billy. Good for being persistent on this one. Bye.
Thank you, Kent. And we do have another caller. And again, please press *6 to speak with the board. Welcome.
Hello, Dottie Russell again. I wanted to bring up a couple things. There should be some more callers trying to call in, so they should be on the queue about the Department of Education and what's happening to support the kids that are not getting through their education the way they need to right now, and what we're going to do about it. It's my understanding that the Department of Education had a stay on their grades, and so if they're not able to get online or turn in their work or get the help that they need, that they're not going to be all failing. Hopefully there'll be 2 other people coming to join about that comment as well.
Excuse me, Dottie, we're talking about the dispatch consolidation. We're not on.
I'm sorry. I thought you were on public comment. I apologize.
No, and just as a heads up, to those who are interested in speaking on items not on the agenda, that's going to come in a while. But we have to get through this meeting and we have to address what's on the agenda. So
right. I wasn't sure.
Thank you.
It looked like it changed. When the public comment is, do you have any idea? Yeah. Okay, thanks.
Thank you, Dottie. Okay, bye. So let's see, we have no further comment on this item. I'll bring it back to the board. Any Supervisor Bohn?
Well, I'm not sure. I got a couple ideas like Supervisor Wilson, but I think the first thing we have to address is our own backyard right now. It sounds like we have a staffing issue right now. And it's not going to get any easier if we're going to have 9/11 calls for COVID and numerous other things. I worry about other issues, that the mental health issues, family issues, domestic violence issues that this lockdown, perceived lockdown, proposed lockdown is going to bring onto people. And then you throw on the financial insecurities, it's going to get topped off on this. I think our 911 system is going to get overwhelmed. And it's not just they're going to be physically overwhelmed. I go up there and spend some time in the dispatch center quite often. It's a pretty high tense area. I mean, you finally realize, and it's got to take a while to unwind when you leave that situation. So I think we need to look at that. Do we have enough bodies? Do we need to get some more people? We need to talk to make sure that they're properly, and I don't know if they're not necessarily asking. I think we have to do this just as, I think this is an important part of our job to make sure that the one of the critical services we provide is covered, especially if we're going to meet that NENA, the 10-second, 15-second rules on 9/11. And that's, I don't know what that number is, but if we don't ask somebody and work towards fixing that, doesn't matter how many boots on the ground if they don't get the call.
Okay, any further comments? Supervisor Wilson.
So I'm still asking,
What action?
Yeah, the action, like how do we need to define that? And maybe what we should do is pull a few of us out in terms of at some sort of ad hoc to come back with some direction on this, because as Supervisor Bohn mentioned, there's kind of the long term, there's the short term. And again, going back to, I see Linda's on the Zoom here, but we would have to, we have this external study that's been done. I don't know if it's to the level that's required for us to really, be like, yeah, we're going to hire some people and move forward. We have a process, just like we've talked about in other departments, and we need to figure out whether we're, whether this is the right thing and all that stuff. So if there's I'm willing to work with maybe even Supervisor Bohn on this to come back with some recommendations.
Even Supervisor Bohn.
even Supervisor Bohn.
Jesus, you're not getting hauled to the gallows, for God's sake.
I know. It's like it's stepping up here, really.
I will accept that and get my pitchfork.
So what I'm saying is, it just seems like this might be. I just feel like there's some strategy that really has to get into this. And in the longer term stuff, we really do need to reach out to, if we're really talking about this, JPA or whatever it may be. And we all know that when we start talking about multiple agencies and the politics, and that was mentioned by Jamie in this, is important. And quite frankly, the egos and the vested interests of many years of people, and just they've got a lot of people have got a lot of into this in their communities, and bringing that together is not necessarily very easy. So, but nonetheless, I think we need to start down that track, and I do think we need a recommended path forward for that. And so I'm recommending that we put together a subcommittee to bring back some kind of direction on this, because I'm willing to go forward.
Is that a motion? Is that a motion, Supervisor Wilson?
It's an emotion, I think.
Thank you. Okay, we have a motion and a second. Any further discussion? Supervisor Bass.
I just wanted to confirm that that motion included that the members of that committee from our board are Supervisors Wilson and Bohn. Make sure that.
Okay, we have Supervisor Madrone and then CAO Nielsen.
I just wanted to say I agree 100% with the points that Supervisor Bohn has made.
Okay.
I'm feeling the love today. I'm feeling the love.
Don't get too close, man.
Wilson's also going to put in for hazard pay, but anyway.
We're on Zoom. Stay that way.
CAO Nielsen.
I would also like to recommend that you refer to this as a consolidated dispatch ad hoc committee, since it's short term, and you'll be bringing back some recommendations on next steps.
That's what my co-ad hocer said.
Yeah, Ryan, you got that?
Supervisor Wilson, I do have that.
Before we go to a vote, I just want to thank you, Jamie, very, very much. Thank the sheriff for putting this all together, and it's a good step forward. Ryan, let's go for a roll call on this item, please.
Sure. Thank you, Supervisor Fennell. And so I have to create a consolidated dispatch ad hoc comprised of Supervisor Wilson and Supervisor Bohn to bring back recommendations.
Correct.
Thank you very much. Supervisor Bass?
Yes.
Supervisor Wilson?
Yes.
Supervisor Madrone?
Yes.
Supervisor Bohn?
Yes, and I do want to thank the dispatch office under Morgan Schlesinger's for spending so much time overseeing the dispatch, but also spending so much time with Jamie to give such a concise report. That was another burden on our short office up there. So you got to give shout outs where they deserve it. So yes.
Thank you. And Supervisor Fennell?
Yes, and also thanks to Morgan. Great. Thank you very much. Appreciate that. Thank you for hanging in there, Jamie. I know everything seems to be going long today.
Sorry,
with that, we did talk about having a break at 11. It's now 10 past noon. We have a time certain of 1:30, and we have quite a number of items still to go. So I'm going to give us a half an hour, if that's okay with everybody. And we'll be back here at 12:40 and take off where we left off. Enjoy your break, and thank you very much. We have a lot of meeting materials still before us. Since I did say we would be back at 12:40, I'm going to take the opportunity right now to create the space for public comment on non-agenda items, and then we'll move forward with the rest of the agenda for today. So right now we're open to calls on items that are not on the agenda. Items that are not on the agenda, and please press *9 if you want to get in to do that. We do have two attendees with their hand. They don't have their hands raised, but they are in attendance. If you wish to speak on these items, please let us know. And again, that would be to press *9, and then you'll be moved to the beginning of the queue, and then press *6. Welcome.
Good afternoon, Thomas Smolder here. First point of clarification, I believe you skipped over items pulled from consent, but maybe I'm wrong. I've been wrong before. Usually
Thank you for that. That's a good call, Tom. Thank you.
So for items not on the agenda, I was driving in Garberville, went by that church. It's been said that people are aware of it, all those kind of things. It's owned by someone that frequently comments to the Board of Supervisors. There are many other properties that, in my professional opinion, are subpar that are owned by the same individual. At any point in time, does the county look at individuals that own properties that continue to be landlords and start looking at all of their properties? I would feel like if I wasn't managing my forest properly, you guys would be coming after me. So is there a way in which, to clean up our county and, help people that need help? Is there a way to enforce the rules that we have within our county, building codes, the health and safety code, to protect neighbors of those said properties that are dilapidated? Because it's becoming a public nuisance, health and safety violations, building code violations. I mean, it's a lot. So I would, I just drove today and saw that. It's like, hey, there hasn't been anything done about this yet. And I don't think this is the only property. There's one in Redway, multiple in Phillipsville. Like, maybe let's start looking at all the rules we have on the books and utilize those same rules the same way we do with other things that we try to do. So thank you for the opportunity to speak, and you have a good afternoon.
Thank you, Thomas. We actually do have another caller here, 7454. Kent, if you would press *6, thank you. Welcome.
Hey, Thomas, you leave my damn church alone. Just kidding, Ken Sawatsky. As far as full transparency go, that is not my church. I just thought I'd let everybody know that. That you're getting public comments probably on all these topics because when you have your disclaimer on the phone, it says public comment. You need a little bit more clarity there so people will start speaking on topic. Really ashamed to have this late in the day. So, I want hazard pay. And to deal with my hazard pay, I'm going to get rid of some hazards. So I initiate what I refer to as recalls. And when I get to a certain level where I don't think things are going right. So Supervisor Virginia Bass, your husband said bring it on before. You said he didn't have the authority to consider it on. It's time, for my opinion, for you to find some other line of work. And Rex Bohn. So I guess I'm going to consider you lame ducks now. But I think you should be lame ducks rather than lame turkeys. And some of the decisions that have been coming out of consistently off this board and some of the ongoings just want to make me go ahead and think of you as turkey. So you build your tombstones now. You're remembered for certain things as far as how you will be remembered in the future. Highly recommend you start looking more toward what you would want if you were to be treated in the same way. So just walk in somebody else's shoes, and maybe some of these agendas here will cease, and you will quit having large expenditures, 18 months of paid administrative leave and big checks. You really need to look. Now, the other thing I'm highly recommending is I think we will probably be putting on the ballot a new elected position, and I think it will probably be Amy's job there, so I think that should be elected. That'll hopefully go before the voters in 2022.
Oh, hell yes.
And we might fix a few things. I hope so, Rex. Quit interrupting me. That you quit just interrupting me, Mel. Please, Rex. You're trying to chill me. That's illegal. You're violating my First Amendment rights. So why don't you just shut up while I'm talking? Thank you very much for the opportunity to speak.
Kent, please. I'm sorry. Go ahead. Okay. Still have a minute. Okay. Thank you, Kent. Any further public comment on non-agenda items? All right. I do want to just say a note.
Fennell, Chair?
Yes.
I apologize. Mr. Sawatsky can go after us elected officials all he wants. He can crawl up my ass. I could give a damn. When he starts going after our hired personnel that work for this county who aren't elected, then I'm going to stand up for him if no one else will, because they are not moving targets. They are not his fodder to come after. If he wants to make stuff up about me in his little fantasy world, that's great. But he's not going to do it going after our hired personnel. I'm sorry, our valued employees. So I'm sorry. I apologize for the interruption. And I don't know how I can be a lame duck when I haven't even been sworn in for my next term, for God's sakes.
So, okay, well, these are trying times, you guys. We'll get through them. Let's see. I did want to say we don't normally respond to comments not on the agenda. They can be dealt with at a certain time, but I do want to say for clarification, because this issue has come up several times, there is actually a response happening to the situation in Garberville. Number one, there have been violations already issued, and there is more response in the works. That's all I'll say on that. That'll bring us back to the board. And now we're going to try and get caught up on some items before we go to our time certain at 1:30. So first item you know what? I'm sorry. Thomas did remind me I did not go to items pulled from consent. So thank you for that, for catching that, Thomas. And we had pulled an item at the request of Supervisor Madrone. So that was, I believe, was it 27? I'm not sure. Supervisor Madrone.
Thank you, Madam Chair. There was a couple of concerns. I think many of us got some of the emails. I'm not quite sure this item's ready yet. I noted that there was a pretty extensive letter from Legal Services in Northern California. And earlier in the meeting, we were talking about evictions and people on the streets and all this, but this is our attempt to try and be very fair to anybody that we might displace from housing for county needs, et cetera, like what we were going to do there on 4th Street earlier in the year. At any rate, they've submitted comments, and I do appreciate that our county council has worked with them and has answered many of the questions, but their most recent letter says that they still feel that there are items that are not addressed and that do not meet comply with the various acts that govern this. So that concerned me, and perhaps our council can speak to that. In addition, there was a comment that I received from the public that it would be nice to add a comment into the item. I don't have it picked out exactly where. Again, that's why I'm thinking maybe a continuance here. But it was basically saying that when we're looking at displacing of people, we need to look at the transportation systems that currently exist for those individuals. So, for instance, in 4th Street, they would be right on transit, right on a transit line. Whereas if we were to come up with replacement housing for them that wasn't anywhere near a transit line, and they were poor and they didn't own a car, then we ought to be considering that and trying to make sure that we keep them whole in regards to those transportation needs. So those were my primary comments, but perhaps Council Billingsley can clarify the legal services concerns. And then I would hope that the board might consider that minor amendment to be added in regards to considering transportation equity in displacement.
Right. Councilor Billingsley.
Thank you, Chair. And through the Chair to Supervisor Madrone. We did have quite a bit of back and forth with legal services over a period of months. I think we've hit a point now where obviously we responded to their letter. We've integrated everything we believe is necessary. And at this point, I think there's just sort of a fundamental disagreement on the legal issues. And this is a little bit of a continuance of the things that were disagreed about as part of the litigation. The attorney that's working on this, we've talked about it, and I believe we have a fully compliant policy. I would defer to staff because there are some sections in there that already deal with transit. I haven't had my hands on this, but they may be able to deal with the transit issues. But I have reviewed the outstanding issues from legal services, and I believe we have a proper policy in place now. Basically, we're just incorporating all of the state requirements. At some point, legal services may be asking for things that are in addition to what is required, but that is not what we have put in this policy. And there is also an alternative recommendation that the board can just wholesale adopt the state policies. That's an alternative if there is disagreement about the terms. But I would defer to staff to talk about the transit issue because I believe they are more familiar with it.
Thanks you, Councilor Billingsley. And let's see, well, maybe we should go to Sean, to Director Meehan.
Yeah, thanks, Chair Fennell. Can you hear me okay?
Yes, we can hear you just fine.
Great, thank you. So to Council's point about the transit, I have not had a chance, unfortunately, to review the letter or the comments that were received in great detail. So I really can't speak to that specifically as the policy goes. I will just echo the same sentiment that this policy is basically verbatim the state guidelines on relocation assistance. And so we believe that it does address what the state requires for this need.
Thank you, Sean. I know, yes, Supervisor Wilson?
Well, this is just a question for Sean. Maybe I just missed it, but I understand meets the state requirements, but the transportation call out, can you kind of, is that also within the state's requirements and just missed by the commenter that sent us that letter?
I think through the chair, Supervisor Wilson, I'd have to do a little bit more study on that as far as what the policy says. It is 50 pages. I'm not super intimately familiar with each provision in there, but we could come back to that and address it more specifically later.
Supervisor Madrone?
Yeah, so if this policy is basically verbatim from the states, but yet the county council said if we didn't like this policy, we could go back and just adopt the state policy. It sounds to me like there probably are some differences. I'm a little confused about that. So I guess what I would suggest, because we have such a huge meeting still in front of us today, I don't want to belabor this, would be that we continue this item. I would make a motion that we continue this item till next week so that we have a chance to look at options, the state one versus this one, and for staff to have a chance to delve into this transportation equity comment and the issues so that we can be responsive to the public. That would be my motion.
I'll second that motion.
Okay, we have a motion and a second. Any further discussion at the board level? Okay, seeing none, I'm going to go to the public for public comment on this item. Again, this is we're going to have a motion to continue it to next week. Caller number 7454. Welcome, Kent.
Well, I strongly support and I'm really encouraged that Supervisor Madrone pulled this one. Sometimes these groups have overly demanding things, but for someone who was involved in a process when I was managing a jewelry store where certain things had to be done for the tenants, when you were moving them out of there, you got pushback. And especially in today's age, especially with COVID, you may consider certain things, of course, consider the financial additional cost that it would be to help these people to relocate. You are moving people out of their homes, and I don't take that lightly. So whatever you can do to make the transition smooth and equitable for everybody, even going a little extra mile beyond the minimum that's currently required by the state, I think you're going to see all kinds of more things coming from the state for things like this, because of course they're talking about continuing a moratorium on evictions, and these things all kind of go hand in hand. So thank you for bringing this forward, and if you do continue that, I would consider some of those topics, maybe go a little bit extra. I think it's about time we did that for people who could end up being homeless or could end up on the street. So thank you for my opportunity to speak on this topic.
Thank you, Kent. All right, I don't believe there's any further public comment on this item. So I'll bring it back to the board. And if there's no more discussion, I'll go for a roll call vote. Ryan.
Thank you, Chair Fennell. Supervisor Wilson?
Yes.
Supervisor Bass?
Supervisor Bass?
I said yes.
Mike. Oh, go ahead. Your mic wasn't on. It's okay.
I'm all for it.
Supervisor Madrone?
Yes.
Supervisor Bohn?
Yep.
And Supervisor Fennell?
Yes.
Thank you. Passes 5-0.
Thank you very much. That will take us now to item H1, which is from the clerk of the board, appointment of a chair and vice chair for next year. Welcome, Kathy. Kathy Hayes.
I'm mute myself there.
Okay.
Good afternoon, Madam Chair, members of the board. Each year your board appoints a chair and vice chair for the next calendar year. The item before you today is for your board to consider appointing a chair and a vice chairman for calendar year 2021.
Thank you. Okay, thank you very much, clerk of the board Hayes. Vice Chair Wilson.
Good afternoon. So typically the tradition in this case is it's been tradition. We really do vote and it is in the discretion of the board to choose the next chair and vice chair, but there has been a longstanding tradition which has been amicable and seems to have worked out very well, that everybody kind of moves up the ladder in order of our district number, and it's just kind of been that way and it's worked out well. I'm asking this time, I'm making the request that even within that construct, which is purely amicable construct, that we consider just a slight change in that. Normally I would become chair at this point, and then Virginia Bass would become vice chair. What I'm asking for the board to consider at this time is for Virginia, for Supervisor Bass to become chair and myself to be vice chair, just to switch it for a year. And really, to be quite frank, it's COVID related, and not because I have COVID, but because I'm spending, doing many of these meetings from home. I've got a kid here that often can pull me away at a moment's notice, just from that, and I'm in the garage today, and sometimes I'm in the shed, and to be frank, like I can't even. Estelle, you have been doing an amazing job of just like holding it down in that way for 8 hours straight up. I just can't, with the stuff that's like bouncing around in these walls under these conditions. I'm asking for a little bit of understanding in that, and I've talked to Supervisor Bass, and she's willing to consider this switch in that. And so there you go. I do know that Supervisor Madrone in the past has had questions with relationship to the timing of when we do these things. And I know that he and Virginia are on a committee that talks about such items in terms of like process and those sorts of things. And so I don't want to get into that. I don't really, I don't know what their conversations are on that necessarily, but in understanding and in seeing this on the agenda, I did reach out to the incoming Supervisor Bushnell and asked just put it to her whether this was a reasonable arrangement. She said that it was fine and did not have an issue. So I just wanted to just touch base on that, just because of the timing of what we're doing here. And so with that, that's my pitch. That's what I got. Trying to keep it short and sweet, simple.
So Supervisor Madrone.
Oh, thank you, Madam Chair. I certainly appreciate Supervisor Bass and Wilson getting together and discussing this and trying to figure out what works best. And as I understand it, you'd be swapping years basically, and Supervisor Bass would be chair this year, you'd be vice chair, and then next year when it would be her turn, you would be chair and she would be vice chair. So you're just swapping a year out here, and that just makes a lot of sense. I also recognize that staff want to get this done now so that we can plan our year, get the proper names and positions onto all kinds of things, from the website to stationery to this to that and everything else. The uncomfortableness I had 2 years ago was that in our board rules, it clearly states that if there is a new member coming on the board, we're supposed to wait till that first meeting in January to make this decision so that they can be included. So I very much appreciate Supervisor Wilson reaching out to Michelle Bushnell and checking in with her And with that, I would make a motion to waive our board rules and go ahead and appoint Supervisor Bass as chair and Supervisor Wilson as vice chair. Just waiving the rules for this one item, that's all. And we are working on the rules. We'll be bringing those back in the near future.
Second that.
Okay. Well, that's actually a good move. I remember talking with Mike about what it would feel like to take this on if COVID was still in front of us. You know, it is a lot to do.
You're going to have to switch your background over. Virginia's going to get your background now.
Okay. Yeah, I'll send it to you. You don't have a green screen. You're just going to have to go in there. But anyway, we'll handle that. We'll talk about that. Supervisor Bass.
Thank you, Madam Chair. And since I come into the meeting office anyway, I may actually sit in the seat and be like, I don't have a green screen. But and I want to say thank you, Supervisor Wilson, for thinking of this situation that can be easier for you, but then also I think it makes sense. I guess, however, if I do disappear midterm, from a previous comment that was made today, you may have to make alternate. You may become chair after all, but that takes a little while.
It might be post emergency.
We're all going.
Yeah, no, that's very interesting times, and I think it's a good solution, you guys. And since we are going usually on that, it's just kind of fun that you switched it like that. I'll just put a good word in for Virginia. Virginia's been chair several times and chair on several other bodies and does a great job. So, you know, in terms of taking on a challenging year, I think you guys made the right call. Not that I'm saying you wouldn't do a great job too, Supervisor Wilson, but I understand the limitations of your current position with your family. So, alrighty. So, anybody else like to have anything to say on this before I go to public comment? Alrighty. So we'll go for public comment on this item, and we have one hand up, familiar one. Welcome, Kent.
Well, I'm very pleased to see this having gone in the way. I had the same concern that Supervisor Madrone did. Was my understanding it was to happen, and a lot of angst. But the reaching out to Michelle Bushnell, Mike, was just something that relieved all of my concerns on this. I think you're handling this perfect. Just as far as clarity, when Mother Nature initiates a recall, that means it's going to the voters. She doesn't do it like a recall action. I guess maybe that's kind of a guarantee. Virginia, you're still going to be there for the next 2 years and 1 month, no matter what, unless you decide not to be so. Just wanted to clarify that for you. And again, this is what I like to see, is a very collegiate approach and problem solving. And I think it's in the best interest of the county. Virginia's always been an excellent chair. And I think we're going to tune up a little things, as far as a few comments, not to chill people regarding litigation or using social media. Other than that, I have no problem, and I strongly support Virginia being the chair. I think Estelle's done an excellent job also, and so I wanted to bring that at this time, and I would like to thank Estelle for the manner in which she's chaired this during, as you say, difficult times. All times are difficult. Thank you for the opportunity to speak.
Thank you very much, Kent. We do have another caller, I believe, 3053. If you'd like to press *6, you can join us, the conversation. No hand. Oh, yeah, there you go. Welcome.
I actually didn't have my hand up for this, but just a point of clarity. So that means the 21-22 fiscal year, it would be, if you follow your board rules, it would be Supervisor Wilson chair and Supervisor Madrone vice chair if you're looking farther down the road. Thank you for the opportunity.
Maybe. No, you're talking about, thank you very much. So 2021, Supervisor Bass would be chair, and then in 2022, Supervisor Wilson would be chair. And that's it.
Right. And
Okay.
then based on the rotation, I would move into vice chair at that point.
Yeah, if you were re-elected for 2023.
No,
After that, I get to be
21,
chair.
22.
No.
The number, never
no.
mind. It doesn't matter.
No. Supervisor Wilson.
I just want to point out that the next year's chair and vice chair is not on the agenda, so we can have that conversation later, please.
It's on the record, though.
Okay. All righty. There you go. I think, is there any further discussion on that? Okay, Ryan, if we could go for a roll call, please.
Thank you, Chair Fennell. Supervisor Bass?
Yes.
Supervisor Fennell?
Yes.
Supervisor Wilson?
Yes.
Supervisor Bohn?
Please.
And Supervisor Madrone?
Yes.
Thank you. Passes 5-0.
Great. All righty. Congratulations and good luck. Let's see. We go on next to adoption of the 2021 state and federal legislative platforms. And this comes to us from the County Administrative Office. We have 20 minutes, by the way, you guys.
So Chair Fennell, I'll just turn this over to Deputy CAO Sean Quincy.
Morning, Chair Fennell and members. Good morning, Chair Fennell, members of the board. I have a quick report for you guys. On an annual basis, departments in cooperation with the CAO's office and our state and federal advocates bring forward the state and federal legislative platform. And before your board today is a 2021 version of that document. Essentially, each platform in this document is a plea advocating for changes to issues that are affecting the county. And the platforms are divided into state and federal sections, each of which is further divided into legislative and financial requests. The legislative platform covers a wide variety of topics in a generalized manner, such as public safety and economic development, and items become more specific as staff learns more about specific issues. Also, items are removed from the platform each year as legislative remedies are passed. After consulting with county departments and outside agencies and our advocacy firms, some of the new and noteworthy platforms in 2021 are as follows. We have several platforms around COVID-19 funding and flexibility around that. We have updated platform on the Klamath Basin and supporting dam removal. We have a platform around accountability, transparency, and behavioral health services in law enforcement. We have expanded platforms around sea level rise, and we have robust platforms regarding economic development and job creation. And we have several platforms around public safety and protecting us from emergency and wildland fires. The recommended action today, it's important for your board to provide input and direction into the legislative platforms as it is one of the county's larger policymaking documents. The recommendations before your board today include, the first recommendation is to provide input and direction to staff as desired regarding the proposed state and federal legislative platforms for 2021. And the second and third recommendations are to provide input and direction to staff regarding federal and state policy issues that should receive priority advocacy services. Those platforms, those issues are specifically in the agenda today, if you want to take a look at those. Recommendations 4 through 6 will adopt the legislative platform, incorporating any changes made by your board, and direct the CAO to submit the final versions to the county's appropriate state and federal representatives and stakeholders. And the final recommendation is to authorize and direct the CAO to submit letters to state and federal representatives as needed to support the county's legislative platform during 2021. The recommendation also authorizes the CAO to advocate on matters that are passed by the board by resolution. And these recommendations will allow the county to quicken the time it takes to respond to legislative changes. And once your board's modifications are incorporated, the County Administrative Office will finalize the 2021 legislative platform and transmit them to state and federal legislative advocates and congressional delegations. And so with that, that concludes my staff report. I'm ready to answer any questions or take comments.
Thank you very much, Sean. Any questions or comments on the state and federal legislative agenda? Supervisor Madrone?
Yes, thank you, Madam Chair. First of all, I want to thank Sean and the staff for all their incredible work in putting together this document. There's a lot of really good information there. It keeps getting fine-tuned each year and updated, and very much appreciate all of that work. I also want to apologize to you, Sean, personally, and anybody else. You sent this out a month ago for us to review. Thank you for that. I have to admit that I never got around to reviewing it. It's been a little crazy lately. So I apologize for not being timely with my input, because I know that you all have worked hard to try and be timely. So my apologies for that. I did have a few comments. I was hoping that we could make a few changes to this document, but I also know that staff would very much like to get it completed and moved forward here by the end of the year in order to be timely for the legislative sessions starting next year and things like that. So timing is of the essence here. I get that. My comments are in three areas. One was on the Richardson's Grove item. It talked about, last year this came up and there was actually some amendments that were made to this last year, and I don't see those amendments in this year. And I think generally the amendments were just saying that we weren't necessarily all agreed that we had open arms wanting to widen the road there at Richardson's Grove. And so there was some sort of an amendment made, and I don't have that language, but I do think that it's not quite accurate the way it's currently stated. And I have a couple of suggestions for amendments to that into the statement there. Things have changed over the years. And what I would add into it would be something like significant public controversy exists around this project and its necessity and potential impacts to old growth redwoods. That would be one comment that I would put in there. Another one would be, in order to strengthen our economy and protect public health, it is necessary that we take care of the roads we have, not try to widen everything to 4 lanes, creating massive landslides that reduce our roads' reliability. Reliability is more important than speed. So that's an additional comment there. And then another one would be, now that Highway 299 is Staw Truck widened, widening of 101 at Richardson's Grove is now less critical because we have an option for Staw trucks to get into our county. And then the last point I would make would be that a lot of local trucking firms actually benefit from this constriction. And I'm very much, as I know the whole board is, very supportive of local jobs. And so there is that kind of a nuance there that because of that constriction, local trucking gets a little bit more of that play. But because 299 is now STA accessible, it just seemed to me that we don't need to be so, the statement there, I basically don't agree with the statement there, and I couldn't support this platform with the statement as it is. And I'm not, that's not a threat or blackmail or anything else, just offering a suggestion from my viewpoint that I do differ on that one. The other ones have to do with invasive plant management, and the county has had a long-standing policy tradition of not using herbicides unless it was absolutely necessary and there was simply no other way to deal with a particular nasty weed. So in that one, I would add a comment that says, down below where Humboldt County supports, I would add, every effort will be made to use manual methods of plant removal, and herbicides will only be used in rare and extreme circumstances and with an utmost of caution. Additionally, Conservation Corps programs will be developed and utilized for invasive plant control and job training programs. So that's that one. The last one is on Redwood Creek, and I have to apologize. I don't have my suggested wording completed, but I would suggest that I could get it finished in the next day or two and provide that to the CAO's office and to Public Works, who covers that item. and make sure that we're in alignment with Hank Seaman and the CIO in the county on this particular one. So that could be handled by simply approving this item today with those changes I've suggested, along with the CAO and myself and Hank Seaman working out the language on Redwood Creek, just to try and update it and make it more current in terms of the current partnerships that are developing to do something there. So those are the primary changes that I was hoping that we could consider. And I know that's a lot, so again, my apologies for not having gotten this to Sean a month ago.
Supervisor Madrone, Supervisor Bass.
Thank you, Madam Chair. Actually, I guess this question is for Sean first, given what Supervisor Madrone said. Do you have the, I mean, I probably have last year's in here somewhere in the office, but do you have the language last year? You know, I mean, I'm just curious how it did change. So if you could drag that out or not. Oh, I see Amy's on now. So I'm just kind of curious because I really wasn't aware it changed from last to this.
For Richardson's Grove.
Yes, I'm sorry for that one.
So I will say I just looked up the first meeting in December and didn't notice any motion language that made that change to Richardson's Grove. So I'm wondering if Sean has other notes.
I don't have any other notes with me. I know that this did change from 2019 to 2020. The language as it stands now talks about completing the Richardson Grove project and allowing trucks into Humboldt County broadly, right, and not identifying the specific roadways that that the trucks would take. And that was a change from 19 to 20.
Right, more broad. Thank you, Sean.
Yeah, that was one of the things that I saw in that the county also supports efforts that would allow larger trucks into Humboldt County is actually kind of moot since they're already coming in over the north end. Oh. I don't know that it, but go ahead. Hold on a second, Supervisor Bohn. Just let us finish our sentences before you give us your thoughts, okay? So, yeah, I mean, I don't know that that is germane to this, but I do know that right now with Richardson Grove, there was a legal finding made that changes the dynamic a little bit between Caltrans and the people challenging it. And I know that they're looking into that at this point and how to move forward. So I don't know. I don't know that there may be some solutions found that will not be that troubling to people who've been opposing it. But anyway, I just want you guys to know that generally speaking, seems like it's what we had from before. I don't know that the language changed, but I could be corrected on that. The only thing I see different, that could be different, would be that we already have access to larger trucks. Supervisor Bohn.
I drove my first truck through that 46 years ago. I've got a little bit of understanding. If you think 299 is great, I want to know everybody from LA, San Francisco, basically the West Coast, for them to drive all the way to Reading and come across. You can do the mileage. You can do it on your MapQuest. The environmental, the output, the environmental damage that will cost compared to cutting no old growth trees. I mean, I don't know if any Mike might remember when you used to park at the souvenir stand right there in the middle of Richardson's Grove? They pulled in there with trailers and blocked the road. I mean, this does not affect, if you buy a piece of equipment and it comes across and comes into LA down south, or you buy it down south, to bring that up Highway 1, Highway 101, and then go over to I-5, over to Reading, go up 2,800 feet, go down to 1,100 feet, go up to 3,700 feet 4 times, and then come into Eureka to deliver that piece of equipment to Garberville, the costs are expensive. If you talk to Sun Valley, Lost Coast, Sun Valley cannot make weight. A 53-foot trailer will allow them. And again, I'll say the same thing. The trucks are the same. It's just a little bit longer trailer. And we just had this turned over just Friday in the Court of Appeals, I believe. One of the rulings just got returned over. I cannot support changing that at all. All that does is give us a different avenue to, we're spending all this money on 101. We're going to put a trail and everything on 101. Why would we put a trail out in Manila too for hiking because it's unsafe on the road when we already have a safe road? Because it gives them another opportunity, another avenue. And for people that live out that way, it's easier to get to. So I really, really think changing that, because one small group, I mean, not a small group, one group wants to change it, but I can guarantee you the majority of the working public needs this. Lost Coast Brewery can make weight in a 45-foot trailer, but if they're shipping it to the East Coast, they have to pay extra freight, because on the East Coast, they want a 53-foot trailer so they can load mattresses or something else, a bulk item all the way to the top. It's trucking is about what pays both ways, and that's what they end up paying. I don't think you'll find any manufacturing firm in the county or anybody that sells equipment that does not want to see that opened up. And the biggest part of it is safety. And it's not about speed. It's not about speed. It's not 4 lanes. It is about accessibility and the opportunity for our local businesses to excel at their best. And part of that is freight. And that's a big, big part of it. And I've heard this for 9 years. I lived it for 40 years previous to that. So, I mean, it's a big, big deal. And just to say this, you have to understand, if you get another 5-foot of trailer, that means you're going to be cutting some trucks out. You're going to have less trips in the safety factor. And then I saw the letter where it said Broadway's a nightmare. And I said, nobody's stopping about when they put every fast food restaurant and a stoplight every 20 feet. So that may be why it's a nightmare.
Thank you, Supervisor Bohn. Anybody else have input on this before I go to public comment? Yes, Supervisor Bass and then Supervisor Wilson.
And I don't know much about making weight and driving trucks, but I do know that prior to my time on the city council, seems like a really long time ago now. I mean, this obviously was a huge issue then, and I know the project has changed quite a bit since then. I know businesses who were not able, they'd have to get through, and they'd have to like offload to bigger trucks when they got through there. It just seemed like it did add a lot of cost to the transportation. The other thing I think about right now with 299 is I still don't think it's very reliable when it comes to being closed down. I mean, I had been stuck for 2 hours, during fire times. During this year, I think they've had a lot of work by Salyer, and so I'm not convinced yet that 299 should be considered the only way that we do this, and perhaps maybe that will change. But I'm kind of I'd be curious. I would, I'm fine keeping last year's language regarding it in here, knowing that we can change at any time. I mean, I would ask through the CAO, if one of us felt that there was a need to actually bring up a conversation regarding an item that is on a legislative platform that perhaps they wanted to have us take a look at, is that something we can do by just asking for a board initiated item? I mean, if there is future conversation on it?
Yes.
CAO Nielsen.
Yes. Sorry, Chair Fennell. Yes, this is your board's policy document. And so anytime throughout a calendar year, we can modify the legislative platform.
Right. And we have the agricultural commissioner here. I know that there was an issue also about vegetation removal. Maybe that's why you have your hand up, Joe. Welcome, Commissioner.
Thank you, Chair Fennell. Can you hear me okay?
Yeah, you've got a big echo. Maybe you have something to.
How about now?
If you better.
Better?
Definitely.
Chair Fennell, members of the board, I have no objections to the amended language that Supervisor Madrone has proposed. He is correct in that generally we are very circumspect in the use of herbicides. The language that he has suggested would preserve herbicides as a tool. We evaluate their use on a case-by-case basis and are very, very circumspect when we utilize that as a tool. So my office has no objections to amending that language to include something along the lines of which he has suggested.
Thank you, Commissioner Dahl. Okay, so those are those two issues. Any further discussion of this item? Supervisor Wilson.
Thank you, Chair Fennell. I know, for me, I would be fine with removing the items related to Richardson Grove for future discussion. I'd be okay with that. But also, I guess, what Supervisor Madrone offered was some language suggestions. And one of them was basically mentioning that the project is controversial. And I'm sorry, Jeff, you're both your items on again, your microphone or whatever. Anyways, and so, I don't think that's an accurate statement that it's controversial. So I think, adding that is fine. I do feel like we should have an update of this issue. There have been, I believe, changes related to this. From a kind of a couple of different angles. And so from my perspective, I think we need a fresh look. And then it was interesting, one of the statements that Supervisor Madrone talked about was prioritizing safety over speed. I think it's an interesting perspective to have, and to say it out loud is not such a bad thing. We sort of say it in the Safe Routes to Schools stuff. It's sort of, it's implied in some of these other transportation things. But I do believe that, we really need to start thinking about, the technology of transportation is rapidly changing, or has been changing for a long time. And our response as humans mostly has been to just let it happen. And it's changed our neighborhoods. It's changed, it's a lot of stuff. And it's all about prioritizing getting vehicle from one place to the other as fast as possible, and has been, up until very recently, not prioritizing the safety and the well-being of the neighborhoods that these transportation systems are moving through. And so I think that's something we should talk about. But nonetheless, I think that what was suggested to just talk about it, or to mention it as controversial, I think is completely reasonable. I wasn't so clear about the other suggestion that Supervisor Madrone put on there. Like I said, I'm willing to have this discussion later if we want to pull this section out and do it later. And I'm glad that Director Dolph was here to support some prioritization or reinforce our prioritization for non-toxic weed removal.
Thank you, Supervisor Wilson. Supervisor Madrone.
Yes, thank you, Madam Chair. Thank you, my colleagues, for discussing this. I see we're at or beyond the 1:30 time thing, and I know we still have a huge agenda. So might I suggest that we continue this item till next week, and I'll provide my comments to Sean Quincy at the county, and that maybe they come forward as just a considered options, right? So this comes back to us with the options of some of the language I'm suggesting. And then we could consider those options with it being written in front of you with some time to consider it over the weekend, et cetera. So that would be one way that we could handle it. So I would make a motion that we continue this item till next week to allow for time to develop these alternative statements.
I'll second that from the standpoint that I do think there needs to be more discussion. And wouldn't it come back to us anyway, Sean? It seems like before we send it and then it's come back to us.
Yes, in previous years when we've made changes at this meeting, especially when they are substantive changes, we've made those changes and brought it back to your board for consent. We've also talked about, as Supervisor Wilson mentioned, potentially removing the item, adopting potentially the rest of the policy document, bringing back this item individually by itself so that we can get the rest of the document adopted. It's another option to do, but obviously that's up to your board to decide.
Okay, thanks.
Thank you. So we had a motion and a second. Any Supervisor Madrone?
Yeah, again, I very much appreciate the work here. I have to say, trying to read through this document was somewhat cumbersome in the way it was laid out. It lays it out by department. And so there's a lot of redundancy and repetitiveness in the document because it'll say, well, this is an item Public Works is concerned about. And then down below, another department will have the exact same concern and the exact same paragraphs are there, et cetera. And it just seemed to me that we might be able to organize this differently, and maybe not this year, maybe next year, Sean. And this is just out of respect for a great document that I think could be shortened considerably and an easier read where you take, here's a statement on climate change and it matters to these departments, right? Rather than having all these things separated out by department, which creates a lot of duplicity, makes it hard to follow. At any rate, that's just a suggestion perhaps for next year. But I appreciate the opportunity to give you these changes so we can bring it back next week. Thank you, fellow board members.
Just so you know, we do have a time certain for 1:30, but there are several people with their hands up who wish to speak on this item. So I will now go to public comment on the legislative, federal and state legislative platform. Beginning with number 7454, if you can press *6, we can get your comment to welcome Kent.
I didn't have to read that document because Sean didn't send it to me. I participated in this process before. I think at other meetings or something we used to have. Maybe I'm mixing it up with something else I attended. I did want to give some input here. If it's not stressed in there, there's two main topics that I think should be some of our top priorities as far as especially the state platform. Number one is how to deal with fire. In other words, we need funding to do our fuels reduction. Maybe that's in there. But to reemphasize that, I think is one of our top critical items. The other one, as we're all probably painfully aware of, I hope, we're being lumped into certain categories regarding COVID, which is having a devastating effect on us. So I think a legislative platform should be, rather than us be lumped in with other areas, that the legislation and the governor be encouraged to treat each county separately and guidelines accordingly. That might make our job, people who are losing their jobs here, a lot happier, might make the students a lot happier who could have gone to school for all these months. And of course, now that things are ramping up, maybe not as much. But those are two priorities. And like I say, I have not seen the documents, but those are ones that I would underline and put in bold type in anything related to those. So you may consider tuning this thing up again in the future or in 3 months or something. But I think those are two relevant things of concern. Those are ones that brought to me by the people. So I guess the people have a little chance to speak here. Thank you for my opportunity. Bye.
Thank you, Kent. The next number in line is ending with the last four digits of 2528. 2528. If you would press *6, we can get your comments to the board. If your last four digits of your phone number are 2528, please press *6 and we can hear your comments. I'll make another call here. A person with the last 4 digits in their phone number of 2528. If you could press *6, you will be able to speak with the board. Okay, I'm going to go to the next number. And the next number is 5745. If you could press *6, you can be welcomed in to speak with the board. Welcome.
Hi, can you hear me?
Yes, we can.
Hi, this is Charlotte Carver. Thank you for the opportunity to provide input. I appreciate the conversation about extending the conversation about Richardson Grove to provide more opportunity for input from the public and just revisit it. A lot has changed, I think. As it's written, I feel that there's a lot of missing information and also misleading information and inaccurate information in the statement in this legislative document. It's called the Richardson Grove Improvement Project, which is definitely a subjective statement. It's really a road widening project through a protected state park. It also states that there are minor adjustments to the roadway, which is also a subjective statement. I think that there's a lot of revisions that need to be looked at in just the context or the information that's included. The other suggestions are important. It's controversial. I do think that when we're talking about what the impact of this would be on our local economy, we also need to consider other aspects of our local economies rather than shipping. I think largely the companies that would benefit from this are the bigger corporations rather than our local small businesses. I think that that's something that you should look more into. I also think that tourism is a huge part of our economy. This project would basically destroy the Richardson Grove State Park group campsite. I think that you should look very seriously at what the economic impact would be. And then of course, there are things that you can't measure, like our environment, the loss of old growth redwood forest, the loss of this part of our history, our culture. This is our redwood curtain. It's a very serious, very important topic that really deserves a lot more thought and public input. So I appreciate you continuing the conversation and providing more opportunities for input. Thank you.
Thank you, Charlotte. The next caller, let's try again with 2528. If the last 4 digits of your phone number are 2528, oh, there, well, no. Okay, so we'll go with the next one, which is 8689. Welcome.
Thank you, Chair Fennell. This is Tom Wheeler, Executive Director of EPIC. I heard the board have a lot of questions about what is the state of litigation. It is true that the Ninth Circuit reversed our previous win at the Northern District of California, but it only reversed on a certain number of claims, and we are still moving forward at the Northern District of California on our other claims. So on the federal side, we're still far from over, and on the state side, we have an injunction through the Humboldt County Superior Court and an order from the Humboldt County Superior Court to Caltrans to redo parts of their CEQA work for this project. Again, far from over. And this project has gone on for 13 years. It was first brought forward to the public in 2007, and it's been controversial ever since. I hope that it's time to move on from the Richardson Grove project because, as you'll see from all the commentaries, I don't believe that it can regain public confidence. I don't believe that this can be fixed. I think that we need to move forward in a cooperative fashion on other projects. As Supervisor Madrone and others have said, the potential need for this project may have changed in those 13 years. We now have SDAA access through Highway 299, because of the Buckhorn Summit project, which Epic did not challenge. And so we have two SCAA routes in and out of the county through 101 North and 299 that has largely obliviated the business community's need for the project. When this project began so many years ago, there was strong business support for this. You can see that has died down. This continues to, however, be controversial in the environmental community and the community of people who care about Richardson Grove State Park. So I'm asking that you just remove discussion of this entirely from the 2021 legislative agenda. I don't think that this necessarily qualifies as saying that you are opposed to the project now, but I think that the county taking a neutral position on this project is important. And I would love the county's help in trying to resolve this amicably with Caltrans and to try to start or restart a new process to examine what are our transportation needs in the county and how can those be best met. So I look forward to working with the county and with Caltrans in the future. We are good partners on the Last Chance Grade project. I'm going to go out in the field tomorrow with Jamie Mattioli from Caltrans to check out a new project. So we are going to continue to need to work together. And so I hope that we can just get rid of this controversial project now and forever. Thank you.
Thank you, Tom. The next caller is with last four digits of 9281. 9281. If you press *6, welcome.
Well, thanks. I'm calling because you just don't need to widen Richardson Grove. You got to bypass it. This is a big safety issue. I drive to the Bay Area a lot, and every single time I go through Richardson Grove, a beautiful grove, I hold my breath. Absolutely, because it is so darn dangerous. There is absolutely, you got trees that are going into the road, wide trucks that are going through. It's dangerous for the trucks, it's dangerous for the drivers, but it's dangerous for the people using the park and all the wildlife. Years ago, I remember going to Prairie Creek in Redwood National Park and the big hoopla to bypass. And I've got to tell you, with that bypass, just literally leaving the park alone, the park people are now protected. They can, be in peace as they enjoy the park. The elk are protected. They couldn't have done a better thing other than completely bypassing it. So by bypassing it, you preserve it for the park users and the wildlife, and you keep it safe for every poor driver from Humboldt County that has to go through it, or from Del Norte County. And everybody who wants to come up and visit us, it keeps it safe for them. So that's all I have to say there. This is just a safety issue, and we've got to get 101 out of the park completely. Thank you.
Thank you, caller. The next caller has last four digits of 0197. 0197. If you could press *6, you can be welcomed in to speak with the board. Welcome.
Hello?
Hello.
Hi. Okay. I'm asking that the Board of Supervisors remove Richardson Grove Improvement Project from the 2021 legislative platform. In a time of ecological collapse, we cannot be destroying any more undeveloped land. And for the future, I would like the county to start a countywide campaign for using less energy, recycling buildings and undeveloped land more efficiently, and consuming less in general. Again, I ask that the Board of Supervisors remove Richardson Grove Improvement Project from the 2021 legislative platform and/or take it off of the platform so that the community can follow up with it. Thank you.
Thank you. All right, we have at least one more caller, and again, I'll remind those who wish to speak on this issue to press *9. The next caller is 4369. Welcome.
Yes, thank you for listening in. I just wanted to add to what Charlotte had said. and some of these great speakers is that we like to refer to the Richardson Grove as our Golden Gate Bridge. And I don't see San Francisco taking down their Golden Gate Bridge. We are world renowned for our redwoods and Richardson Grove and Avenue of the Giants. And there are people that come from all over the world that have never ever seen a redwood tree. And they come to see that redwood tree, and they're in awe, and it might be their only time to connect with nature. And so I urge you to look at all the options to preserve. And we know that our young engineers are trying to find out ways to build roads that incorporate the growth of the tree with it. So the future is all of ours. Thank you for listening.
Thank you, caller. Let's see, I think that's the end of public comment. To just very quickly put out there, if you wish to speak on this item, please press *9. Okay, we do have one more, and that's a caller with 6556. Could you please press *6 on your phone? Welcome.
Hello, my name is Sherry Ward, and I agree with Tom and the people that want to keep Richardson Grove the way it is. And my point is, we have a deep water port. We can ship things. We're not cut off, and I think we need to really develop that. It's so important, and we can keep our remote status. We can keep our pristine, lives as much as we can. So anyway, Deepwater Port, I hope we can develop that. Thank you.
Thank you, Sherry. And I do believe that is the last caller on this item now. So I will take this back to the board. And we have a motion and a second. Any further comment on this item? Okay.
Can I have
Ryan,
the motion read?
Yes, I was just going to say that. And Supervisor Bass, actually, you have your hand up.
As one of,
go ahead.
I did give the second. If I recall, the motion was to bring the entire legislative platform back. But then I heard people talking about just bring this item back. So I'm hoping we can get clarity where we want to go with this.
Ryan.
So my understanding of the motion is just to continue this item to the meeting of December 15th. So this entire item would come back on December 15th with the motion on the floor currently.
Thank you.
I would then suggest perhaps to the motion maker, because I know Sean did say that if we pass the other items, then they could start incorporating all of that, which is a good idea if we don't have more things to bring up in regards to changes we wanted there. So if we're going to have this come back, can we just, I don't know if there's interest in just having the one item come back. I just don't want to have county staff holding back on things that they could be getting into the pipeline, waiting for us to come back with one item. So just a thought.
Supervisor Madrone? Your mic.
I have two mic spots. That makes it difficult. At any rate, I appreciate Supervisor Bass's suggestion, and I would agree with that, but it's not just one item. What I would suggest is that we approve the legislative platform as it's been presented with the changed wording I suggested on the invasive plant herbicide use, which Director Dolph supported, and I can provide you that language. I read it out. And that we bring back the Richardson's Grove and the Redwood Creek items for fine tuning next week. Does that work for you?
When you're talking about other items, are you talking about the other one that you had mentioned, the sides?
There's just three items.
Right. I just
Redwood
wanted
Creek,
right, and the herbicides and
Richardson's Grove.
Redwood Creek.
Yeah.
I'm
herbicides.
I'm
Supervisor Wilson, and I would like to remind everybody that we are now 20 minutes late on this hearing item, but go Supervisor Wilson and then Supervisor Bohn.
I just want to clarify process. So there's kind of two directions people are talking about. One is to separate out, approve a bunch of stuff and then separate out things and come back, or just bring back the whole thing with amendments and then we'll talk about it as a kind of a whole thing. I prefer the second one because I think it'll be less confusing to staff to not create two different documents. So I suggest that the motion be interpreted as bring it back with the suggested changes. We can hash it out at another meeting.
So that was the original motion. And so I will call the question, I think. Ryan, if you could do a roll call vote on the motion, please. Is that okay? Well, okay, seconder, go ahead. Do it.
Supervisor Bohn had a hand up somewhere right after Supervisor Wilson, and maybe I was wrong.
He was lying back. I didn't think he was.
Well,
Supervisor Bohn.
Well, I mean, the herbicide thing we're already doing, so throw in there what you want. Jeff Dolph said we're already doing that. So if you want to put a poster on that, a post-it note on there that says we're doing it, I'm fine with that one. Redwood Creek needs to be addressed. I don't know what he's bringing forward, and hopefully he's talking to all the people there in the Army Corps of Engineers. So I don't have a problem with whatever he wants to change to Redwood Creek, because if he doesn't do what's right, he's going to hang himself with those people up there. So I'm kind of okay with that one too. And Richardson's Grove, it's been on our platform for 10 years. The state is overturned, hasn't turned all of it. You are missing. It was, when it was first bid out the first time, it was a $2.4 million project, and 1.1 million of that was a retaining wall at Singing Trees. So it's 1.3 million to do this job. No old growth, no anything. Now we're using airspace. We're up over $13 million because of this, where we're trying to save money and spend our money elsewhere. And all we're trying to do is just come into the 21st century on getting access to longer trailers and making it safe. And it's not going to chase the tourists around because they have it everywhere else. So there's only like 42 roads that aren't STAA approved, I think. So with that, I say bring the whole damn thing back. But I mean, I don't have problems with anyway, and as much staff. And I really got to say, it is a little bit long. That's why we get it a month ahead of time. But I don't know how you compact what each department. I don't think we can minimize what each department's impact is on an item, because it's different viewpoints. They're not saying the same thing, but they all have different ways it affects them. And I like seeing the extra viewpoints. So I even though I don't like reading a document this long, I think these guys did a great job on it. So I really think that we could move forward with the way it is and approve the whole darn thing, but it doesn't look that way. So I'm more on second version with Wilson. Let's just bring the whole thing back if you want to do that.
Yeah, and I just would say very, very briefly about the length of the document. I think that the way it's put together is also to help our lobbyists, so that they can present the different packages to the different interest level at a different point, whether it's a specific piece of legislation, etc. So it's all, this is where you go with that, and this is where you go with that. But anyway, let me just clarify one more time for Ryan's sake and for all of our sake. Are we now going with the original motion to continue this item to next week? Okay. Correct. And that's okay with you? Great. All right. Ryan, let's go for the roll call, please.
Yes, Chair Fennell. Supervisor Wilson?
Yes.
Supervisor Bass?
Yes.
Supervisor Fennell?
Yes.
Supervisor Bohn?
Yeah.
And Supervisor Madrone?
Yes.
Thank you. Passes 5-0.
All right. Thank you, everybody. So now we will go to our time set item. It's a planning and building department item, and it is again an appeal of a planning commission denial. It's been before us before. I now want to open the public hearing, receive the staff report on the Maple Creek Investments LLC appeal. Director Ford, welcome.
Good afternoon, Chair Fennell, members of the board. Thank you very much. John Ford with the Planning and Building Department. Joining me is Cliff Johnson and Rodney Yandell to present the appeal of the Maple Creek Investments appeal of the Planning Commission's decision to deny a special permit for 27,025 square feet of cannabis cultivation. This is an application that was filed under Ordinance 2.0. The board considered this item on October 20th, and at that meeting there was a lot of public opposition to the item. And the board considered the public opposition, considered the requests from the public to see the site relocated to an alternative site, and continued the item and directed staff and to explore design options which would minimize, reduce the visibility of the site from Maple Creek and also Butler Valley Road, and also to address the development around the wetland, and then also see if it was possible to move the site to another location. There have been meetings on site with Supervisor Madrone and the applicant and explored various design options. Also looked at an alternative site that's not on this property, which was found to be infeasible. The applicant has worked on some design options, which were actually presented to the public at a public meeting. The public was pretty strongly opposed to even the design options. The applicant has submitted a request to allow this cultivation area to be relocated to another site. The way this would work is that it would be allow approval or require approval of the appeal, then approve the special permit with the condition that the site is approved to be relocated and that a covenant be placed on this property requiring that no future commercial cannabis cultivation be approved at this location. We are recommending that a condition be added, and we're recommending that the condition be added that would read, prior to issuance of any construction permits or initiation of cannabis cultivation on the site where the 27,025 square foot cannabis cultivation is relocated or permitted, the property owner of the subject parcel shall record a covenant precluding commercial cannabis cultivation to the satisfaction of the Director of Planning and Building. What this would do is put a permanent notice on this property that there would not be cannabis cultivation allowed here. But what this also does is allows basically the entitlement for this property to be relocated to an alternative property. So it's not being permitted as new cultivation, it's being permitted basically as a transfer of a development right, which is essentially what the RRR process does. So this would seem to be a win-win from the perspective of the community who wanted to see this relocated. The applicant has requested that relocation. The analysis has shown that the site meets the technical requirements to be approved at this location. And so what this really does is that it allows an accommodation to the community to allow the cultivation to be relocated to an alternative site. There has been some concern expressed by the public that this should not be approved. And so as an alternative, staff would recommend that if this alternative to relocate this to an alternative site is not acceptable, that the cultivation requested for this property be approved. The analysis has demonstrated the site can support 27,025 square feet of cultivation. Would be happy to answer any questions that you might have.
Thank you, Director Ford. Supervisor Bohn?
Well, and just so you know, I talked with Director Ford this morning about this. For one thing, I want to thank the applicant. I actually want to thank Supervisor Madrone, and I really want to applaud the applicant because the Dunaways, I've known the Dunaways for over 55 years. You know, Robbie, Mike, Kathleen the most. And they've been here a long time. They've been up in the valley a long time. None of them called me and played the friend card and said, hey, Rex, we really need this. We knew that. I didn't get a phone call, one from them. Everybody else I did. But now we've been able to say, okay, we're going to take a piece of property, and much to, because there's still a lot of grows up there, we're not going to grow on this piece of property. We're going to walk away from it and try to approve something else. And I applaud them for doing this. I think this is a good compromise. This is the only thing I've said is I don't want to look at it. I don't want to look at it. But I mean, they're surrounded by it already, but I guess they get along with those people, and that's fine with me. So I'd like to make a motion that we accept, and I'm sorry about all the public input and everything else, but I'd like to make a motion that we take staff's recommendation, allow the moving of this off of the property and the supplemental. They won't be able to grow cannabis on that piece of property in the future. I mean, everybody's got everything they've asked for. And if they want another piece of pie now, I think it's too late.
Well, Supervisor Bohn, I understand your desire, but really, as far as a hearing process goes, I think we do have to hear from the public before we, go too far down the line of making motions. So just hold that thought. It's very clear. Supervisor Madrone?
Thank you, Madam Chair. And it feels like a Share the Love event here today. Thank you, Supervisor Bohn, for your support for that. And I too want to applaud the applicants. I first worked with the Dunaways on their property 44 years ago on salmon restoration there, and have had a good relationship over those years. I really appreciate the way the community and the Dunaways have responded to this situation, and the applicant accepting this move is just phenomenal. You've made our jobs easier. You're doing the right thing by your neighbors and your community, and I fully support that. And once we get around to it, I would fully support the motion that Supervisor Bohn has put forward. I think this is really the best outcome that we could ask for here, and I very much appreciate the work on the part of staff in helping to negotiate this agreement. They put in a lot of personal time out in the field and on the phone and Zoom meetings and on. And I'm just really happy to see that process worked. Lately we've continued a lot of items and shoved them forward to wait for the neighbors and the community to come together. That hasn't always been successful, but in this case it has, and I very much appreciate everybody's efforts on this. So thank you.
Thank you, Supervisor Madrone. Any further discussion from the board before I go to your testimony from the applicant and the appellant? Okay, we'll go now to the applicant. When speaking, who is speaking for the applicant here?
Thank you, Chair Fennell. Brian Shields here. I'm the project manager for the Maple Creek Investments family, the Dunaways. I just want to, again, reach out and say how appreciative I am to have been now working on this project for, if you believe it or not, 4 years. Will be in about 10 days from when we originally submitted to start this out. So I'm greatly appreciative to Director Ford and Rodney Yandell, Cliff Johnson, and the various other staff members there at the planning department that really provided guidance and really helped us pull this together. Supervisor Madrone, it was a pleasure having you out there on site too. And I think that just like everybody's saying, we've come to an amicable solution to where we've quite honestly have taken shots from some of the members in the community. But, as the project submitted, it did meet all the requirements, but being able to listen to some of those more valid concerns and complaints from some of those members of the community and reassess certain other areas under the ownership of the Dunaways to relocate that 27,025 square feet. It just took some additional time. And here we are. We're ready to get to work we're ready for your final decision. And so again, just wanted to thank everybody involved in this, the various supervisors for their input and direction, as well as county planning staff. And really, that's all I have to say on this matter. I do believe we have Robert Dunaway and some of the other family members here that might like to chime in as well. So I'll turn it over back to the chair for their input. Thank you.
Thank you, Brian. Mr. Dunaway, would you like to add something to this, or Catherine?
Hello, Chair.
Yes. Welcome, Mr. Dunaway.
Thank you for the opportunity. No, just shortly, let me reiterate what Brian said. The family took to heart some of the valid concerns expressed by people that we've known for a very long time, and came up with a resolution that I think is in fact a win-win, as was described. I don't want to forget Supervisor Wilson, who also made the trek all the way out to Maple Creek to look at the site as well. I'm speaking on behalf of the family and saying we're pretty impressed by the way the process worked and the willingness of people to be involved. So thank you, and we're happy to answer any other questions that might arise.
Thank you, Rob. Anyone else from your side, the applicant side, who'd like to speak? Okay, let's go to the appellant. Is there anybody representing the appellant here who would like to speak today? Director Ford?
Chair Fennell, thanks. The appellant is the applicant.
Yeah.
Oh, sorry. Okay, sorry about that. Okay. I think that we've gone through that part of the process, so I'm going to open it up now for comments from the public. And so far, we've got 2 hands raised. I just want to say, if you are attending to speak on this item, you should press *9. We'll get in the queue. We have public member and then we'll get you in and call your number out. So this one is 7454. I recognize that number. Please press *6 to join in. Welcome, Kent.
Well, Kent Sawatsky, I really like to hear the term TDRs. I learned about that from Mark Lovelace. Is one of the best things that I don't think has ever been implemented in the general plan. And John Ford can correct me if I'm wrong about that. It enables someone to move entitlements or a process to another site. Hopefully a better site is what it is. And in the TDRs, you have something where you have places it's moving from to. So you have receiving in a TDR process. So I would assume that these, and this is a question you need to ask, and you may wish clarification and be part of your amendment, is this TDR, this transfer of this site, to be made to an approved RRR site? I would think that would be something you may wish to have in there. Or are you creating a new RRR site, which may have the complication? So I think this is a very relevant question. So rather than be moved to another site and have them go through this, highly recommend that it be moved to an existing RRR site to facilitate that, because those are already approved, have already gone through the gauntlet, and seem to have acceptance. I'm understanding there's a few out there still, I think, as far as availability goes. So that clarity is important. Again, I would hate to see it be in another site of this particular nature, where we don't have fire service, we don't have first responders, and again, someone signing one of these little waiver things, understanding it's not there, which does not protect the neighborhood or the other things as far as potential problems that would arise from not having those critical first responder services. So that's my comment. Hopefully that will go through under that guideline. And I guess that'd be a friendly amendment from the public regarding the motion that's made there, and maybe can get some feedback from staff on that particular topic. Thank you for my opportunity to speak.
Thank you, Kent. The next caller is got the last four digits of the 2089. If you would press *6, you can join in the conversation. Welcome.
Hi, this is Beverly Phillip.
Hi,
Hello?
Beverly.
Hi.
Hi, Beverly.
I wanted to just say that I went to the neighborhood meeting, and the Humboldt Bay Water District was there and brought up an issue that they have apparently submitted some sort of proposal to the county some time ago to protect the water in the Mad River, and that the county, as they said, has ignored it. And I'm just, I was opposed to this project, and I wasn't one of the people that just, didn't want to look at it, as someone said. I'm concerned about the water quality of the river, and it was really kind of shocking and disappointing to hear that what the Humboldt Bay Water District said about that. And I'm wondering, I know this isn't part of this proposal, but it seems like an issue that needs to be dealt with. Thank you.
Thank you, Beverly. Let's see. The next caller is has the last four digits of 3053. If you could press *6, welcome.
Hello, Thomas Mulder. This project isn't in my neck of the woods, but as a cannabis person in the cannabis industry, I'm just asking for some clarification here. This project, from what I heard in other hearings, was an existing project, but they missed the timeline to submit for existing, so they submitted for new cultivation. So now they are going to get the right for the RR, basically the RRR, which is already expired, that program, to move the proposed new cultivation to somewhere else. The board does have the authorization to just deny this project for community reasons or whatever, but I just want to make sure you aren't opening up the new, basically people out there that have new cultivation applications in place that are probably in a bad location, that now all of a sudden they're going to move that cultivation to another area, which also brings the impact to that neighborhood as far as traffic, all those other different things, whereas the existing, that was baseline. So I think staff's getting creative, and I appreciate that, but I just want to make sure you're clear that you aren't opening up the RRR program again, which has already been closed. Thank you for my opportunity to speak.
Thank you, Thomas. Okay, the next number is the last four digits of 1417. Welcome. You need to, yes, go ahead.
Hello.
Hello.
This is Victoria, and I am just wondering if there is a map that is provided for this new project, and if they've done all the necessary mapping and surveys for this seemingly new project location. Also, there's the EIR in this project is not updated to reflect the present amount of marijuana grows in the area. So I'm just wondering if the staff has looked into that. The fact that just a lot of marijuana grows now have been approved, and there has been so much public backlash, it might be good to kind of, step back and take a look for future development in that area and in the Maple Creek watershed, so as not to kind of bombard it with grows and kind of keep its beauty as well. So just the highest and best use for the area, which I do appreciate the fact that, they're wanting to move it to a different location, and that's wonderful, but is the amount still okay? 27,000 and having a big commercial situation out there when there's a whole bunch of other grows that have been approved, it's kind of like, what is the highest and best use for that area, the general welfare of everyone in the area, and the general welfare is defined as the happiness of the people in the area, and I think there's a lot of people that, still, even with it being moved, are going to be affected and unhappy with that turnout. So just urging you guys to take a look now and in the future. It's kind of like a KOA. You can't have a KOA within a certain amount of mileage from another KOA. So maybe it's time to kind of reevaluate and look at the environmental impact of how all of these approved grows are gonna be in the future. So thank you.
Thank you, Latanya. I'm sorry if I got your name wrong. The next caller is 0219. If you could press *6, you can join the conversation. Welcome.
Hi, this is Judy Wartella, and I just wanted to, I'll keep it short and sweet, but I just wanted to say that we really appreciate all the grueling hard work of the supervisors and the planning staff. You guys are amazing, and you have a really hard job. I do appreciate it. So we just want to thank you for all the efforts, and we'll follow up with some for cumulative effects, things with the Mad River. But thank you very much. That's all.
Thank you, Judy. Again, just before I close the public comment part of this hearing, I'll just put out one more time. If you wish to address this item, please press *9 on your phone, and you will be able to speak with the board. All right, seeing none, we'll bring it back to the board. At this point, I'm closing the public comment section of this and bringing it back to the board. Director Ford and then Supervisor Bohn.
Thank you, Chair Fennell. I do want to respond to a couple of things. First is the letter from the Humboldt Bay Municipal Water District. There are two things to consider there. Number one is the Humboldt Bay Municipal Water District actually withdrew their letter formally. And so that's really important. Their letter of opposition to this project, they've withdrawn that. They have submitted a request to have the Mad River watershed deemed as a critical watershed. That is on our work program. We will be meeting in the near future with the Humboldt Bay Municipal Water District to begin talking about what that process looks like. So that is something that is very much in process. In terms of the RRR program, Mr. Mulder is absolutely correct. That program has expired, but one of the things that we do is that where it's appropriate, the RRR, an application that was submitted before the expiration of the RRR program, we have used that. That is the circumstance here. So we're not setting a crazy precedent here that we wouldn't want to live with. We will be reevaluating the project when it moves to a receiving site. A comment was made about move to an approved RRR receiving site. There are only a few of those around. What the applicant has expressed the intent of doing is moving it to a site that they're already in the process with that will be coming forward shortly. So I just wanted to clarify those couple things. Thank you.
Thank you, Director Ford. Supervisor Bohn.
I'd try that motion again now that and see if we made any traction. I'd like to make a motion to accept staff's recommendation. And again, I want to thank the Dunaways for going to this effort. We're lucky that they do have a large land holding up there and can move and listen to the neighbors' concerns. So I make a motion that we accept staff's recommendation.
Second.
Right, we have a motion and a second. Any further discussion? Seeing none, we'll go to a roll call vote, please.
One question, did that include the supplemental information? Because I did hear that discussed.
Yes, I apologize. The supplemental is included at the request of the Planning and Building Director.
Thank you, Supervisor Bohn. And I can do the roll call vote now, Chair, if you're ready.
Yes, please, Ryan.
Thank you. Supervisor Wilson?
Yes.
Supervisor Bass? Supervisor Fennell?
Yes.
Supervisor Madrone?
Yes.
And Supervisor Bohn?
Thank you, yes.
Thank you, passes 5.
Okay, thank you very much. So we have two more items here. Let's see, well, there are several more items on the agenda. So we have, before we go to our next public hearing, we have two more items from the County Administrative Office, and this has to do with the first item is item H3, agreement with MGO and a supplemental budget request. CEO Nelson.
Thank you, Chair Fennell. First, let me start by saying there has been a lot of inaccurate information about the county administrative officer attempting to outsource or audit the auditor controller based on the recommendations contained in this agenda item. This is not at all the case. This is not an agenda item about outsourcing the duties of the auditor controller or an audit of the auditor controller. The county already has an external auditor that audits the books of the county. This agenda item and its recommendations are a response to an organizational change that is occurring. This is an adaptation to the work the auditor controller wants done in the organization. This is aligning how the workforce, in this case, the county administrative office, maintains compliance in a changing business system. And that changing business system is the auditor's office. The desk audit that is referenced in the agenda item is a component of the staffing study, which was directed by your board on November 23rd. Human Resources Director Lee is available to discuss the staffing study in more detail at the end of my presentation. The recommendations in today's staff report discuss contracting with MGO for interim financial advisory services. The items mentioned in the contract scope of work are items the county administrative office and other county departments are already working on. The only new addition is to provide assistance with correcting audit findings. For example, the scope of work states, working with state agencies and county departments to claim all allowable state and federal reimbursements, assisting with developing the internal service fund charges for fiscal year 2021, and developing fiscal strategies. The CAO, Human Resources, and Public Works all have internal service funds and provide services to county departments. And as a result of these services, charge departments. They prepare and charge departments. And these charges can be claimed to state and federal governments for reimbursement. Other departments, such as Health and Human Services, also prepare a county expense claim to receive state and federal reimbursement. The auditor reviews and approves charges and claims. We want the auditor's office to be satisfied and confident in the work product provided to her. The scope of work states developing financial policies. The county administrative office makes financial policy recommendations to the Board of Supervisors. Just a few of the financial policy recommendations that the CAO's office has brought to your board include pension funding, debt management, budget adjustment procedures, contingency reserve, general reserve, and deferred maintenance. Staff would like to continue the development of financial policies to ensure consistent financial practices across the county. There are many changes occurring in this organization, such as potentially budgeting trust funds, professional service agreements for smaller value purchases, changes in how we provide contributions to veterans organizations, and updating the chart of accounts, which requires departments to adjust their processes to reflect the auditor's changes. In particular, this impacts the preparation of the proposed budget book. We can do all of this, and we need immediate assistance in the short term through MGO, and in the long term, we need more staff. The scope of work also states participate in the Auditor Controller's Office staffing study in collaboration with Human Resources. The staffing study was again directed by your board on November 23rd. Regarding the recommendation to direct the Human Resources Department to conduct a classification review and develop classification specifications for the position of Chief Financial Officer. The responsibilities mentioned in the staff report fall to the County Administrative Office, and the role of the County Administrative Officer is defined in County Code. For example, in County Code, the budget is mentioned specifically and states the following: supervise, in cooperation with the Auditor Controller, the preparation of the county's annual budget. In this connection, review all departmental services and institutional requests and make recommendations to the Board of Supervisors concerning decreases, increasing, and other changes in the preliminary and final budgets. As your board is aware, the County Administrative Office prepares in collaboration and then presents the recommended and adopted budgets for your board. And the office then follows up with budget reports throughout the year. Included in the proposed budget and subsequent budget reports, the County Administrative Office presents to your board is also a review and analysis of the fiscal impacts of projects and proposals. For example, this includes a review and analysis of capital projects and supplemental budget requests. The Auditor Controller directs the accounting forms and methods of keeping accounts in the budget. The Auditor Controller is responsible for the chart of accounts, the line items where revenues and expenses are posted, and staff across the county defer to the auditor's direction on where to post revenue and expenses. Further, the County Administrative Office provides revenue projections and analysis, as well as overall financial forecasting. More specifically, see property, timber, and sales tax. The recommendation for classification work for Chief Financial Officer position is an adaptation to the systemic changes coming from the Auditor Controller's Office and aligning the workforce to maintain compliance with those changes. Human Resources did attempt to bring the classification work for the Auditor Controller's new positions to the board in a special meeting on December 4th. The Auditor Controller was not available on this date. However, this agenda item did contain the recommendation in today's staff report to conduct classification work on a Chief Financial Officer position. It should be noted that Shasta County has a Chief Financial Officer in the County Administrative Office and an elected Auditor Controller. Chair Fennell, I would like to turn this over to Human Resources Director Lee to share some additional information on the differences between traditional personnel management, which focuses on the maintenance of personnel and administrative systems, whereas Human Resources Management has a more strategic approach, forecasting the entire organization's needs and how this particular recommendation came to be.
Thank you, CEO Nielsen. Welcome, Director Lee.
Good afternoon, Madam Chair, honorable board members, CEO Nielsen's County Council Billingsley. Thank you for the privilege to be here this afternoon. Just to a quick summary, as discussed at the November 23rd meeting and by the adopted motions by your board, my office was directed to 1, return to your board with the classification reviews and positions as requested by the Auditor Controller. 2, provide operations realignment recommendations. And 3, provide analysis of a recommended staffing study. My office has done just that. And just to reiterate what CEO Nielsen indicated, I was ready to present this item to your board. But we look forward to collaborate with the Auditor Controller's Office to return the classification reviews of her requested positions at her earliest availability as soon as possible. To answer the questions, what is the difference between traditional personnel management and HR management in the 21st century from a transformational strategic approach? I'd like to kind of give all of us a context. The organizations as we are today, we operate in an environment that is full of complexity and rife with so many uncertainties. The ability for our organizations to navigate all of the demanding changes, whether it's an internal I'm sorry.
The exciting stuff.
Yes, very lively background. So I just wanted to say that the ability for our organizations to navigate through all of these dynamic changes, whether it is in an internal or an external operations environment, we need to be mindful that as to be successful and to be goal-oriented, we need to move forward in a strategic pathway. How an organization structures that can implement the response to support all of these dynamic changes is drive through the adoptions of what we call in human resources organizational change management, OCM. In broad context, OCM is largely depending on the audience. For our purposes, the organizational change management is a systemic approach to the preparation, implementation, and support of a change initiative with wide-reaching consequences to motivate organizational success and organizational service excellence. Broadly speaking, effective OCM efforts support both the adaptive and the transformational changes and require identifications, clarifications of goals, stakeholders, engagement, defining and adopting business strategies, and creating the appropriate change controls and procedures to leverage as dictated by all of this organizational change. In HR, these efforts are often related to compliance management, regulatory changes, and organizational human resources needs. While it is important to note that all of these elements are tactical in nature, there is a focus of strategy involvement. It should be noted that an effective OCM will support any organizational strategy through supporting transformational changes, which are designed to support business strategy across the entire organization. To support these initiatives, such as restructuring, organizational business realignment, it will require a collective entities across the board. As I have shared before, your board is moving the directions, is really creating a vision for these organizations to move forward as a high performance organizations. To achieve high performing, we must align those strategies with your board strategic framework. Our recommendations to allow MGO to partner with my office to conduct a formal staffing study is our attempt to be strategic in our approach into a staffing challenge through examinations of work, department structure, and classification needs. A staffing study is not solely operational or tactical in focus. It is an effective staffing plan to provide a blueprint for various strategic imperatives, such as workforce and budgetary planning. HR successful completion of the staffing study as required by your board will require close collaborations and participations from all of the auditor controller staff in task. Let's be clear. This is not a financial audit as generally perceived. In order for us to do our work, we must be able to do what we best do in HR, is to talk with people, to do time studies, to collect data, to analyze data so that your board can make informed decisions. It is a scientific exploration, analysis, and presentations of the findings related to the staffing need. And this will address a long-term, so it can be a sustainable plan for the Auditor Controller's Office. Likewise, our recommendations is for the Board of Supervisors to direct my office to return with a classification review and develop a classification spec for the positions of the Chief Financial Officer. This is not uncommon for a county of our size, with a budget of our size, not to have a chief financial officer in the role of budgetary development, management, long-term planning, fiscal outlook, financial planning. There are many other counties that have these positions, and I look forward to return to your board with a very thorough analysis for your board's directions. Again, these are parallel tracks to keep pace in a constantly evolving public service environment with ever-changing regulatory and compliance demands. As a county, we must address all of these changes affecting processes, initiatives, activities, and business systems, while at the same time, we must maintain a systems level view. In order for us to develop an agile workplace, we must leverage a systemic approach to implement and manage change. Therefore, our recommendation from Human Resource is very consistent with this assertion. When an organization is serious about change management, a roadmap for change must be developed and defined. HR management in the 21st century is about strategic management, forecasting the organizational needs, not just individual business functions. I recommend this, and these recommendations are very consistent with your board strategic imperative of improved county government operations, and it reflects my unbiased professional opinion. Thank you.
Thank you very much, Director Lee. All right, so we now have a good idea of where we're going with this. Supervisor Bohn.
I'm trying to see if there's a parallel. Ms. Lee, is there a parallel that kind of what we did this morning, the study we did for the communications and our dispatch services on how it could better operate without stepping on the sheriff's toes and the dispatch managers, but kind of overseeing? We've always heard they needed more people, but wasn't this a way to actually scientifically prove it and actually get to that point and see it on paper that where we needed it? I see a parallel. Maybe I'm seeing something I shouldn't, but is this somewhat in a parallel that we're just trying to verify what's needed?
Absolutely, yes, Supervisor Bohn.
Okay.
It will require a formal staffing study.
Okay. Thank you.
Thank you. Any further comments or questions for CEO Nielsen or Director Lee? Supervisor Wilson.
Oh, thanks. I do have a couple of questions. There's some information out there that I'm just going with some. I've heard there's only 4 counties with CFOs in the state of California. Is that true? I mean, or what do we know about that? Is this a rare occurrence, or is it reasonably common? In just talking about this position, that's one question I have. So is there any?
I can certainly speak to that through the chair. 58 counties do have elected, the state of California has 58 counties. Of those, 54 counties have elected auditor controllers positions. The other 4 have what they're called is a charter counties, and they have a CFO doing a different role, but those are charter counties, and I would be more than happy to bring all of this report back to your board for your considerations, but I just like to clarify that.
I mean, we're not a charter county, right? Yeah, I mean, yeah. And so are there any charter counties that have a CFO position and an auditor controller position?
That would be part of our staffing analysis, but just to answer very quickly, of the 54 counties, we do have variations of chief financial officer classifications, a budget directors, a finance director, a finance managers, playing various roles in the capacities, and all those positions report directly to the county administrative officer in those counties. And certainly when we do our classifications review regarding the proposed chief financial officer, we will be able to present a very comprehensive matrix to your board.
So we're not really necessarily talking about specifically a chief financial officer position. It could be an officer of finance, an officer of budget. I mean, there's a kind of a spectrum of options based on the needs from your study. Is that what I'm understanding?
This will require collaborations with the state county administrative office and with the county administrative officer Nielsen's, but there are varieties of job classifications out there that will fit the proposed responsibilities as detailed in the staff report. But I will defer this to CEO Nielsen to elaborate.
Through the chair, there is, as Director Lee mentioned, a variety of job titles across the 58 counties. And so one of the things that Director Lee is mentioning is looking at that across the counties. And so right now, the recommendation is for Chief Financial Officer, and that classification work, that title may change based on the information that Director Lee receives from myself, as well as information from other counties.
Okay, so more of it's like a placeholder, and I mean, I'm just saying, you know, just the term seemed to, of course, it seemed to have created some agitation within the community. I mean, I guess I can kind of see it a little bit, but in terms of intent, it's a little bit broader of a you know, spectrum of options from what I can see here. So maybe we can figure out a different way to phrase that. If we decide that we want to, you know, seek that a bit more. There was also a question out there with relationship to, you know, and we get this. We have to say we get this question a lot on contracts when we contract out services. We often get this question when we're contracting out services for attorneys, or whether it's for engineers, and we contract out a lot of temporary services. And can you just elaborate a little bit, like, you know, what we're weighing at, what a board weighs when and a department weighs when we're looking at contracting out services, you know, versus, you know, hiring full-time employees in terms of the types of, you know, what we're kind of doing?
Through the chair, I can start to answer that question. This contract is for interim financial advisory services. This in no way is a long-term contract, because the hope is that we would have a chief financial officer to then assume those roles, the responsibilities in-house. And as I mentioned earlier in my presentation, there's a number of changes that are occurring in this organization that require additional staff. Such as professional service agreements for smaller value purchases, budgeting trust funds, you know, a more deep dive into the internal service fund charges. So that all creates additional work, and therefore the need for additional staff.
Okay. And then, you know, there's an amount on here which seems like it's a substantial sum of money. But I mean, it is entirely, I mean, this is money, I mean, this is for services. It is entirely possible that based on this list of services you know, asking for here, we may or may not go through all of these services, and we may or may not spend all of this money. Is that correct? I mean, that's possible. That's what we generally look at in these contracts.
Through the chair, yes, that's possible that we would not spend the entire amount that is specified in the contract. And I would like to add that this contract amount includes the staffing study that your board directed on November 23rd.
Right. So if we can, I mean, part of this, there's a list of items in here that, you know, you have on this as part of the services that the contractor would work with your office to get done. And some of them are, I mean, a lot of them are based on what we perceive as requests from the AC's office, and responding to, well, what can we do to help you get those things done? Because I think there's a lot of discussion in the community about, you know, the need for staffing within the AC's office for in relationship to, which is not what we're talking about in this moment, but what has been referenced, we'll be talking about in a future meeting. But in terms of responding to the request by the AC to really up the details and up the reporting of all the stuff. But when those requests come from one office, then the response takes up time and staffing too. And so this is basically looking at trying to staff some of that, or to somehow, you know, to basically provide resources to get those things to the AC's office. Is that kind of how I'm understanding this?
Yes, through the chair. This is in response to the requests from the AC's office. As I stated previously, there's an organizational change that's occurring, and so this is a response to that organizational change. Staff is at capacity, and so additional resources are needed to respond to the additional requirements.
And what I'm saying is, like, there's a lot of anxiety and, you know, staffing pressures within the AC's office, and I think that's out there. We understand that. The other departments also trying to pull the information together to do all this administrating also are at their capacity too, right? You know, I mean, and just because one department talks about their capacity issues doesn't mean that the other departments don't have capacity issues in order to respond to a lot of that stuff. And I can see this is part of trying to address some of those things, at least in a very temporary nature. On the list of, and I just want to go down, hold on, I got to close the door to the garage for 1 second here. Otherwise, you're going to be hearing kids eating, or a kid eating a hamburger. Okay, so what I'm trying to get to is we have this list here, and some of these things on here, I mean, I just want to go through the bullet points of kind of the tasking, if I could, just for a second, if that's all right. Working with state agencies and county departments to claim all allowable state and federal reimbursements. So that's basically assisting departments to respond to and get information to the AC's office as best as possible, right? So that's just offering assistance to those departments. Is that what I'm understanding, or can you maybe describe that a little bit? Just the first on the
through the chair. Yes, that is, as I mentioned earlier, there's 3 departments that have internal service fund charges. That's the CAO, Human Resources, and Public Works. And so those internal service funds provide services for other county departments, and we bill for those services. And so one of the things that this contract would do, which is another bullet point, is to make sure that we're developing internal service fund charges in compliance with the State Controller's Office and the OMB circular. So that's one thing. So that takes off another bullet. But at the same time, there's other departments that prepare county expense claims, particularly Health and Human Services. And so Health and Human Services has to submit those claims to the auditor's office. And as mentioned previously, MGO has worked with Health and Human Services to make sure that they have their documentation in line and in accordance with how the auditor controller would like to see it. So we would just be improving upon those processes.
And with regards to the bullet point next one, which is the long range financial planning to ensure state and federal cost reports claim the maximum allowable amount. Can you just give a little bit of detail about that? Because you're not asking for financial planning services per se. You're just asking, it looks like you're seeking some help to strategize how to kind of better get, you know, those reimbursements. Is that kind of how I understand it?
Through the chair, yes, I think that's a fair way to discuss it. You know, we don't want to leave state and federal dollars on the table. So we want to make sure that we're claiming for all state and federal dollars so this community can continue to have the important services that it needs for its vulnerable population. I mean, in particular, Health and Human Services provides a significant amount of services. And so we don't want to leave federal and state dollars on the table. So this would help ensure that we're claiming the maximum allowable amount.
On the, and so I'm just going through this bit by bit, but I mean, there just seems to be, you know, the need for clarification on sort of the services, because there's, you know, there's significant discussion within the community about these issues. I think it's a bullet, I mean, they're not numbered, but like, well, 1, 2, 3, 4, 5, the developing and implementing financial strategies for resolving fiscal problems, provide direction, support, and advice to department agency representatives and other officials regarding fiscal problems. Are you talking about addressing some of the findings? Is that what you're talking about, or what? I mean, I think this kind of gets into the space where who are we talking about, and what might be the nexus with the auditor's office in that bullet point?
Well, for example, earlier, so this position would, so this contract, which is recommended as an interim contract until hopefully there's a chief financial officer position or some title like that, would be a bridge, in essence, to the auditor controller's office when there are potential issues. And again, I'm going to use the county expense claim from Health and Human Services as an example, where there was a need for a lot of additional documentation. And so MGO provided that bridge and that communication piece. And so this position, in terms of fiscal strategies and resolving fiscal problems, would help clear up some of those fiscal problems, working in collaboration with the departments and the auditor controller's office.
Okay, I guess one of the, I don't see it. Where is, there was one in here about the issue of the claims for the internal charges with relationship to utilities and stuff like that. Where is that in here? I just can't remember. I've been marking this thing all over up, but I can't remember where that is on here.
Through the chair, it's the third bullet. And let me provide some additional detail on that. The county administrative office receives, pays, and distributes the utility costs. And one of the ways that we distribute the utility cost is based on square footage. The auditor controller has asked for blueprints to justify the square footage methodology. We can do that, absolutely. That requires a little bit of additional work. And so this is, again, another demonstration of how we have increased workload. And so therefore there needs to be an organizational response, which is to review the classification work of a chief financial officer so we can get auditor controller.
Well, I mean, and just to be clear, like this particular item, I mean, it would just be basic, the most that would likely come of this, as I understand it, and I could be misunderstanding, is that these square footages would just be adjusted according to maybe new information, correct? But overall, the same, we're still being charged the same amount for utilities, for instance.
Through the chair, that is possibly one solution, and the auditor controller may have a different distribution methodology, and this position could engage in that conversation and exploration of that methodology further.
I see. So, okay, so I mean, really it's like trying to get some support to, and then also understanding, you know, what's the timeline of that? Because the current methodology has been in operation for some years, I assume, right? Which is, I mean, you know, we're in a building, I'm not in the building now, but you're in a building that still probably has blueprints dusty on a shelf someplace, right? When people actually used blueprints to build buildings. Currently, that's not like a thing, but it would surely be so much easier if they're all, you know, CAD files that you could just mark up, but, you know, I don't know what it is now. So I guess, is that where this has been, that the current methodology has been there a long time, correct?
Through the chair, yes, this methodology has been in place for a long time.
And if it goes for another year, is it gonna, you know, do we feel like that there's gonna be a big impact to the taxpayers or anything like that, or? Through the chair, if the methodology remains the same, for another year or two, there would not be a big impact to the taxpayers from my perspective. Okay. Maybe.
On that one particular, I want you to continue, Supervisor Wilson, but on that particular item, it just seems to me somewhere, sometime, somebody said, this is the square footage of this office. I'm assuming it came from when it was built or whatever blueprints are available. Why would they change? But anyway, I don't want to digress.
It's okay. My point is that kind of what I'm getting is there's a list of items here, you know, and in all of this, we have to prioritize, you know, And I understand that when we bring on a consultant, or a contract worker to do some of this work, they're going to have to work with everybody, including the AC's office, to prioritize these things, because none of these things happen instantaneously. We have to strategize and prioritize and really figure out the way, the best way to prioritize these things. So in the staffing study, as Supervisor Bohn mentioned, we're probably looking at doing some sort of similar staffing study for the sheriff's department. It looks like that's kind of the direction when we talked about consolidation earlier, correct? I mean, is that what I kind of understood? Maybe Director Lee is that what it seems like where we're going with that?
Through the chair, my understanding from the staffing study was directed by your board at the November 23rd meeting for the Auditor Controller's Office. I am unaware regarding the sheriff's items, but I will be collaborating with the CEO Nielsen's and with the ad hoc committee as directed to look into it. But again, to look at a significant organizational change that will require a strategic framework, and a staffing study is a very formal process to collect data, to analyze data, to be able to make a very meaningful presentations and discussions. It will involve very lengthy conversations.
Okay, so there's been some, as it does happen sometimes when we do contracting, people have questions about, well, why do you pick this particular contractor versus, anybody else? Qualifications, price matters, experience. Can you sort of summarize, why this particular contractor would be one that you might look at versus somebody else? And there's always a question about, is the contractor local? Is the contractor from somewhere else? Can you kind of reach into that? I mean, it's a common conversation we have when we have these, contractors come on.
Through the chair, yes, I can answer that question. MGO has a niche in local government accounting services. They have a significant experience with counties and cities. And since your board has a $465 million budget, you want that level of expertise when you're contracting out for services. To the best of my knowledge, there is not anybody local who has that level of experience. You heard from Scott Johnson the other week, and he has worked for a number of municipalities as their chief financial officer, and that's what I would recommend that your board pursue.
We have some pools of service providers. I've looked into them. I think you might have too. Did you find any that had this type of experience in the sort of professional pools that our county can avail of?
Through the chair, Supervisor Wilson did send me a purchasing pool, and there were no CPA firms in that purchasing pool.
Okay. And let's go straight to the rate, because people have those questions all the time, because this person who's kind of the lead on this has a charge out rate. I'm sure there's other staff that could or may work on some of the details of some of these things, have other charge out rates. How does this compare to charge out rates for our engineering services, our attorney services, and the other services? And it is shocking to normal people who don't pay for consultants what these hourly rates are, but there's a reason why what that compares to other options. So can you kind of give us a framework on that?
Through the chair, yes, I can give you a framework on that. I think the community might be interested to know that when we contract for attorney services, attorneys can be upwards of $700 an hour. So contracting for some CPA services is significantly less. Your board should also be aware that the highest hourly rate is for the person with the most experience in overseeing the project. And so when staff begin to hopefully work with MGO, they wouldn't necessarily be working with Scott Johnson. They would be working with at the lower price point. So I hope that provides a little bit of clarification for your board.
Okay. So from my perspective, the thing that gives me the most concern about this item is really the use of the term chief financial officer for this position that we're not totally sure what the scope of duties would be and we're not totally sure of, comparable yet, because we don't have that information of comparable positions within other organizations like ours. And I will say, I get it, somewhere between $400 and $500 million organization would probably have somebody who, really does, financial projections, financing, really can dial in on budget planning, those sorts of things, which is fundamentally a very different job than auditing these systems. Although, auditors have very important roles in a nexus to those things. This seems like these kind of roles have something that's very, that's fundamentally different. And I would say it's worth the conversation is whether or not these services are of value to an organization of our size. It's quite possible we could look at that evaluation that comes back if we decide to do something like that and be like, we're not going to do any of that, or we just need a financial planner position, or we just need it's possible. But I just want to make sure that we have, if we decide to move forward on, there's real flexibility in what comes back and kind of a spectrum of options for our board to consider. That would be important to me. I appreciate the board entertaining my very long questioning on this, but I just want to make sure, I got a lot of feedback and stuff, and I want to make sure I was hitting everything I could to be as complete as possible. So I'll stop now.
Through the chair, may I?
Please go ahead. Please go ahead, CEO Nielsen, and then I have Supervisor Bass and Supervisor Bohn.
So in the staff report and mentioned in the presentation, some of what the responsibilities for the chief financial officer, call it what you may at this point, is long-term budget preparation, developing internal service fund charges, overseeing the fiscal monitoring and control, revenue projection and analysis, debt management, long-term fiscal forecasts, and recommending fiscal policies to the board, reviewing and analyzing the fiscal impacts of proposals or projects, and facilitating corrective action plans. Those are very much functions of the county administrative office right now. And what I'm saying is we need assistance because of the changes that are occurring in this organization. This is not taking any away from the auditor controller's office.
And just reiterate that the budget is one of the main focuses of the work of the supervisors, this bunch of elected officials. Supervisor Bass and then Supervisor Bohn.
Well, first I want to thank Supervisor Wilson for covering pretty much almost everything. So did a really thorough job. And I also want to say, I want to thank Director Lee for coming on board. In the 10 years I've been here, I don't think we've ever looked at a systemic approach. Okay? I think it was just, HR just kind of was maybe there, and so this is painful right now, but we are looking at changes, and changes aren't bad necessarily. You have to adapt to them. And so I really do appreciate, the views that you have brought and your expertise in trying to help us through this interesting situation. And I guess one of the things, since I got a lot of questions answered already, I know that I had talked to Supervisor Modi from Shasta, And I had asked, there's a couple things interesting I learned. I said, you know, why do you have a elected auditor, but also a CFO? It seems like it's a reasonable question. And what he said was the CFO is half CFO and half assistant CAO, you know, so there's all sorts of ways it seems like you could, you know, if this moves forward, to create what that might look like. And I also did want to mention, I think we, you know, the term CFO is seeming to cause some heartburn. And what I've noticed is when you look online at the county website, county's that website, it actually refers to the auditor as a chief accounting official. So it's I think some of the word usage is, I think it is important that we decide what do we really want to call this position if it comes on board. But it seems like there are multiple avenues that we could look at. So I just thought it was interesting. It's not that this doesn't exist anywhere. It's just it exists differently in locations, and that's part of what I suspect Linda would be finding out to bring back to us. Is that correct?
Correct. Yes.
Okay. And like I said, most of my other questions were answered. Thank you, Supervisor Wilson.
Thank you, Supervisor Bass. Supervisor Bohn.
I want to give my heartfelt thanks to Supervisor Wilson for asking all the questions too. But I was going to kind of follow up on what CEO Nielsen said. We do financial projections. We do all of that, but it goes through the CAO's office. And what we've done is we've turned the CAO's office and her assistant CAO, they're spending more time on budgetary issues, and it fully says that our auditor controller can switch the accounting way she runs her office, the way she audits her office. And what she's doing is she's creating a situation where we don't have any, the words I always see is serious financial misuse, corruption, fictitious employees created. She's doing all that, but what that does is that creates a level of work throughout the county that falls back on the CAO's office. Now, the other thing we do, we've got her involved with economic development, and they've been making great headways on that. And I want her to be able to see that. I want her to do CAO duties. I don't want her to see it. I think this is a good way to get there with somebody that can assist her on this and all the other departments as we move forward with however we're going to be accounting and auditing this county in the future. So I don't see as big a problem with this, because I look at this as another tool in the toolbox rather than, and it's not a hammer. It's a pretty precise tool to make everybody move along a little bit easier. It's more like a finishing tool. And I think I don't have an issue with it. And I just think I applaud him for bringing it forward. And I don't think this is trying to take, not everything is trying to take anybody's powers or anything away. I mean, the emails I've got is we're trying to underwrite. I mean, it's just absolutely amazing. I had an hour and 10-minute conversation with a very good friend of mine on this, and and we came to an even kind of an agreement in sort. But I think this is probably a good idea right now, especially with COVID, CARES Act money. You guys, we keep hearing the CARES Act money may be changing. We're going to need somebody to fight for that CARES Act money, or we're going to bankrupt the money we've spent to fight with this COVID. We're going to need these monies. We're going to need another bulldog to go after, and it can't just be the CIO's office. So I think this is a great idea. I think it's been well thought of, and I appreciate you guys for bringing this forward. And I don't think there's anything nefarious about it at all. I think it's just a good decision to help Amy's office, Department of Health and Human Services, all of these people move forward that have financial people that could use that oversight on, not on their accounting, not anything else, but moving their financials forward.
Supervisor Bass?
Who's in the background?
And then, no, okay. let's go to, your hand was up to Virginia on the attendees list. Director Beck.
So I thought I should chime in because DHHS has been mentioned so many times today and other days. I did want to just take a minute to talk about MGO and their relationship to DHHS. When they first started working with us, we weren't getting our claims signed or submitted on time at all because of the lack of communication between the auditor's office and DHHS. Not stating that my staff were not trying and doing the best that they could, but that wasn't happening. So I have to say that MGO assisting us was really helpful in getting the changes and the documents that the auditor's office could require in order for us to get our claim signed. That's the county expense claim that Amy was referring to. So I just wanted to make a note of that. I also feel like it's important to just say that, our staff have worked really hard and continue to work really hard in keeping up with all of the changes and requirements of the auditor's office that's happened in the last year or so. I would really appreciate having additional staff available to assist DHHS and other departments. It's been, the last couple of years have been really difficult for departments to meet the requirements that we have to work with in order to get to receive our federal and state revenue and run our programs. And so I feel like at this point, we need any assistance possible from your board and others to do this work. So thanks a lot.
Thank you, Director Beck. Supervisor Madrone.
Thank you, Madam Chair. Great discussion, and I'll jump in on the share the love again today and thank Supervisor Wilson for covering a lot of very important questions that have come from internal and external around the community. That helped a lot. I actually am kind of seeing a light at the end of the tunnel here, I have to say. This has been a rough road for all of us in the county, and people are wondering what's going on, but I actually feel pretty good about this recommendation and where we're going. It's clear to me that the departments need help with training and getting together all the kinds of documentation that the AC's office is requiring. It's clear that the AC's office needs additional staff. It's clear to me that we've had a backlog of problems in this area for quite a few years. And so it's not surprising to me that we're having to invest significant funds both in the CIO's office, in the auditor controller's office ultimately, and with a consultant to help us because there is such a backlog. We really need to get all this training up to speed. I mean, it's really an investment. As Director Lee has said, it's an investment into systematic change, and creating systems that will allow us to move away from these great expenditures at some time in the future. MGO, for instance, will eventually be off the table because we'll have got people up to speed and trained and all working together to accomplish the goals for our community. So I think it's a good investment. It's clear to me that assistance is needed, as Director Beck just said. And so I'm good with that. I think that's the support that we as a board need to provide and be responsive to. I think where we're at today is a chance to kind of press the reset button on all of the stuff that's been going on, right? And I mean, it's really neat when you got that reset button there and you just go, okay, let's start over here. And what I mean by that is if we as a board can do our job of providing the support where it's needed, and I think that's three places, CIO's office, AC's office, and MGO for the time being to help departments and the CIA's office do the work we need to do. I think that that's a really good thing to do. And it will allow us all to kind of start fresh with each other and work really hard, like I see everybody working, to try and put the past behind us and focus on the future and better systems, better training, better accounting, and more professionally, timely, and accurately done. So I am very supportive of that. And I want to thank everyone for their hard work to get to that place. I think we all know that when we work together, we can accomplish great things. I do wonder, though, you know, $250,000 is a lot of money. And I'm just wondering if we might consider maybe $125,000 as a starting point and then have a check-in. You know, what's that getting for us? Are we in fact getting the results and those tasks on the list accomplished, or are there still barriers? Are there still problems and personalities and other things? Because I don't want to just keep throwing the money out there to solve something if it's not actually solving anything. So I'm just kind of wondering how the board might feel about sort of a metered approach on that, where we put it out as 125 with a possible extension up to 250, but with a semi contract report, sort of, without spending 50 grand on the report, you know, but just here's the tasks that were the priorities, and here's what we've accomplished. We're moving forward. Things are really lining up nicely. Great. But here's the rest of the tasks we need to complete. Okay. Then we go to the further amount if necessary. But that's just a thought I thought I'd throw out there as a possible avenue. Otherwise, I really am looking forward to and want to thank Director Lee and CAO Nielsen for working on the classification stuff for the AC's office. And I know that she was not available last Friday, but I do hope she'll be available soon and that we can get that and bring that back to the board ASAP as well. And I know you're all working on that. So let's get the resources where we need them and get this job done and get caught up. That's my attitude.
Thank you, Supervisor Madrone. Supervisor Bohn.
I'm hoping instead of saddling when they do the bid process, it's kind of like anything when you go do a job. If you do $100 worth of work, you know, $100,000 worth of work, it's just many hours. If you do 200,000, I think for them to plan ahead, I would like to just amend that. What your wish is to have them give us a halfway check-in. I mean, I don't want us to, because it's up to 250. We're not saying give them 250. I think your idea of a check-in and say, hey, how are things going? I've almost got a pretty good feeling we're probably going to hear how it's going anyway, but or we're going to be able to read it somewhere. But I think the idea is if we went ahead and ask them to come in and give us an update on how they're doing, I think would probably be, rather than going over the finances and rebidding. I think it's a great idea, because I think you're right. I don't want somebody to get halfway through and says, well, we really haven't done anything. Give us some more time. I think if we see what the deliverables are halfway through, whatever they figure out, I think would be a great thing. And again, I applaud Linda. I think Virginia hit the nail on the head. We've had HR people in the past, and I liked Lisa. Lisa was a good friend and things, but I think Linda's taken it one step farther. Sunday morning, I think I scared her. I was walking down the hall about 8 o'clock in the morning, and she was walking down the hall in the morning, and I heard this yelp, and I looked behind her, and I guess I scared her. So, but anyway, she's putting the time in, she's putting the effort forward. So if Supervisor Madrone would be okay with that, I'd love to throw that little in there.
I see a thumbs up there, Supervisor.
God, I hate COVID. We could be doing a group hug right now.
Supervisor Wilson.
I'm still, I mean, I really do want to make sure that we include language that really, when we evaluate whatever this new position might be, and should we even choose it, that we really are looking at not, what's the word I'm looking for? Having, repeating or having the same, duties as, as some folks are concerned about, with regards to the auditor control. I know you will do that, but I want it to be specific in the analysis, that we're not having it's the, I guess what the word I'm looking for, but it's not duplicative. That's what I'm saying. That they really have, that they really are offering services and in conjunction and to supplement or to assist in helping that office get the information they need, and quite frankly, give us ultimately everyone, this body, what we're doing, the county, all 1,500 workers or more, we're trying to provide services. That's it, right? We're trying to have adult conversations about strategy to provide those services, to the efficiency of providing those services. And sometimes we disagree on those strategies and where it might be efficient and how we do that. And that's, we can do that as humans, right? And of course, as in large institutions, there, it's turning the battleship, as they say, or turning the freight line or whatever. There's a lot going on. We're working real hard. A lot of what we're doing is keeping the wheels on the bus as we're kind of moving it forward. Civil society is in a state of entropy all the time. Like, it's physically falling apart in terms of like our infrastructure, which is always mending and rebuilding anew, but socially too. And that's why we have a DHHS, right? And those other things. And we're trying to keep it all rolling. And in the core of that, right, in the heart of that is the management of the money which is basically just resource allocation, right? And so we really got to work on not having divisiveness in that space, because it's bad for the heart of this organization, which is to provide services. Everyone I see on the screen, everyone who's working as our employees are public servants. We're servant leaders. Like that's our role as electeds, all of us. And in the end, we're obligated to really work on providing services. And we'll have some discussions and disagreements about the strategy of that and the efficiency again. But ultimately, that's what I think we're doing. And I'm hoping that we're going to get to this place. So I just asking for that one amendment that this is clear that we're not duplicative of these services, or trying not to be duplicative of offices. And with that, I'm ready to talk about public comment and stuff like that.
Well, I'm glad. Okay, then that's what I'm going to do. Let's go to public comment on this item. And again, anybody who has input for us on this item, please press *9. Call the numbers on the screen and then press *9 to be put in the queue. I do not see anyone who wishes to. Here we go. All right. So the first one on the list is last four digits of 3053. Welcome.
Hello, Thomas
Hello.
Holder here. Just following these things, I support you guys moving forward with this. It seems like because of, I'm not an elected official, so I don't have to be PC with it. And I know everyone's trying to get along, but it seems like with the mandates of required more documentation by our auditor controller, that this new requirement of staffing is needed to move our county forward to not miss out on funding. I think it's imperative that we get this done. And actually, I think it's very, very smart of the CAO's office to forward think, and HR to forward think of what can the county legally do to make sure they are not going to be missing out on any funding due to, I don't know what you'd call it, a difference of opinions or whatever it may be, that things aren't getting done accordingly, even though there's, I think it's 30-40% more staff in the last 4 years or something to an office. So please move forward with this. Please make sure you secure our funding so we don't lose it as a county. Thank you for the opportunity to speak.
Thank you, Thomas. All right, we do have some more commenters. 7454. Welcome, Kent.
Estelle, it's getting really late in the day. Can we go home yet? I just wanted to know.
No, we've got a lot more.
No, let's take the rest of the day off with pay. I did want to make mention, and I think this was brought up before, but you know, in the thing of working with people, the opposite of how to influence friends or make friends or whatever is the statement, take direct action to develop concrete steps to protect the county's fiscal operations, financial conditions, and reputation arising from operational gaps. So I think maybe we're beyond that kind of language in these things, or I would hope so. One thing that I did wish to mention was I don't see anything in your motion that was made last time, and I'm reading it from your action summary, that has anything at all to do with that new position. It's just not in here. It has a long list for the controller to do, or their motion to authorize them to do, which I strongly approve of. And then it says, direct departments to provide federal award letters to the auditor controller by end year. So I'm not sure if that is going to slow her from doing her work. I don't know. And direct, here's the direct, the auditor controller and human resources to return with position classification work, potential operations realignment, conduct this potential staffing study, includes supplemental budgets if necessary. I was very impressed with your HR director, and I concur that you have a very sharp tool there. But she's being directed, or along with the auditor controller. This has nothing to do with an outside firm that I can see in here. So I don't understand how that even enters the conversation. I don't think that was, I don't know, it's obviously been agendized, but not in your direction from before. And again, it includes supplemental budgets if necessary. Well, I don't know. Is the supplemental budget the $250,000 we're relying to? We won't know whether it's necessary until, I think you got the cart before the horse. I think you really need to have your auditor controller and human resources do what you were directing them to before you go spending money out there. It sounds to me like maybe that particular company, the 250 or half that or whatever you're going to do, really should be working with Connie Beck's department and all the other departments so that they can make the same improvements Connie Beck said that they made to facilitate the process. So I think we're kind of we're reverse engineering something here and working from the middle both directions. I don't know. It's not making any sense regarding how you're directing your potential person to do it. It sounds to me like a good share of what you're potentially directing them to do could be funded through your HR department and give her the resources to work with the auditor controller and accomplish the goals that you've suggested in your direction here in your action summary. So that's my input. It sounds like Alicia Hayes or what used to be Cheryl Dillingham are actually doing the job you're intending. Maybe just give her a new hat and a whistle and a few extra dollars. But that's what I understand. Most of those things, and I'm always impressed with, especially what Cheryl used to do in that position. And I think Alicia does a good job there too also. But that's just my question. So let's get that. Let's make sure we don't have that cart in front of the horse. Thank you for my opportunity to speak.
Thank you, Kent. And let's see, we have last four digits of 2122. If you would press *6, you can give your welcome.
Hi there, this is Uriah Driscoll again. I hope you're all sitting down because I am going to agree almost wholeheartedly with Mike Wilson. Good job, Mike. Yes, we should not be creating something that's duplicitous, that's for sure. I also like Supervisor Madrone's idea about a check-in, and Rex kind of seconded that. But I'm here also to speak for the Humboldt County Taxpayers League. We had a special meeting last night to draft up some comments and that were approved. And it's basically, it reads as such, that we would like, the Humboldt County Taxpayers League would like that the office of the auditor controller remain an elected position. I'm not sure that that's at risk, but, and number two, that the office of the auditor controller be fully funded and staffed as necessary to carry out the will of the people, or the Board of Supervisors create a public process for transparency to amend the auditor controller's functions and duties. And that was the statement that the Humboldt County Taxpayers League drafted last night. So again, yeah, you got interesting subject going here. Of course, taxpayers and all of us as taxpayers really appreciate transparency, and auditor controller as a check for that. And anyway, that's all for my comments. Thank you very much.
Thank you, Uri. Okay, I do not believe we have any more public comment on this item. So I will bring it back to the board. Supervisor Wilson.
I just wanted to, it seems that maybe that, I know Director Lee mentioned this, but you know, we have directed staff to come back with at least 2 more positions related to the Auditor Controller's Office, and that's really dependent on schedule at this time. And I mean, obviously, where it's not on the agenda, we can't say what we're going to do with that necessarily. But what we did give direction was to bring back that item, and so I just want to make sure that it's clear and out in the space that is and was scheduled to be before this, or actually part of this was actually to be part of that conversation, so it would, you know, meld and kind of come together. And so we're just waiting for some availability and scheduling to get that so that we can have that discussion. And maybe the CAO or Linda can help me if I haven't stated that correctly.
Through the chair, is that okay, Chair Fennell?
Yeah, please go ahead.
Yes, staff attempted to bring the auditor controllers positions to your board in a special meeting on December 4th. I believe that myself and Director Lee, if the auditor controllers availability improves, we would absolutely try to attempt another special meeting to have that discussion. So that is on our to-do list, and I know Director Lee and myself will not let your board down in that regard.
Thank you. Okay, so at this point, if we've kind of exhausted our discussion, I entertain a motion. Supervisor Bohn.
I just, with that, I have one question to ask Linda Lee, because most of my emails contain this, that please give the auditor's office what they need. The office is severely understaffed. And I've been hearing this obviously since, and have we added any positions to that in the last 3 years? Have we added positions? I know you weren't here, but do we have that information, or could you at least give me that information?
CAO Nielsen?
Through the chair, I can answer that question. In June of 2018, your board added a position. In November of 2018, your board added a position. And in December of 2019, your board added a position.
So we've added 3 positions in the last 2 years, 2.5 years.
Something to that effect.
I want people need to understand we have added people. If we need more, let's do the study so we can actually, because the confusing part I had was, and I've only been here 9 years, I think it was the only time I've ever seen a department head not bring a budgetary item to the budget hearing, but then come in afterwards and go to the court of popular opinion and say, I need more people, where we didn't have the budget to verify that. And I don't think any other department had ever done that, at least in my memory. So, and it's fairly short and old, but there is a procedure, and we have added bodies. I just don't want you to think we're trying to do anything there. There's nothing nefarious about this. It's just hard for me to get over that. And I think I appreciate Supervisor Madrone's idea. Let's just start from square one moving forward, but with actualities. Thank you.
Thank you. Okay, well, again, to the issue at hand, can I have a motion? Supervisor Madrone.
Don't have a motion, but I'll make a 1-minute quick statement. The staffing thing is a tricky issue. the CAO's office is down 3 people or more from COVID. The AC's office is down 3 people or more due to COVID. You know, people being out on extended leave and stuff. So right now there's understaffing because of that. And then there's long-term issues of staffing. But, you know, I don't want to get into a long debate here or whatever, but I do think that let's just focus on getting the staffing where we need it, where these department directors are asking for it. I realize that every department needs it, but when you've only got, you know, 12 people in your department and you're down 3, yes, maybe you added 25% positions in the last 2 years, but you also lost 25% due to COVID long-term leave and things like that. So, you know, again, rather than getting into a debate on it all, I like where we're heading with this. I don't have the motion other than I guess I think I'll let Supervisor Wilson do that. He seems to have a handle on the elements real well. But, you know, we're moving forward. Let's do that. Press that reset button. It's a really valuable tool.
Okay.
Supervisor Wilson.
Thank you. Yeah, I want to reiterate too that I don't want to relitigate the issues of the past and where we are, you know, and those things. I just think it's not going to be beneficial or helpful. And it is what it is. There's a department that's at the core of this that is requesting changes fundamentally. We're trying to respond to that as best we can throughout the organization and also within that department as well. And so with that, I'll make the motion that we approve the item as stated with the following amendments. The first amendment is that we'll receive a report at or around the time that the contract is half spent or allocated, and so that we get a check-in, a status report of some kind. And number 2, that, you know, that we make sure that there's special language that really seeks to not duplicate the duties as specified for the auditor controller. And I do know that when we're talking about money, there can be a little bit here and there, but understanding what I mean by that, it's not an absolute. I'm not an absolutist, as everybody knows about myself. So from that perspective, but understanding when I say to seek to not duplicate duties, that it's within reason. So that's my motion. Where's Ryan? There you are, Ryan. Ryan, does that make sense? Are we?
Supervisor Wilson, so I've approved staff recommendations with the additional modifications or conditions that you receive a report at the time the contract is half spent, and that special language that doesn't duplicate the duties of the auditor controller is what I heard you say. And I'll have to iron out.
Yeah, and yeah, that's close enough, I think. And Amy, does that seem reasonable to you?
Through the chair, absolutely. We can provide a staff report at the time the contract is half expended, and then there is not an intention to have a duplication of responsibilities across the 2 departments. So I understand that completely, and I believe Linda Lee understands that as well, as she is nodding her head in agreement.
So,
yeah, and I'm glad. The chair, if I may, I'm glad, and as the motion maker, I'm glad that you mentioned intent, because again, I want to specify the intent is for this organization to operate as smoothly as possible to deliver services to our community. That's everybody's intent. That should be, when people read whatever they read, whatever it is, they should assume if it's not that intent, when it says the intent of, because there was a lot of stuff flying around about intent, then I think people need to check with the folks who supposedly have the intent, to ask them directly whether that's their intent or not. And like I said, we can disagree whether the strategy being proposed is whatever it is or whatever those things are. But when we assume intent of people, no matter who it is, we got to be real careful about that. I know I do. I fall into that trap, and we all do it. And so we just hopefully check ourselves. So thanks.
Yeah, well, there's a lot of conversation about things that never came up in the meeting. Just the things that are just out there. But okay. Again, Ryan, you did get clear that that was the halfway through the allocated expenditures, not halfway through the project.
Yeah, so that clarification from CAO Nielsen, receiver report at the time.
Yes.
The receiver report at the time the contract is half expended. Is that correct?
Right. Expended, yeah.
Expended, correct. I have that correct. And then we just need a second on
Great, wonderful.
I seconded it.
I'm sorry,
And
Supervisor Bass.
No worries.
Thank you.
Okay, let's take this to a vote. Ryan, thank you.
Thank you, Chair Fennell. Supervisor
Do a roll
Bass.
call vote.
Yes.
Supervisor Madrone.
The microphone, Supervisor.
It's always that second button I have. I have a dual button on my thing. Yes.
Thank you. Supervisor Wilson.
Yes.
Supervisor Bohn.
Yes, great.
And Supervisor Fennell.
Yes.
Thank you. Passes 5-0.
Thank you. So we have another item coming up really shortly, but I have gotten a request for a break. So let's say that we'll take a 10-minute break. I hope that's okay with everyone. And so we'll make it about 13. So let's come back here at 4:55.
No.
I mean 3:55.
Yeah, okay.
Sorry, that would have been an hour. That would have been a very long break by today's standards.
Is this for a health break?
3:55. Yes. So the next item on the agenda comes to us also from, this one comes to us from the County Council. And I'll toss it to you, Councilor Billingsley.
Thank you, Chair Fennell. Before your board is a request of the Auditor Controller for outside council representation. I just want to say preliminarily from correspondence, I was under the impression that the auditor was going to bring this item forward, but it was asked that I do that, and that's why my office is bringing it. My office is in receipt of a series of letters, and they are attached to the agenda item from attorney Cindy Day Wilson, and she's requesting to be appointed to provide outside council representation for the Auditor Controller. Those letters are in response to an interview notice that was sent to the Auditor Controller. The decision regarding the request for outside counsel is one for the Board of Supervisors, and then potentially one for the court under the provisions of Government Code 31,000.6, which was also attached. And I just want to say that the Office of Auditor Controller was added to that statute just recently in 2019. It also includes the assessor and the sheriff. As conveyed in the response letters, the Office of County Counsel's client is the county as a whole, and the office does not provide individual representations to employees or elected officials in an investigation. It does not appear that a clear conflict exists regarding the office at this time, but this is an underdeveloped area of the law. Because of the potential ambiguity between the requirements of Government Code 31,000.6 and the California Rules of Professional Conduct, the Office of County Counsel is announcing a potential conflict regarding representation of the Auditor Controller regarding the investigation. In light of this, the recommendation that was in the agenda item for appointment of a County Counsel attorney with an ethical wall is being withdrawn. But there's a separate inquiry that's before your board today, and that question is, does the board find that the requested representation during the investigation is a task within the performance of the duties of the Auditor Controller that would entitle her to an outside lawyer? The Office of County Counsel is not aware of any dispositive authority regarding this issue, and no further authority has been presented in response to the request of Ms. Day Wilson. Again, this is a separate question The conflict question is separate from the question of whether or not this is within the duties of the auditor controller. And lastly, I did want to add that regardless of whatever is decided by the board today, the auditor controller remains free and entitled to have her own representation. Really, the quest here is whether or not the attorney would be retained for and paid for by the board as opposed to by the auditor controller herself. With the removal of the recommended action, I think the other alternatives are what are for your board's consideration today. I believe an invitation went to Ms. Day Wilson. I don't know if she is planning on participating or offering anything, or if the auditor controller is planning to say anything. I would see if they are here to make any statements.
At this point, I do not see either one of those people, either Ms. Day Wilson or Auditor Controller Paz Dominguez on the list of attendees or the panelists. Ryan, can you confirm that for me, please?
You are correct, Chair Fennell. I do not see either Ms. Paz Dominguez or Ms. Day Wilson. I did send them panelists or Zoom invitations to this meeting, and I had copied County Council on that as well, but I don't see them in the attendee queue or in the panelist queue either.
Thank you. All right, so I'll go to the board first. I have some thoughts myself, but Supervisor Bass.
Thank you. I just had a couple of questions for Jefferson. Still getting used to calling you County Council Billingsley. So this is about some interviews that are coming up. So it's, if I'm understanding correctly, it's not about necessarily any wrongdoing. And my next part would be, are others in the organization likely to be interviewed as well? And then lastly, since we know the work is done for a lot of different agencies, often things through the auditor's office, would any of those other agencies be interviewed? I mean, it seems like this is trying to get information and fact finding. So I suspect there's others, but what can you provide there as far as, you know, who else might be in this pool?
Well, Supervisor Bass, I'm a little bit hamstrung because I can't really talk about investigations, but I could generically say that, I mean, I think the generic allegations are in the agenda item, and then anyone that would have relevant information would be a potential person to be interviewed as part of that inquiry. But I really can't go into any more details than that to protect the investigation.
No, that's helpful. I just was trying to figure out the potential breadth of it. But
well, my thought here, I mean, this just doesn't seem to me to rise to the level of needing an attorney. I don't know. I mean, we have these kinds of internal investigations in the county quite frequently. I haven't heard of this. There's no charge filed. It doesn't seem that this is the kind of situation where one would require an attorney. So I know that we're very hamstrung by this being an internal situation, but that's what I see. I don't understand it, actually, to tell you the truth.
And Chair, if I might, I think the wrinkle here is that there's a specific statute that applies to 3 elected officials that provides them this avenue to seek representation by the board. Otherwise, it probably wouldn't really be much of a discussion.
But in what kinds of circumstances? I mean, with their charges, or, I mean.
Chair, if I might, there are very few decisions under this statute. There's only a handful, but usually it's a situation where there is litigation between 2 departments. For instance, when there's a disagreement between the assessor's office and the Board of Supervisors about how to assess a particular piece of property. So they had litigation between the 2 departments, which is obviously a conflict for the Office of County Council. Another one was when the DA's office was investigating whether or not the elected sheriff had committed a Brady violation. And then if they had made that finding, that would have affected the sheriff's ability to do his job. So there was the need for independent counsel for the two offices.
Mm-hmm.
This is a unique situation. That's why I asked Ms. Day Wilson for some input, because really there's not a lot out there. It's very unique.
Okay. Supervisor Wilson.
I guess that question is like, in order for there to be some, I don't mean conflict of interest, but conflict. I mean, the question is like, is the action adversarial to an individual? And it seems like this action is about an issue, right? It's not about a particular individual. So I'm not really clear. I guess I'm not really clear where that conflict has been defined. And I did read the letters from Day Wilson. I mean, there's a significant number of inaccuracies in there and things that are just not necessarily true. But I mean, so I was just kind of wondering, is you're feeling like maybe the statute isn't clear on when that threshold is crossed? Is that what you're saying?
There just hasn't really been much detail as what is within or without the scope of duties. That is the difficulty here. But I agree from the letters from Ms. Day Wilson, she's clearly making the argument that it's an adversarial proceeding, and that's why this request is being made.
Who are the adversaries?
I think from the letters, there's the opinion that it's the board, the CAO, and the Human Resources Department. I mean, I think it uses the term witch hunt in one of the letters. So, I mean, clearly that it's being viewed as adversarial.
I've heard that term before. I also kind of look at those letters as being adversarial to us a bit, and they could constitute, from my perspective, I think they could constitute a threat of litigation. What do we, and should we be talking, I mean, we're supposed to be talking about threats of litigation in closed session for obvious reasons, right? To protect the county and the county's interests in that regard. But this is complicated because so I was kind of wondering, do you have thoughts on that? Should we be doing this in closed session? I'm just, I know we're trying to be transparent, but at the same time, threats of litigation and litigation in general, we don't discuss in open session.
Supervisor Wilson, it is a unique circumstance, and up until a couple of days before it was published, I thought that the auditor controller was going to bring this item forward, and that's the only reason I am bringing it forward. I did notice that in some prior cases, the request was discussed publicly, but I would agree that the letter basically does make a threat of litigation, that if this counsel is not appointed, that Ms. Day Wilson will go to the court to seek appointment. That is a threat of litigation. It could justify a closed session discussion. The difficult part is that the discussion about what is within or without the duties would be the record that the court would look at. So there needs to be some kind of establishment of what the board's view is, and that is what would be reviewed by the court. Some of that is in the agenda item, some of that could be discussed here, but that could also be discussed in closed session and reported out. That could happen as well.
One last question for me, and I know there doesn't seem to be any order to us kind of jumping in here. It seems a little free form, and I appreciate Supervisor Fennell letting us kind of roll like this. But is there limitations on that representation? Like, I mean, could that representation just during interview of this one item, or does it also, is there really no functional limitation to and assuming it will, let's a scenario where we say, yeah, we'll pay for this attorney that's asking for it now. Would that mean that this attorney would then and could apply their time currently up to this point into that, or would it just be just for the interview and reasonable preparation of an interview? Because someone could just say, well, we're going to talk for 20 hours to prepare for an interview, a pretty standard interview that could last an hour or two at most. I don't know.
Supervisor Wilson, I mean, the cases are clear that obviously this is an expenditure of public funds that's outside of the normal realm. So I believe, as the Attorney General said, it does need to be for a discrete matter. It's just not, here's an attorney for the elected official to do with whatever they want. It has to be for a designated matter with parameters. There can't be a lot of restrictions on how the attorney handles that matter, but it should be for a specified item. And that's what the compensation would be for. It might be sought for these letters and leading up to seeking appointment. That wouldn't appear to be within the statute, but I don't know if that would be requested or not, and that might turn into a fight.
And one last question about that. Would we have discretion or any sort of say in what attorney might be hired if we decided to do this?
Well, the first step in the process under 31,000.6 is the elected official goes to the board and asks for an attorney. They only go to court if the board decides not to give them an attorney. So if the board to contract with an attorney, that is up to the board who they want to contract with. That is not a decision of the elected official. If it does go to court, then the elected official makes a recommendation, the county can make a recommendation, and the presiding judge would actually pick who the attorney would be.
And this is all with taxpayer dollars to supplement services, for a high paid position. So interesting. All right, I'm done questioning.
Supervisor Bohn.
Yeah, I appreciate Jefferson's approach. I think, I wasn't sure if it was you who I talked to back in July when I had charges filed against me to county council and the HR, and I was told I had to hire my own attorney. And then we did a 4-month investigation into the charges, numerous charges, and came back with no findings. The investigation cost the county almost $22,000, and there was no findings. So, but I had to retain my own attorney just for my own benefit in case they saw something that didn't come to the head, and it was between myself and another department head. So, but I could not get representation through the county because that would be, the quote I kept hearing was it'd be a gift of public funds. And I asked before I got an attorney, but I think in this case, the attorney's been hired. You asked if we could choose the attorney. The attorney's been hired. And I think the letter basically asked, I says, hey, I've been hired, will you guys pay me? I like it. It's a good approach, but I don't think I can go down that route because I had to go down the route the other way. So.
Okay, any further discussion here, Supervisor Wilson?
There's a balance between what we expect. This is the kind of discussion we have in closed session right now, right? Which is the balance between, what we think we should do to protect the county's interests, what the people involved, their situation is, what the exposures might be. This is kind of why this is a little bit weird to be having this in this space, because we are perceiving, I perceive anyway, threatened litigation. And so I don't know where to go with this. And so
well, let me just say also, this really, okay, I'm looking at the agenda item, and the letter is in response to an interview notice sent to the auditor controller regarding an investigation concerning delays in payments, transfers, and reconciliation of accounts. Now, we've been talking about this for several meetings. This is an issue that we're just trying to figure out in the county. Of course, I can't go into any more detail on an internal investigation, but this is I
believe the chair is frozen.
Departments, other, pardon?
Chair, I believe we missed about the last 30 seconds.
Oh, yeah. Okay. Yeah. Just said it was unstable. Well, I don't know how much you got, but basically I'm just saying that it seems to me that we have talked about these issues already. It seems to me we can't talk about much because it's internal, but I don't see any charges or anything or any reason for someone to have an attorney. I mean, I don't know. But anyway, that's where I land on this. Supervisor Wilson.
And again, I mean, my interpretation, I could be wrong, of this type of investigation is that it's really about an issue and not about people particularly. And that what comes out the other side are recommendations, findings and recommendations, which we do with audit reports and all kinds of things too. So, I mean, it seems like that's kind of where it goes. I don't, and again, I'm not an attorney in this space, but I don't see this as to create charges or to doing those things of anybody in particular. I do know that often when these investigations are happening and, there is conflicts between humans that are happening in those spaces. I get it. I mean, we're a big organization and that's, people, well, that's part of dealing with, that's why they call it human resources. You're dealing with humans, but at the same time, I guess, I don't know. I mean, any further analysis for me, I feel like again is more in response to litigation to so I don't know. I'll let Steve jump in.
Did you have something to say, Supervisor Madrone, on this issue?
Oh, Lord. What I would say, I can't say, because of everything you've already all said. My preference would be to press the reset button. And without getting into the details, because there is a lot of this stuff that probably only should be discussed in closed session. But here we are, we're in the public. The public deserves to see transparency. So what I would say is that there have been a lot of problems. I think today we just turned the corner on helping solve some of those. I think as soon as we get the positions filled in the AC's office, we will solve more of those. And I believe that what we're going to see is a repair of all of the reasons for why this situation is even occurring. Would that go easier if there, was an attorney involved or this, that? Oh God, I don't know. These things, once you get to this stage of attorneys, it just starts going down the rabbit hole, and we no longer can just be human beings and apologize for whatever actions we or others might have taken that created conflict. I've said this before, that I just wish we could just apologize, recognize there were probably some mistakes made. I don't think anybody was negligent or being, irresponsible. I think everybody's overworked, understaffed, and we're all going crazy with COVID, And so for me, what I would say is I would love to see this just kind of go away, get the people hired in the AC's office, get MGO on board to help us get everything up to snuff, and figure out what we're going to do in the CIO's office for help. So, I mean, that's kind of where I'm at. I'm not going to spend much time belaboring it.
Thank you, Supervisor Madrone. Supervisor Bass and then Supervisor Wilson.
Thank you, Madam Chair. Lots already been said. I mean, for the fact finding, I don't really know why an attorney would need to be there. And it doesn't threaten litigation in that letter. But Supervisor Madrone, we've talked about reset the button. And I think that's what many of us are trying to do. I mean, I will say for my part, I thought a lot this weekend. And I reached out to, the auditor on Monday and said, I apologize for some of my things I've said and, et cetera from there. And she replied as well. And, I think the two of us at this point are like, okay, let's start over. There's a lot of relationships that need repair right now. And it's not just in the county family. It's like, unfortunately, it extends. So, yeah, if this could go away, as Supervisor Madrone said, I'd appreciate that from the standpoint that generally attorneys getting involved, I don't expect that to actually, I think that actually is more likely to cause a bigger disturbance. And I know certainly that I would want the board to be able to choose who to hire. And so, you know, that would be, you know, just putting that out there, and hopefully that's not even the direction we're going to go, but it's like, I think it feels like being kind of, yeah, litigation, threat of litigation. I agree. I'd rather not go there.
Councilor Billingsley?
If I may, I mean, obviously this item has sort of come forward in an awkward way, just sort of, it happened naturally. But I mean, if the board does want to consider some of these items in closed session, I think that is definitely justified, and that could probably happen next week. I mean, we have established a public record of what the request is and what the basic issues are. I just wanted to put that out there.
Thank you. Any further discussion about this item? Supervisor Wilson?
It's all right. I'd like to I'll make a motion that we postpone this decision and seek a closed session item to discuss further. Again, it's based on the assumption of the assumption of threatened litigation. It's just an idea.
Okay. Supervisor Bohn.
I'd wait for a second on.
I'll second it. It still was kind of a clunky motion, so I was going to ask Supervisor Wilson if he could kind of like streamline it a little bit.
I'm gonna take a little bit of a moment here and say my parting gift is like, when you make a motion, have it thought through and then make the motion. But don't make your argument in the middle of making the motion, because it makes it very difficult for Ryan or anybody else to know it. I'm sorry, Supervisor Wilson, but maybe just clean it up and I will go from there.
Yeah, I just couldn't think of the word. What I'm asking for is that we, what's the word that we use? Help me, Jefferson.
If I may, you would just continue it for 1 week. My office will put the closed session forward. We would just have it scheduled before the item is publicly discussed.
That's it. So basically, to continue this item and request a closed session to discuss.
And if I may, for the record, in my letter, my first response to Ms. Day Wilson, I did inform her that no interview requests will go to the auditor controller until the board meets on this item, and I think that would stay true until next week, that no action will happen until the board makes a decision, just so she knows there's no need to rush to court or anything like that until the board's made a decision.
Good plan. I think everybody.
That's not part of the motion. That's just so it's in the record.
Yeah, okay. All right. Did you? Oh, my internet says I'm unstable. Can you guys hear me?
Yes.
Yeah. Okay. Good. So Supervisor Bohn, did you have something? I'm sorry, I didn't want to go. No. Okay.
No.
Okay. Alrighty. So we have a motion and a second. I'm going to go out and see if we have public comment on this item. We do have 2 hands raised, and they're pretty familiar. Item last 4 of 7454. If you could press *6, please. Bring you into speak with the board.
Well, this is Ken Sawati. I like the direction you're going here. That one of the options that wasn't mentioned was just to kind of set aside and just drop the investigation for now. I think that would be in everybody's best interest. That makes any, and I saw no threat of litigation in those letters. I'm not an attorney. I saw a justification for being made to be the counsel. It was also, one of you made mention that you found all kinds of errors in the letters that were sent there, and I would hope you would go ahead and state what those are, because as far as I'm concerned, an attorney may have just been liable, but that's, just, I wouldn't make those statements. I just, regarding Rex, it's, I think they pointed out here, there's 3 protected classes here: assessor, auditor, controller, sheriff. And I think your counsel told you that. That's why you're not in that class there. And so you would have to get your own counsel. To let you know, Estelle, I would, if I was in the position of anybody in any kind of a thing like this, with what's going on in the tenor in the county, I would be afraid someone was coming after me for malfeasance in office. And there may be other repercussions going along with that. So this is not a small item to have an investigation with the current tenor you have out there. I really wish, like you say, it would just go away. And I just kind of see the same thing happening that happened in the Jeffrey Blank case. No, you're asking someone, but you're not telling them what's being investigated. If you want someone to be willing to comply, let them know what the charges are, the reason for investigation, definitely, and what might be their part in that. And you can't expect anybody not to have an attorney without having full disclosure as far as what's being investigated. So, I highly recommend, I appreciate the fact that you realize there'd be a conflict of interest. That was cut and dry, perceived by everybody I talked to. This is a hot potato, and I would drop it right now. And hopefully, like Supervisor Madrone and some of you mentioned, let's get past this, and let's set the investigation aside for 60 days, and let's see where we're at there or something. But I would notify them that that's what you're doing. We're setting aside. That would be an action you might want to take in closed session report out. We're setting aside this for 60 days, cooling off period. Let's get past this. I don't want to see you guys spend, a couple $1 million again, like you did in Jeffrey Blank by the time 18 months of paid administrative leave, which you can't do to her, obviously. But the settlements that will come out of this, I don't see the implied litigation threat, but that's just my opinion. Not a lawyer. Take care. Good evening, everybody. I hope, is this our last one? Don't know. Bye bye.
No, there's still more to come.
Damn.
Let's see. We have another caller here. 3053. Welcome.
Hello. Good evening. Thomas Mulder here. You can hear me, correct?
Yes, we can, Thomas.
So, as an outsider looking in, there's all kinds of interesting things. I oppose the Board of Supervisors authorizing this expense of taxpayer dollars. Quite interesting that someone that gets paid well over $100,000 a year can't afford their own attorney expenses. Heard Rex spent his own money on attorney fees, so I don't think you should do this. And if you do feel that you legally are obligated, I heard the county has the right to pick who the attorney is, so maybe something a little more economically feasible. It's pretty sad that an investigation into things that aren't being done right makes someone go out and get an attorney. Is there a possibility? I mean, usually you do that whenever you're guilty or something's going on. So it makes me as a taxpayer of this county very unsettled, very, very concerned that I agree with Madrone, like, make it go away, but it ain't going away. If it was going away, the AC would have been on the call today for both last agenda items, and the AC would have said, you know what, I'm going to fund this bill because there's nothing to hide, so there isn't a lot of lawyer expenses. So when you guys go to potential threatened litigation, it's going to be a stretch to even talk about what you want to talk about. This needs to be open in front in the public, and if there's nothing to hide, who cares if there's an investigation? Doors wide open. Actually, the door's closed at that office. I forgot about that one. Look forward to speaking on other agenda items tonight. Thank you for the opportunity to speak.
Thank you, Thomas. I don't see any further public comment on this item. I'll bring it back to the board. Any further discussion before we go for a vote? Supervisor Bohn.
This actually, Jefferson, can't you just bring this back? Do we need a motion for you to bring it back? can't we just direct staff? I mean, if you guys want to get all formal and everything, but I mean, can't we just direct staff to bring this back? Because we're not making any ruling on this whatsoever. I mean, the way I read it, I mean, if you guys want to do the roll call and everything, I'm all for it. But do we actually need to do that, Jefferson?
Supervisor Bohn, I will put the closed session on, but I think depending on how the board decides, it may make sense to have the actual sort of rationale explained in open session, so there's a record.
Okay.
All righty. Supervisor Wilson.
I just want to make sure that, I mean, I put that motion out there for discussion, but if, I just want to make sure, is there appetite from this board to consider paying for that attorney, for not this attorney, because I wouldn't do that, but pay for a separate attorney to move this forward? I just want to make sure that that's not, if that's in the, I mean, in the current context. I don't say that in terms of like, well, we'll move forward later. I don't know. My motion is as an alternate to paying for an attorney, but not this one. And I just want to make sure if there's not 3 votes to do that in the current context, without further discussion based on this perceived threat and litigation, then I'm willing to move forward with what we got. Because otherwise, we don't have to come back again.
Supervisor Bass.
Thank you, Madam Chair. Supervisor Wilson, I think I know what I heard you say, but can you say it one more time? It's like you're wondering if anyone has the appetite to, well, not hire this attorney. I mean, what are those words again? Just because I think I might agree with you.
I mean, another option would be to pay for an attorney under the stipulations that were given to us by Council Billingsley, and then just say yes to that. Of course, that would be an attorney that we agree with. Jefferson, can you help me with that? I mean, I really don't think it's appropriate to, if we were to do that, to move forward with the attorney that has been put forward by the controller. But I would consider the idea of that, but I just want to make sure. I mean, what do you think, Jefferson? And how do we put sidebars on that in the motion if that was the case?
Well, if the board is considering making the findings to appoint outside counsel, I could come back with an item with a recommendation for an attorney, aside from Ms. Day Wilson, that would be appropriate. I've put out some feelers on that, but I don't have a solid recommendation at this point.
Mm-hmm. Okay. I'll stick with the motion that we have right now, unless there's, like I said, appetite to move in that other direction.
Supervisor Bohn.
And one of the other options was to just do it in-house. I mean, right?
It was an option, but I think Jefferson, Council Billingsley laid out that there was a potential conflict with that.
Potential, but is there? I mean, there's a potential conflict on everything we do. I'd like to seek something more definitive. I mean, if we're looking, I have no appetite to pay for any attorney to defend it at all. So I mean, I just so you know, I'll be voting no.
Yep. Yeah, I mean, honestly, Supervisor Wilson, again, I'll reiterate, I just don't see the need. If we need to have a meeting, a closed session meeting, to get dive down a little bit more, I hear what Supervisor Madrone is saying. We're second guessing. We're doing this, in fact, it's a gigantic display of passive aggressiveness in this county right now that is just unbelievable. So it's like, we're trying to guess. And I really would like to see some clarity here. And for me, it's really clear, but if there is something in there where we need to consider because there's a perception of a need to consider, then maybe we need to go into closed session.
Well,
And so that's where I see Council Billingsley's recommendation is probably best for the kind of situation we have. But Supervisor Bohn.
Well, and I heard us talking earlier, why are we talking about this in public? And then I heard one or two supervisors saying it's transparent and it's a great way for the public to see it. And then right after we say it, let's take this into closed session and discuss it. I mean, I put our cards on the table. I mean, I'm willing to say I don't want to hire, and I don't care what class I'm in. I've got no class then, but that's obvious. But I'm just saying, are we going to hire? I don't care if there's a class or not. If this flashes back on any of us, do we hire everybody attorneys? And then the fact is that you go hire the attorney, and then you say, then you have the attorney write us to pay for them. And I'm sure, I bet they're watching. But I truly think that I don't know what we're taking into closed session to talk about that we can't talk in open session after we talked about how we're actually, this is good because it's so transparent. Maybe you could explain that to me.
I'll put it forward if it through the chair, which is when you have a threat of litigation, you have to weigh that threat and all its cost benefit analysis, whether or not you know, there's like the right and wrongs of all the stuff, and then there's just what risk are you putting the county at within litigation? And so, yeah, I mean, and you really, and then once you believe there's a threat of litigation, you know, in balance to protect the county from those potential liabilities, you have those discussions in closed session. And so that's that. I mean, I'd say it sucks that we're having to be in that position, but that's what these letters have put us in. For me, has put us in that position where we have to weigh that potential, that litigious threat. And I don't know. I mean, maybe it's not intended. I don't know. But when I read that, that's what I get. So that's why I think there's that space. And I will say that if there's discussions about what our board might do with relationship to, I'm not even going any further, because if I go any deeper, yeah, I think we put ourselves in jeopardy. Yeah. Again, I don't know what that intent is, unless there's something comes back with intent like, hey, we don't really intend to sue you. Then maybe this conversation changes very differently. It's very different, but it's like, I don't have that right now. Not feeling that way.
So the thing that leads you to believe that there could be a threat of litigation is, this is in the record, it's in the agenda packet. Let's see. If the Board of Supervisors refuses to acknowledge that the Office of County Counsel has a conflict, Ms. Paz Dominguez will apply ex parte to the presiding judge of the Humboldt County Superior Court, requesting that I be appointed as counsel. That's from Ms. Cindy Day Wilson. Is that what you perceive to be a threat of litigation, Supervisor Wilson?
Yes, I believe that. Okay. But understand that starts down a road, and maybe
yes.
Once we start getting into the judges, then it's like you don't know where it expands from there. I'm just saying we've seen this before. I mean, not this exact thing, obviously very new, but it's treacherous space, or it can be without knowing people's intent. You know?
Okay, so any further discussion before we go back to that motion to continue this to next week and take the matter up in closed session?
Just one question for our council. Do you think this is a reasonable course of action?
I'm sorry, was that a question for me?
Yes.
I do think it is a reasonable course of action.
Thank you. So, taking that under the advice of County Counsel. Ryan, if you would, we'll do a roll call vote on this.
Yes, Chair Fennell, and I'm just going to restate the motion as I understand it, and
please
continue this item to December 15th, and also seek a closed session item. So that you'll have a closed session item, and you'll also have this on your agenda as well. Is that correct?
Council Billingsley, does that fit the course of action? Okay.
Yes, Chair, that was my suggestion.
Okay, great. Thank you. All righty. So with that, we'll take a vote, please.
Thank you, Chair Fennell. Supervisor Wilson?
Yes.
Supervisor Madrone?
Yes.
Supervisor Bass?
Yes.
Supervisor Fennell?
Yes.
And Supervisor Bohn?
No.
4-1.
One. All right. So thank you for that. Now we're going back to public hearings. And this one is from the Planning and Building Department, and it regards the extension of the temporary moratorium on the cultivation of industrial hemp. So go to Director Ford on this item, receive and consider the staff report, and then we'll open the public hearing.
Thank you, Chair Fennell. John Ford with the Planning and Building Department to present a 4-month extension of the existing 12-month temporary moratorium on industrial hemp cultivation. Before I talk a little bit more about it, I think we do need to have it introduced by the County Council, so I would ask Mr. Billingsley to do that first.
Please.
Thanks, Director Ford. Before the board is the introduction of an uncodified ordinance extending for 4 months and 15 days a temporary moratorium on cultivation of industrial hemp. And I just wanted to add for the board, there's a new rule in the new year that if we change our agenda items, I will no longer have to read out all these titles. So I think we can all look forward to that.
Thank you, Mr. Billingsley. So as Mr. Billingsley mentioned, this is a 4-month, 15-day extension to the moratorium on industrial hemp. This would extend the moratorium from December 25th, 2020 to May 10th, 2021. The board will recall that the demand for industrial hemp was generated largely from individuals who were interested in cultivating hemp for medicinal purposes, and those were predominantly individuals who were associated with small farms who felt alienated from the cannabis permitting process. The outshoot of that discussion was the work on the small farmer amendment to the commercial cannabis land use ordinance that was initiated by the ad hoc committee of Supervisors Estelle and Fennell and Steve Madrone, and that has now been adopted and is effective. So now the focus from a regulatory standpoint turns to addressing industrial hemp with the direction from the board to develop a more permanent ordinance. Staff will be working on that in the intervening approximately 5 months now to get that done. And staff would ask also that you would make that part of your action to direct staff to continue work on that ordinance. So if the board were to choose not to adopt this extension, hemp cultivation would be unregulated, and this is not recommended. There was a lot of opposition to allowing industrial hemp within the county, and I won't go into all of that again, but I would be happy to answer any questions. This does conclude staff's presentation.
Thank you, Director Ford. Any questions for Director Ford on this? Okay, I'll take it out to public hearing now, to open hearing, and hear from the public. I see some hands up, and if there's anybody else who wishes to speak on this item, if you would call the numbers on the screen and press *9, you will get in the queue. And when your number is called, you can, well, I'll give you instructions to get on. So we begin with number 7454, Welcome, Kent.
Thank you, Estelle. So I was speaking to one of the people who spent the time to try and get into this business today, and they've decided, of course, not to move forward because the county really didn't want to get involved with the CBD kind of. And I didn't quite understand what John Ford was saying a little earlier, that you guys do have some regulations for small growers who just grow the medicinal. Maybe I didn't get that clear. It'd be sometime it would be nice to get some clarity and a little more details as far as someone availability. And I don't. One time they were talking about only people who had the regular pot permits moving forward. So that's the first I'd heard about that. So I guess King wants to know about it too. There, it sounds like. Anyway, I'm just curious how that one was going. And of course, I let my license that I was anticipating getting lapse, and probably will not be moving forward with this, as just about everybody else has that I've heard about. But I would be interested in if there ever sometime, maybe not now, but agendize some details regarding what was mentioned earlier. Maybe I totally misunderstood. So I think it's sad, but hey, so be it. It's the will of the board. And that's my comments on this particular extension. Sounds like it's going to move forward. And I can understand that because you don't want it just to go crazy out there. So I concur with that extension at this time. Hopefully develop some guidelines that are workable for people who want to go ahead and do CBD, not just the big stuff. And it's growing basically the same as your cannabis. And so you really would have very little chance of any kind of cross-pollination. So that's my opinion. Thank you for my opportunity to speak.
Thank you, Kent. The next caller is 4 digits 3053. Welcome, Thomas.
Good evening, Thomas Folder here. One of the items I was actually following you guys for to talk on today. I would say I encourage you to pass this moratorium. With that motion, I encourage you to pass a motion to direct staff to make a permanent ban on hemp in Humboldt County. I think Humboldt is not the place for industrial hemp. At least make a recommendation for industrial hemp. I think a lot of people were wanting this as a way for the small farmers to get in there, and people that were left out of the permitting process. You have since up the personal use to 400 square feet on parcels over an acre, I believe it is. So that allows for a lot of people to provide that medicine that they would barter and with other people, other medicinal users, as well as the small farmer ordinance that will allow 2,000 square feet on residential parcels over 5 acres, if I remember right. I can't remember the exact language. So I think the county's done the work to try to throw out that safety net to try to save some of the smaller farmers that didn't make it through the original permitting process. And also with the personal use, the 400 square feet allows those people that don't want to be in the regulated world and just run in the medicinal barter system to move forward. So I encourage you, once again, pass this moratorium and please direct staff to make a permanent ban on industrial hemp. Thank you for the opportunity to speak.
Thank you, Thomas. And we do have another caller here. It's the last 4 of 2223. Welcome. You have been unmuted. Caller with 2223. I can see that symbol says you can talk.
Can you hear me now?
Yes, we can. Mm-hmm.
Thank you, Madam Chair. And I just want to acknowledge this could be the last time we engage with you on a public forum like this. And we've appreciated your service to the county. To the matter at hand, I completely agree with Thomas. Let's close the door on hemp. We still have so much unfinished business with cannabis. At the moment, the county building and planning is still needing to sub out to get more help with finishing the building permits and planning permits and all that. So to bring on hemp would just open the floodgates to the building and planning and totally overwhelm and slow this. We've had over 4 years to work on just the cannabis component, and our time as small operators is ticking as the state will open up to larger operations. And then we also have other counties like Lake that is going It's going off the charts, literally. 8-acre grows, hemp or THC, whatever you want to do down there, and they're streamlining it. We really, really just need to move on to the new business. Finish the old business and close the door on hemp. I think that's pretty much what I want to make sure the point is driven. And it really comes down to our genetics would be in jeopardy with pollen drift and so forth. Last year's Emerald Cup, Humboldt County bringing in multiple spots in the top 20. We've definitely made our mark on the world and the state as cannabis producers and notorious for our legacy genetics. Thank you so much for the time, and we appreciate you hearing my call. Thank you.
Thank you very much. We have, and again, the number is on the screen, and you press *9. We have another caller, 2912. If you could press *6, you can be part of the conversation. Welcome.
Hello, supervisors. Thank you for considering this item today. My name is Russ Gordon. I'm Policy Director with Humboldt County Growers Alliance. Want to echo the comments from Thomas and Craig just now. Strongly agree with both of those. Historically, we've had a lot of concerns about hemp in Humboldt County, which stems from a lot of different issues, but I think the core of the issue is the fact that hemp, when grown for CBD, and THC cannabis are essentially the same plant, grown in the same way, that are governed by two very, very different regulatory frameworks, which creates a lot of distinctions in terms of the environmental regulation and the pesticide regulation. And that parity has always been a concern for us, and the challenge of trying to reconcile those frameworks. As Craig mentioned, there's also a lot of concern around cross-pollination. We're seeing a lot of unstable genetics with hemp, and those unstable genetics create concerns, as well as the scale of hemp production, about potential cross-pollination and losing the thing we have here, which is so unique, which is the cannabis industry. And really, over and above all of that, I think looking at how the hemp industry is playing out around the country, this is really a commodity industry, which is really based on an industrial agricultural paradigm. That is how hemp CBD is being grown and marketed and sold. And so investing our energy as a county really in the cannabis industry and in the opportunities that has to create a real small farm craft industry really seems like the more appropriate road to take for Humboldt County. I also want to just echo the comments about the 2,000 square foot ordinance and about the, I think, really positive steps the county has taken to help small farmers get into the licensing framework. And would encourage continued attention to that issue and making sure that that 2,000 square foot ordinance is made as successful as possible and helps as many people as possible transition into the regulatory framework. And we think that approach is going to be a much more fruitful approach to reducing those barriers to entry than opening up hemp with all of the other issues and complexities that creates. Thank you.
Thank you, Ross. I believe that's it for the calls on this item. Thank you, everyone, for your input. We'll bring it back to the board. I do want to reiterate that there was a question about the 2,000 square feet. So I'd love, I know that myself and Supervisor Madrone are very familiar with this. We worked it out over a long time with a number of people, including staff, but perhaps Director Ford can clarify it for anybody who doesn't understand. But the bottom line is this is, again, an ability for small farmers to enter into the cannabis industry without too much difficulty. Director Ford?
Sure, thank you, Chair Fennell. The important thing to understand is that from a regulatory standpoint, as was mentioned by the public, cannabis or hemp are basically grown in similar ways. Medicinal cannabis or hemp, medicinal commercial cannabis are grown in the same way. So we treat them the same, we regulate them the same, we permit them the same. And the thing that we have done with the 2,000 square foot, the small grower amendments, is to create a much lower threshold for small farmers to get in, giving them a reduced time frame to get through the process, giving them a set fee so that they know that they're not going to end up with a huge bill from the county at the end of the permitting process.
Thank you, Director Ford. Supervisor Bohn.
So we brought that forward about what, 2-3 months. Are we getting quite a few people applying for that permit now?
We're getting a fair amount of interest. We've had application assistance meetings. In fact, I just talked to our senior planner today about a question relative to one, but to date, we have not received one formal application yet.
And then through the chair, I think the previous speakers make a good point. I mean, hemp is down to, I don't know, I've heard 350 flowering CBD plants are down to 350 or $4 a pound. I don't know if we have enough ground to grow it on, but I know the market is tanked. Oregon is tanked. And I just don't know if we could go with a permanent ban instead of keep bringing this back. And then if miraculously it becomes back to being a great moneymaker, I'm sure we're going to hear about it. But I think we're hearing from a lot of people. We're not hearing from a lot of people because it's kind of like, I don't know, building Edsels. There's no money in it. So I don't think anybody's going to do it. So I don't know if there's going to be any reason not to do the other way. Maybe the planning director can tell me, or maybe Jeff. I mean, Jeff would probably hear about it if somebody wanted to grow it. And I mean, I don't know what you've heard either, Jeff. Ag Commissioner Dolph.
Welcome, Commissioner Dolph.
Did you unmute me? Yes, you did. Chair Fennell, Supervisor Bohn, Jeff Dolph, County Agricultural Commissioner. The level of interest that's been expressed to this office is down precipitously from last year. We had 2 registrations. One was the same individual that was cultivating in Arcata last year, and the second individual was in the city of Rio Dell. I would mention that the city of Arcata and the city of Rio Dell have no prohibitions on the cultivation of industrial hemp. And so we've had one other party that's interested. They would be producing industrial hemp nursery stock in the city of Arcata. We have yet to receive an application from them, though. We've discussed with them the process, and so we're anticipating an application anytime. But other than that, there has not been a lot of interest expressed towards this office.
Through the chair, Director Dolph, if we put a ban throughout the county, that would not proceed. Arcata could plant it on the plaza if they wanted to, right?
That's correct.
Thank you.
Thank you. Okay. All righty. So do we want to move forward with a motion on this staff recommendation for moratorium? Supervisor Wilson.
So is there a maximum for this moratorium? I mean, I hear we have the 4 months and then the forever. Is there anywhere in between? Are we allowed to do?
So through the chair, the current recommendation and action before the board is for an additional 4 months, 15 days, which is the maximum that we can go under a temporary moratorium.
Okay. Yeah, that's what I thought. I was just trying to remember from the past. Okay. I mean, I'll make the motion to go with staff recommendation. Although I am empathetic to the idea of if I had the choice, I would probably make it 2 or 3 years, and then if we wanted to come back to it, I just don't know about, prioritizing staff's time on coming back with an ordinance.
It could be, I mean, I don't know how it goes. And obviously, if you're going to go with a plan, maybe we could, instead of you going in, diving deep into coming back with an ordinance, come back and say whether, give the board a choice of, do we have a permanent moratorium, or do we go forward and then go for creating an ordinance? I don't know.
So if I'm hearing the things being said here is that reading between the lines, not a lot of time spent working on this, feel more comfortable with something that's more cut and dried and perhaps even for a period to be revisited in a few years.
Exactly.
So if am I understanding that's the motion?
Let me try and reframe the motion. So it is to continue the moratorium to its maximum extent possible, 4 months and whatever that was, and with direction to staff to minimize work on ordinance for this. And then when the moratorium is over, bring back, or this current temporary moratorium, bring back an update and assessment or recommendation on where to move forward from there.
Do I hear a second?
Supervisor Bohn seconded.
You did? Okay, sorry about that.
Yeah, good.
Thought I heard you second, so.
I don't.
I'll take it. It doesn't matter.
Okay.
I kind of forget what day it is.
Ryan, are you clear on what the motion is there? Okay. I know.
I was writing as fast as I possibly. Yeah, I was writing as fast as I possibly could. So my understanding is that we're approving staff recommendations. That's the portion to continue the moratorium, and then we're giving direction to staff to minimize work on the ordinance, on the moratorium ordinance, and then bring back an update and assessment of where to move forward when it expires.
The only
correction,
not an update on the moratorium, but an update on the hemp ordinance.
Yeah. Update on the what?
Hemp.
So it'd be an update on how to move forward into the future beyond this moratorium.
There you go.
So basically, it'd be a report and recommendation from the Ag Commissioner's Office and Planning and Building on how to address hemp moving into the future.
Now the seconder has a question here.
Good. And if the firster will have, could I throw an exemption in there for learning institutions? We have a local junior college that is actually going to maybe take a certain part, and John's aware of this and stuff, that has been talking about putting this into their curriculum. So some of these farms would have staff, ground ready staff, if this is going to go as mainstream as it's going. And since the hemp plant and the marijuana plant run so concurrently and react so to mold and everything the same, they are talking about putting some plants up at CR, not out at the Stafford farm, for what I understand. And if that's the choice they do, I'd like to have an exemption for any learning institution, certified learning institution or whatever. I don't know if Humboldt will take on. I mean, they've got a Center for Marijuana Institute or whatever. So I think we should probably leave that open, knowing that it's not going to be a commercial operation. I don't know if that's how you'd word that, but I'd like to make sure we don't make it any more difficult for them if they decide to pull the trigger when we get out of this when we go back to hands-on learning. Is that understandable?
And Supervisor Madrone?
Yeah, I agree with what Supervisor Bohn just said. Great day today. So, but the thing is, it seemed to me that the staff recommendation, if you look at the whole of it, was to do exactly that, was to extend the moratorium for 4 months and 15 days. And then staff were going to come back to us with a recommendation for a hemp ordinance. Now, if I remember back a year or more ago when this all started, I think that if we don't establish either a moratorium or an ordinance, I believe people can just go out and grow hemp. So, we've extended this moratorium as far out as we can go if we do this today. And then if we don't do something in 4 months and 15 days, people are going to be able to just do it. Is that correct, Director Ford? Am I remembering that correctly, or Director Dolph?
You are precisely correct.
Yeah. So I frankly don't like this motion, and I liked the staff recommendation, which was to extend the moratorium 4 months and 15 days, and for staff to come back at that point with recommendations for a hemp ordinance. That doesn't mean it's going to say, we're unleashing hemp in the county industrially and everything else. It may very well say, no industrial hemp whatsoever, but maybe cottage hemp that's done carefully without, male plants or whatever. I mean, we don't even control male plants in the cannabis industry. So it's kind of an interesting thing because people want to be able to breed, but they want to breed professionally and carefully, not just have a 50-acre hemp farm next door that's spreading, pollen into their crops. So I liked the motion that the staff recommended, and it also included coming back with this recommendation for research institutes like CR. So thank you, staff, for the work you did to bring us that recommendation. And that's what I would support.
Okay. I rescind my motion if that's all right, but I do have a clarifying question for Supervisor Madrone. And I'm wondering if in the motion that we can clarify that if there is an ordinance that comes back, or when an ordinance comes back, and we'll have a choice between that and a moratorium, that the ordinance focuses on small scale, that we're just going to say right now, like even if we're going to consider something, it will be considered, we'll only consider small scale. Otherwise, it's a moratorium. Does that make sense?
It does. Through the chair, I would make a motion to approve staff recommendation with direction to staff to focus on small operations for hemp, if at all, and research, as was said.
Supervisor Bohn?
If we're worried about cross-pollination, 10 plants will do it as much as 1,000 plants. One plant will cross-pollinate, and there's an obvious reason we don't exempt male plants from cannabis. I mean, I think, so I just think, and what that does, it allows somebody, and I know nobody would do this, but they're all, I mean, we just saw 2,400 acres of cannabis cut down in Bakersfield, and the guy thought, he said he must have got the wrong seeds. He swears to God that he was growing hemp and he wasn't sure. I mean, so what we're going to do is we're going to put such a burden on our staff of these 40 plant, 50 plant things, and they're going to let us know they're just growing hemp because there's no way you can tell. I mean, it costs, I think the machine to decipher it, and John could tell me, is rather expensive, but by the naked eye, from what I'm hearing, the best of the best can't tell the difference until they. So I don't think cottage hemp is I don't think there's a market for it. There's just more opportunity to create deception. And why make good people a criminal? I mean, we're just giving them the opportunity to do it. I don't think we should. I like the idea, but I don't know what the craft hemp market is. I don't.
Well, especially since we have passed the 2,000 square foot ordinance, and that doesn't mean you have to do 2,000 square feet. You could do 500 square feet if you want to do it commercially. You can grow hemp that way under the cannabis ordinance, and it's very few regulations. There's going to be regulations one way or the other. So I don't know. I tend to agree with Supervisor Bohn on that. I am. And the only question I had was what came up, what kind of engendered that fuzzy motion was the concept that the planning and building department is busy enough as it is. Do we want them to spend time creating that ordinance? If it seems like the general feel of the board is to extend the moratorium, I don't know. So that's where we came, but let's just go with what we settled on. But what are your thoughts, Supervisor Madrone, on our concerns about the small?
Well, I appreciate all the comments from the board and the public, and I have utmost faith and trust in John Ford and Director Dolph that they have heard the community, they've heard the industry on all sides. They had a lot of workshops. They understand these issues we're talking about here today, and I have every confidence they can bring back to us a recommendation in 4 months and 15 days, or a little before that, to either decide whether or not we're going to have an ordinance that says we're only allowing research hemp, or whatever we decide, or we say we're going to ban it completely. But, you know, we need to do something before 4 months and 15 days, or it will be allowed unregulated all over the county. So let's just go with the staff recommendation. Keep it simple. Staff have heard our comments and directions. I have faith in them.
Great. So we've got that. Now we're drilling back down. That's your motion, right?
Yes,
Do I have a
that's
second?
my motion, and I'm sticking to it.
Second.
And we have a second. Okay.
Faith in you, John.
All right.
Faith in you, Jeff.
Excellent. That should be pretty easy, Ryan.
Approved staff recommendation. I got it.
Okay. All right. Let's go with a roll call vote, please.
Thank you, Chair Fennell. Supervisor Bass?
Yes. Excuse me.
Supervisor Bohn?
Yep.
Supervisor Wilson?
Yes.
Supervisor Fennell?
Yes.
Supervisor Madrone?
Yes.
Thank you. Passes 5-0.
All right. We have one remaining item, you guys. And this also comes to us from the planning department, and it is also a public hearing. And this is the Small Pacific Group Development Agreement. Open a public hearing, and I guess we'll go to Council Billingsley to introduce the
Thank
item.
you, Chair. Before the board is introduction of an ordinance approving a development agreement between the Samoa Pacific Group and the County of Humboldt.
Thank you. And go to Director Ford.
Thank you, Chair Fennell and members of the Board of Supervisors, John Ford and Trevor Estelle, to present the Planning Commission's recommendation to adopt a development agreement associated with the Samoa Town Master Plan. I'm going to let Mr. Estelle kind of walk through the development agreement if you're ready to. Yep.
Okay. Thank you, Director Ford. Good evening, supervisors. This item before you tonight actually is a development agreement between the Samoa Pacific Group and the County of Humboldt for the development consistent with the Samoa Town Master Plan. The master plan has been in the works for about 20 years and covers approximately 185 acres of land in and adjacent to the existing town of Samoa. The master plan provides for future development of a wide range of uses within the town, including tourist-oriented accommodation and retail uses, new and renovated housing, business and industrial uses, historic, cultural, recreational uses, community uses, and parks and open spaces. More detailed history can be found in the Planning Commission staff report, which is attachment 6-year board report. As outlined in the board report, development agreements are contracts negotiated between project applicants and public agencies and can provide the county with public benefits by requiring the developer to provide certain public improvements and benefits that would not otherwise be obtained through the normal approval process. The development agreement provides a developer with greater certainty in the development approval process by vesting certain development rights. In return for recognizing these certain vested rights and avoiding future conflicts, the developer in this case has committed to certain public benefits, including the sale of approximately 35 acres of coastal dune property to a nonprofit land trust to be preserved in perpetuity as open space, the construction of additional parking and trail improvements to facilitate and encourage public coastal access, the formation of a Peninsula Community Services District to provide the provision of utilities, emergency medical services, road maintenance, storm drainage, parks, recreation, and open space, the construction of affordable housing units, and the expansion of tsunami evacuation education, signage, and protocols to include areas outside of the Samoa Town Master Plan. The development agreement was negotiated with the participation of the applicant, the Planning Department, and the Office of County Counsel. The development agreement previously went before the Planning Commission on July 9th, 2020, in which they found it to be consistent with the findings in section 2171-14 of County Code and made a recommendation on its adoption to the Board of Supervisors. Staff believes that the findings can be made based on the submitted evidence. I did see in the agenda there was one public comment requesting sidewalks, and just wanted to point out that sidewalks are proposed along Vance Avenue and some of the other side streets that are wide enough to accommodate them. And finally, I believe Mike O'Hearn is the project applicant, and I believe Dan Johnson's also here. If you have any questions for either of us. So I'll end my report and try to answer any questions you may have.
Thank you very much, Trevor. Does either Mr. O'Hearn or Mr. Johnson want to speak? I see Mr. Johnson right there. Do you have anything you want to say, Dan?
Well, I'm Dan Johnson, Danco Group, Arcata. No, I don't really have anything to say. I think Trevor teed it up very well, and it's been a long day for you guys, so I won't bore you. I can answer questions though.
Okay, that sounds good. It's just a fresh face, Dan, you know. Let's see. Okay, any further discussion? Supervisor Bohn. Hi, Mike.
I remember when Dan and Lane first bought this, his son was riding around out there on his bicycle, jumping in the dunes, and he just got married a few weeks ago. So this project has taken a while. So I think it's going to be a great project, and the housing that's going on out there. So thanks for your perseverance and the harassment you've got from so many people along the way. Good job, Dan.
Thank you. I will say one thing. I do want to just let you know that the sewer plant is up and running and connected to the outfall line, and the first 46 residents have moved into the affordable housing project. We moved them in on Thanksgiving weekend. I mean, thanks to the good work of you guys to, get that project approved and to see that, 10 of those 46 residents that moved in were homeless. And I was there on the first day of move-in day, and to see the families and the impact that project has made was, quite frankly, put a lot of tears in Lane and I's eyes, because we've been working on this since 2001. We spent $4.7 million in studies to date with our different consultants. We started working on this development agreement with Andy Leslie from Remy and Muse in 2011, and it's now being heard in 2020. So I mean, it's been quite a project, but it is actually happening. The water tank, Mercer Fraser poured the slab for the water tank today. So the new 300,000 gallon water tank will be installed by the end of the first quarter, which will eliminate a tremendous amount of headache that John Ford and myself and the local fire out there, Dale Una, has had to deal with. The fire it'll bring a solid fire suppression to the town. So it is moving. It is moving. So I did want to say that. Thank you for the support.
We've got Supervisor Bohn, and then Supervisor Bohn.
I was out at Recology the other day, and I know quite a few of their employees are actually filling out applications to move in as things progress. And I think that's what we were looking for, was putting industry out on the peninsula and those people working, and that warm and fuzzy feeling that everybody will get on this board if they can just walk to work or pick them up in a van and go back home. So
yeah, I think there's 4 of them that have been approved, 4 of those employees out there that'll be moving in.
That's huge. Thanks.
Supervisor Bass.
Thank you, Madam Chair. And along the lines of Supervisor Bohn, I'm really excited to see this tonight. It's worth the long day we've had if we can end it with this. Dan, I was going to tell story about the families you told me that you saw moving in, and I mean, I had tears in my eyes, and I was just hearing it from you, and so it was like it's such a wonderful feeling to see things moving forward, and you put so much work and effort, and and I have to thank Trevor and John Ford. I know they've been working very hard on this. It's just nice to see it come to this place today. So looking forward to getting to vote on it.
I would add one more great thing that you guys could put your hat on is that we our pink slip has been approved for the sale of the homes. So, or the white slip, excuse me. So we're at the point where we can take reservations. We can't really, we have to quote a range of price. Like this house is 200 to 225. We can't get specific, but we can take $500 refundable deposits, and we're in that tentative map phase with you guys right now. We expect to have that recorded in the first quarter. And Mark Burchett, who is Benchmark Realty, has been retained as the company that's working with our existing residents. And 13 of the existing residents have given refundable deposits and qualify. And it is a form of affordable housing. You know, these units are going to be selling for, you know, we're working to sell them like they are so that they can stay affordable, and then the people can put their own tender love and care in the units. And so they're going to be selling from, you know, $150 to, you know, $350 in price. And it's hard to find a place as close to Eureka and Arcata in a special community like this is going to be at that price. So that's another really cool thing that's coming from it. And we just opened it up actually a week ago tonight, and we've already had 13 reservations come in. So I wanted to share that with you as well.
That's great, Dan. That's really, really good news. Did you want to say anything, Mike?
No, I just wanted to thank you for the time and just answer any questions, but I think everybody understands the process here, and the development agreement is really important to the project because it's going to take 10 to 20 years to build out. So we need some certainty in the approval.
Yeah, that's great. Yeah, we've been talking about that for a while. Great. Well, let me open this up for public comment then. Oh, Supervisor Wilson, sorry.
This is great. I just wanted to, you know, acknowledge, well, you know, I was with Dan and Mike in the beginning of this project in terms of like, I mean, you know, discussion and those sorts of things long before I was elected as anything, and you know, had some hand in sort of the analysis of the wastewater issues, and that was back before we even had now an outfall pipe. And so I want to really thank Dan and his whole team for the tenacity and the long range work to really get to this place. You know, from when it was just like these pieces of paper with drawings on them, and there was even like a model over there that people pondered over and all that stuff, and it's really getting into that place where you're right, people are going to be really moving into real homes in a real space, and it's going to grow, and it has that, it's going to have that blossoming feeling to it. I really like that a lot. I want to thank the county too for being supportive of the Harbor District in purchasing and moving forward with the public assets, which created that out, you know, would preserve that outfall. Quite frankly, you know, if we as a community didn't preserve that outfall at a time when it was really tenuous, you know, this project would be, you know, it would be a lot harder because quite frankly, it was a real challenge to figure out where wastewater was going to be, you know, where that disposal was going to occur. And I think, and so it takes a real community effort, and I just appreciate where we're at on this. And I'm hoping that Virginia will make the motion on this as soon as possible.
And through the chair, I thought she'd stop me since we haven't gone to public comment yet.
Exactly what I was going to do. And I love it how Supervisor Wilson can go on and on, but suddenly he wants it done. It's like Supervisor Bohn.
Well, and I don't think Connie Beck and DHHS, both through CalWorks and CWS and everything else, the available units that they've been able to work with Dan and his team to get them out there has been, people say this is some of the housing that we've worked with Dan, funding and everything else to provide these things. So when these things open up, it's a good thing. And I got to clarify that it was Dan's nephew that got married, not his son. I don't want Carter might be a little confused right now. So.
Yeah.
Okay, you guys, we'll go to public comment on this item. And we do have one hand up, and just for anybody who's listening who wants to participate, if you want to give public comment on this item, you can press *9 call the number and then press *9, and we'll put you in the queue. But in the meantime, we do have a very familiar number, 7454, who's already pressed *6. So welcome, Kent.
The main reason I'm calling in, just so Virginia can go ahead and make her motion on this. Congratulations to Mr. Johnson and his crew. I remember back in the day, I think it was Floyd Squires. Dan was bidding on it. There was an engineer, and I think maybe Sunberg's were Truman, Bowman, and Sunberg. And you know, and I learned something, and I kind of an example. Sometimes the best deals you do are the ones you don't do at all. 19 years, and congratulations again. I'm so happy to see it going out the outfall. At one time, it was alleged it wasn't going to be, but my crystal ball said that was a cost to be incurred. I did want to make mention on the sidewalks here, which I did see the one letter, and I know it was partially addressed by staff. And I don't remember, but I people can't believe I'm a developer who loves to put in sidewalks because it protects the children, and that's the main reason, safer out to schools. And it sounds like some places you can't put them in, but one of my main concerns was, I think there was one of the main roads, and at one time they were going to put sidewalks on both sides plus a trail, but they dropped the sidewalk on one side, and I just see a need for these people to move from the existing place to the high ground, and even if it's something that's clear, you know, not a legal sidewalk or something, but I can just see a whole bunch of people during tsunami trying to get to that high ground, and so that always will be a concern of mine. So again, congratulations on that, and of course you did see that that was from the office manager of Peninsula Union School, who wrote the only comment letter there. And did raise that concern regarding sidewalks. I was back there. So if you can throw a few more in there, Dan, maybe that would be a good thing if there's any way. I know the lots are really small, the way I understand, or a lot of them are. And so you don't have that much sidewalk on each street. So thank you for the opportunity to speak. And is this the last one, Estelle?
Yes, it is. It's the very last one.
Thank goodness. Hallelujah. You know, praise the Lord, and off we go. Okay, have a good evening, everybody.
Thank you, Kent. You too. Okay, so on that very collegial note, we'll bring it back to the board. Supervisor Bass. Oh, gotta put your mic on.
Unmute.
I was too excited. Oh my gosh. Okay, I make a motion that we approve staff recommendations 4 through 7, because I think the public hearing is going to get closed anyway.
Second.
Public hearing, okay.
I'm going by the numbers.
Public hearing has been closed, and we have a motion and a second. And thank you to everybody. We'll go to Ryan for a roll call.
Thank you, Chair Fennell. Supervisor Wilson?
Yes.
Supervisor Madrone?
Yes.
Supervisor Bohn?
Please.
Supervisor Bass?
Yes.
And Supervisor Fennell?
Yes.
Thank you. Passes 5-0.
Thank you. Congratulations, everybody. Thank you for hanging in there, not only for those many, many years, but for a long day as well. And thanks a lot, everybody. Good evening.
Have a good night, everybody.
Good night.
Good night.